ಅಂದ್ರೆ ನಮ್ಗೆ
also have a small poster exhibition.
Development.
Over to you, sir.
ಹೇಳಿ. ನಾನು ಕನೆಕ್ಟ್ ಆಗಿದ್ದೀನಿ. ಓಕೆ. ನೀವು ನನಗೆ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಬೇಕು. ನೀವು ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಬೇಕು. ಇಲ್ವಲ್ಲ, ಆಗಿದೆ ಅಂತ. ಓಕೆ. ಕ್ಯಾನ್ ಯು ಹಿಯರ್ ಮೀ? Am I audible? Hello? Hello? ನೀವು ಇನ್ನು ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಎಲ್ಲ ಕೆಲಸ ಮಾಡ್ತಾನೆ ಇದ್ದಿ ಎಲ್ಲ ಕೆಲಸ. ಬಟ್ ದ ಸ್ಟೇಜ್ ಸಮ್ ವರ್ಕ್ ಇಸ್ ಗೋಯಿಂಗ್ ಆನ್. ಕ್ಯಾನ್ ಐ ಕಂಟಿನ್ಯೂ ರೈಟ್ ನೌ? Okay. Dear colleagues, I'm happy to be participating in this cardio yoga event. As part of the inauguration, I declare the event inaugurated and open. Cardio yoga program. I'm very happy that the Department of Ayush has taken this initiative along with the Jaydeva Cardiology Hospital at Mysore to introduce a yoga program for the benefit of individuals who have been affected with cardiological problems. It is noteworthy that as a non-communicable disease, cardiology and cardiological conditions are getting attention in view of the fact that either they are potentially serious, at the same time being chronic. Take, for example, hypertension being a chronic one, and acute myocardial infarction being a very serious one. And we know that cardiological conditions are like any other non-communicable disorders, have multifactorial causation. Although I must admit I am not a specialist in cardiology, lifestyle has been emphasized from time immemorial in cardiological care, exercise, and so on. Yoga has been a very important lifestyle, a spiritual lifestyle in our country, practiced by many people. A good number of them practice it as a well-being promoting measure, and a good number of them practice it as part of a spiritual growth that they want to seek. In either case, there are benefits to physical health by virtue of it influencing also the well-being component of the psychological health, reducing the stress and reducing other subclinical or even clinical levels of psychological distress, which indirectly promote better cardiac health as well, cardiovascular health. So in this regard, bringing yoga as part of a lifestyle change measure which cardiologists promote, and to bring this into awareness, both the Ayush groups and the cardiology groups working together becomes an important step, and this summit hopefully will ensure that this is taken to a logical end in the days to come, and that the benefits of yoga are passed on to those who need this service. So I wish the organizers the very best. On a different note, I want to make a comment which is a research agenda. There are, of course, longitudinal cohort studies of both lifestyle change and the better cardiological performance in terms of various cardiovascular conditions. And there are also some yoga papers which have come out even with long-term outcome being beneficial. However, multi-centric studies on the efficacy of yoga in cardiovascular conditions merit to be demonstrated with very good clinical design, research design. Although this may not be proper to bring it up here, but as part of the Cardio Yoga Summit, where you will be discussing several academic and clinical concerns, the issue of a multicentric study of concurrent yoga into cardiological care requires to be examined. There are 2-3 observations, of course, which I will conclude with, that autonomic effects on cardia are being shown to be different between yoga practitioners and non-yoga practitioners, and within the subjects in a randomized study, heart rate variability has been shown to be increased following the practice of yoga. But there are many other concerns in cardiological disease-related investigations. Have they all been brought under control, changed? Can we see this to happen with a translation to clinical effects as well with the introduction of yoga? I can just quote an example. A person undergoes a cath lab procedure and you find that one of the arteries is blocked or one of the branches is blocked. You would probably take a decision putting a stent, or you may want to advise him to go through a surgery, or maybe manage conservatively depending upon case-to-case basis. When such a thing is there, in those who are undergoing conservative or a stent procedure, would you also be recommending other lifestyle measures? I'm sure you would. And would that be yoga versus a non-yoga multi-center trial? Can that be taken up where a cath lab diagnosis or report is available? The cardiologist prefers to use conservative or stent-related procedures, not necessarily subjecting the individual to or recommending a surgery. In such situations, addition or no addition, can this be compared in a multi-center trial? And can you demonstrate any reversibility, if any, that's going to happen with the practice of yoga? So if such research agenda is also taken up by the group, I'm admitting again that my competence and knowledge and primarily cardiology is limited, but I can only think of a possibility of blending yoga with the modern medicine care in any subject for that matter should depend upon the clinical evidence, the evidence created using very well designed research, and such evidence based clinical application is something that we need to look up and promote. And if that does happen, if it does happen, I'm sure the care of the patient is much more complete, and we would be working together. Essentially, it is leveraging all healthcare supports that are available to promote the best outcome in a given individual. So in this regard, I wish the organizers the very best for conceiving this cardio yoga program as a summit, and I wish them all the best. And I wish all the participants the very best. Uh, I regret that I'm unable to physically join this meeting and be with you, but I'm sure I am a person who is a votary of an integrative approach to healthcare. Thank you very much and wish you good luck. Dhanyavad.
I want voice Today, the biofuel
In my estimation,
Sir, we are
Is it? Yellow. Yeah. What's the cost of commemorates the occasion? So that though that is commemorative stamp. Now definitive stamp is a one that you use on your letters. Like you see, I think we have many personalities. Mahatma Gandhi, Jawaharlal Nehru. Those are definitive stamps. Now my stamp is something that you can customize. You can have your photo next to the Mysore Palace. So that is what we have released here. Sorry, by heart, I am a doctor, but still my department, so I had to clarify that. I am truly humble for giving me this opportunity. I thank the Director. Director Jayadeva cardiology. Presidential speech. Okay. ಇವ್ರಿಗೆ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳಿ. ಅದೇ presidential speech.
Thank you, Angel Raj, for addressing the gathering. Now we have our president.
us and all the faculty members of great pleasure to be with you on this Cardio Yoga Summit. Then by both Department of Ayush and Jayadeva Institute of Cardiovascular Sciences in collaboration. You have all heard of the awareness of yoga is increasing. It is now catching up not only in, though it is originated in India, it is present. Now people are aware of yoga all over the world. Thanks to Prime Minister 2014. So he, in the United Nation Assembly, that yoga should be celebrated International Yoga Day. So there is a overwhelming response, and it's almost more than 10 years. That is yoga. The roots are in India, started for many thousands of years. So it is marked on 21st because 21st of June is supposed to be the longest day in Northern Hemisphere, supposed to be auspicious day. That's how they took 21st June as the day. We all know yoga, actually the meaning of yoga is that means to unite, harmony. So unite your body and mind. So that is whatever movements of the body should be united, synchronized with the mind. That is the basic definition of yoga. Started many years, then it has been popularized by Maharshi Patanjali, though it was there earlier, Swami Vivekananda. There are many people who have been there. Even in Bhagavad Gita, we have seen the importance of yoga. And so then it became as part of Maharshi Patanjali. Yes, put it in a more perspective and sections and different types. He has streamlined that. Afterwards, everybody now the yoga is become a part of our life. We know the definition of health is it is not just the absence of disease, physical ailment. It is both physical mental, social, and now it is a spiritual also. So the yoga says it should be both physical, mental, and spiritual well-being. So you know the theme of yoga of this year, it is self and society. It's a yoga for self and society. So if we are individual is good, if we are good, and definitely we can translate that into a goodness and wellness into the society. I know all the we have very good speakers today who are going to speak on the benefits of yoga, especially with respect to cardiovascular science. The benefits not only in cardiovascular science, all the systems in the body are we get benefits. Do away with yoga. So many conditions, even the recovery, post-operative recovery, can prevent so many diseases. So this is how the benefit of yoga. I think this cardio yoga summit and also Madam IPO through this postal card, you are creating more and more awareness. Because unlike other science, this there is no side effects of any doing this. Anybody can do, all ages, any section of the society, so can do the yoga. There is nothing that it causes any harm to the what we treat allopathy. So we give medicines, you know, it has its own limitations. If we can prevent a disease, nothing like that. Promotion of health and prevention of this disease is possible with yoga. So he was our friend Shekhar was telling. So he is more influenced by the Ayurveda. It is always health is not just one specialty cannot treat most of the diseases. It is the combinations, whether it is homeopathy or allopathy or it is naturopathy. The people say have sympathy for the patient. All pathies can have. That is more important. So we should be empathetic and sympathetic to the society and the sufferings. That is more important. So we need there are some observational data and more and more scientific information is there, but I think even as Dr. V. N. Gangadhar, who is the chairman of National Medical Commission, also referred to, we need more multicentric, well-designed, randomized controlled trials to see how far this yoga can be beneficial. So that is the, I think we have to look at the research papers. I think research wing is active here. I think we have to look at those practical research. So this summit should be beneficial and think should spread message across all the people. I wish this will be useful for most of the people who have come here. I think we'll go away with a good information on yoga. Hope this cardio summit is definitely once see the what we see doing 1 day or 2 days. It should be a continuous process, and do not go with the impression that yoga is a panacea for all. See, we can supplement whatever the treatment you are taking for whatever specialty. It can only supplement, complementary to the existing system. You can cut down the medicines and can better improvement, better recovery. I think yoga should be practiced by most of the people. Even people, even pregnancy people also practice yoga. So there are certain limitations. So you have to get the advice that the way our today we saw that yogic demonstration. You could not believe. I think we always shake our nose. We can flex sometimes. Some connective tissue disorders are there. Then only we can flex the body. Not to the extent they were doing. I think if yoga can be introduced in the Olympic, they would get a gold medal. These people. I think we should think of introducing yoga in the next Olympics. We have seen people who are performing yoga. I think of Dr. Rajkumar, who was very good yogasana and all he was doing. See, there are some lifestyle and meditation and diet can sometimes neutralize the genetic influence. In his family, there are genes which carry risk for cardiovascular disease. All children have cardiovascular problem. Dr. Rajkumar could postpone that to that extent because of his yoga and meditation. The genes can be, the effect of genes on the body can be neutralized by your proper lifestyle, diet, and regular exercise, and now the yoga. I think there are some lot of benefits which we are going to hear. I think I thank all the organizers and Jayadeva branch, Mysore, Dr. K. Sadanand has taken an initiative. We are always doing good work. I think with the collaboration of Ayush department and Lakshana is a very dynamic personality. So I think this summit is I've been now I witnessed a lot of the posters and actually pictorial things. Those who can go around and see. I wish the yoga summit all the success and thanks for calling me and this giving me an opportunity to be with you on this morning. Thank you.
sir.
Good morning, everyone. I feel proud and privileged to have the opportunity to propose the vote of thanks on this important occasion. First and foremost, I would like to express my heartfelt gratitude to Dr. Srinamalu, IFS Commissioner of Ayush. Sir is not only an exceptional officer, but also a distinguished scientist in molecular biology and biotechnology. Sir, your dedication to preservation of wildlife and the environment is truly inspiring, and we are honored to have you with us today, sir. Thank you for your presence. I extend my sincere thanks to Dr. Gangadhar, Chairman of the National Medical Commission, New Delhi, and former Director of NIMANS, Bangalore. We deeply appreciate your support and valuable insights. Thank you, sir. it is my great pleasure to thank our beloved director, Dr. Ravindranath KS, Sri Jayadeva Institute of Cardiovascular Science, and former Vice Chancellor of Rajiv Gandhi University Health Sciences, your encouragement for research and your belief that we should always leave our field richer than we found. It is an inspiration to all of us. Thank you for being an integral part of this event, sir. Thank you. I would also like to extend our gratitude to Dr. Shekhar MA, Vice Chancellor of Adi Chinchirgini University. Your leadership in steering the academic vision of the university is commendable. In spite of your busy schedule, you are here. I know that you have to attend another function. Thank you very much for joining us, sir. A special thanks to Dr. Sadanand KS, Professor and Medical Superintendent. Your continuous support and encouragement in the organizing event, your guidance is invaluable. Thank you, sir. We're also honored to have Dr. Shita Lakshmi, former DME, Government of Karnataka, a key resource person for this event. Thank you, madam, for your presence and contributions. My heartfelt thanks goes to our special guest, Dr. Angel Raj, IPOS Senior Superintendent of Post Office, Mysore, and Dr. Prabhavati Madam, our esteemed speaker, and Dr. Vadiraj, Research Officer. And finally, thank you for your support and involvement. Finally, I would like to thank all the delegates, heads of the department, chairperson, co-chairperson, professor, staff, paramedical staff, nursing officer, medical person, media personnel, security, and Ayush TV. Your participation and efforts have made this event success. Once again, thank you all. Thank you.
So before we end this session, I wanted to thank three persons here. One is Dr. Devara, the research head of Jayadeva Institute of Cardiology, Mysore. I request our director and our commissioner to felicitate him for his great effort of cardio yoga. Devara, sir. Also, the decoration and the selfie point was done by Dr. Shilpalata, the assistant professor, Government Nature Cure College. So we wanted to felicitate her also. And the invitation, brochure, the poster, and all the things was done by none other than Dr. Renuka from Jayadeva Institute of Cardiology. She is the senior research associate here. So we wanted to felicitate her also. So we will have a tea break, and after that we'll start the session. Tea break will be there for only 10 minutes. That's all. So sharp, after 10 minutes, we will start the first session here. And in between, we will have yoga dance, artistic yoga dance, then thematic yoga dance. We are having about 12 dances here in between. And in between, we will try to give the prizes to all the students. 150 students are there. In between, we are arranging the prizes to all of you. Within 1:45, we'll finish our program. No problem. Okay. So we will have a group photo with the nursing students because they have done the poster competition and posters for this today. So please come to the stage. Sir, on the group photo. So it is time for tea break. It's over.
You can sit. You can sit. Sit.
Thank you. I request everyone to be back after 15 minutes of tea break. We'll have a scientific sessions by the resource persons. Thank you, everyone. We'll have sessions by Dr. Vadiraju sir, Dr. Prabhavati ma'am, Dr. Sita Lakshmi ma'am. So I request everyone to be back after 15 minutes.
Next session. They will start with the session.
I request everyone to have tea. Please, everyone to have tea. People, you can go have a tea. You can have biscuits. The two at the last. The one with specs. Please have a tea.
Hello? 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 ಚೆಕ್ ಮಾಡ್ತಾ ಇದೀಯ ನೋಡಿ, ಸೌಂಡ್ ಬರ್ತಾ ಇದೆಯಾ ಈಗ? ಎಕೋ ಬರ್ತೀಯಾ ನೋಡಿ, ಎಕೋ ಇಲ್ಲ ಅಲ್ಲ, ಇಲ್ಲ ಅಲ್ಲ, ಇಲ್ಲ ಅದನ್ನ ಕೊಟ್ಬಿಟ್ವಿ ಆಗ್ಲೇ. ಅಲ್ಲ ನೀವು ಮತ್ತೆ ಕನೆಕ್ಟ್ ಮಾಡಂಗಿತ್ತು ಅಂದ್ರೆ ಅವ್ರು ಮೈಕ್ ಕೊಡ್ತೀವಿ ಅಂತ ಕೇಳ್ತಿದಾರೆ, ಅವ್ರು ಚೆಕ್ ಮಾಡ್ಕೊಬಿಡಿ ಅಂತ ಮತ್ತೆ. ಹಾ
We have a yoga dance performance from the students of Government Nature Care and Yoga Medical College, Mysuru. The students, I request Dr. Shanai sir to welcome Dr. Harish Babu sir, Deputy Director Yoga, Ministry of Ayush. Please sir, please on the stage.
Sir, Harish Babu, sir. Okay.
Welcome you sir. A note to all the students who have the performance in yoga, please hand over all their audios to the engineer section that is in the back side. Your audios, please. Guys, adjust. Okay, then. The whole team has been prepared and the guide was Dr. Bharat Chandra, professor at Government Nature Care and Yoga Medical College. First the auditorium. ಗೊತ್ತಿಲ್ಲ ಅಕ್ಕ ಇನ್ನು ಎಲ್ಲ ಬೇಕಾಗ್ತದೆ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಯಾವ್ದಿದ್ನಾ ನಮ್ ಪೋಡಿಯಂ ಕಷ್ಟ ಅನ್ಸುತ್ತೆ ಮ್ಯಾಮ್ ಇದೆಲ್ಲ ಇದೆ ಮ್ಯಾಮ್ ಸಾಕ ಅಂತ ಸಾಕ್ ಅನ್ಸುತ್ತೆ ಮ್ಯಾಮ್. The whole team has been guided by Dr. Bharat Chandra, Assistant Professor from Government Nature Care and Yoga Medical College, Mysuru. ಕೇಳಿಸ್ತಿಲ್ಲ ಬರೀ ಗಾಳಿ ಕೇಳಿಸ್ತಿಲ್ಲ. ಇಲ್ಲ
जलप्रवाहादितस्तदेकलेवलं व्यलम्बितां भुजङ्गपुष्टमालिकाभक्तमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डमण्डम झरी विलोल बीच वल्लरी विराजमान किशोर चंद्रशेखरे रचित शिक्षणो प्रमोदमान मानसे कृपा कटाक्ष धोरणी दिगंबरे मनो विनोदमेतु वस्तुनि भुजंग पिंगल स्फुरत्मणामणि प्रभात अंब कुंकुम द्रव प्रलिप्त दिग्बधू मुखे मकरंद सिंधुर स्फुरत्व बुद्धिरीयते दुरे मनो विनोदमद्भुतं विधत्मभूत भक्तजी नमः शिवाय धूलि धोरणी चिराय जाय चकोर बंधुषे पंचसायकं नमन्निलिम्बदायकं सुधामयुक्तरेखैर्विभाजमाय शेखरं महाकपालि सम्पदे शिरोजकालम् कराल भाल पंडिका धगत 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 ज्वलत धनंजयाहुति कृत प्रचंड पंचसायके करागरिद्र कुचार चित्र पत्र कल्पना शिल्पिनी त्रिलोचने रतिर्ममा नवीन मेघ मंडली दुर्ग दुर्धर पुरंगूनि सिद्धि तमहत बद्ध कंधर हरि पनिर्जनि धर दुरंगलानि दान बंधुर श्रियं जगद्गुरं धर पंकज प्रपंच कालिम प्रभावलंबिकंठ कंदली रुचि प्रबद्ध कंधरं स्मरच्छिदं पुरच्छिदं भवच्छिदं मखच्छिदं गजच्छिदं धकच्छिदं तमन्तकच्छिदं भजे अखिल सर्व मंगला कलाकदम्ब मंजरी रस प्रवाह माधुरी विजृंभणा मधुव्रतं स्मरान्तकं पुरान्तकं भवान्तकं मखान्तकं गजान्तकान्तकान्तकं तमन्तकान्तकं भजे प्रचंड तांडव शिवा चित्रकल्पयो जंगमो छत्रजो नदिघरत्नलोचयो विपक्ष पक्षयो शारविंद चक्षुषो प्रजामहि महेन्द्रयो नमः प्रभुशिवं भजाम्यहम् सदा शिरस्त्रमञ्जलिन्वहन्ति मन्त्रमुच्चरन् तदा सुखी भवाम्यहम् शिल्पिनी त्रिलोचने रतिर्मम रवीरमेघमण्डली निरुद्ध दुर्धर पुरनिशीलिनी तमः प्रबन्ध बन्ध कन्धर दुरङ्गलानिधानबन्धुरः श्रियं जगद्धुरं पंचकालिम प्रभावलंबिकंठकंदली रुचिप्रबद्धकंधरं स्मरच्छिदं पुरच्छिदं भवच्छिदं मखच्छिदं गजच्छिदं धकच्छिदं तमं प्रकच्छिदं भजे.
Thank you guys. Please be on the stage. Please come. It was a very wonderful performance. I call upon Dr. Harish Babu sir to present a small memento to the students of Government Nature Care and Yoga Medical College. Deputy Director of Yoga from Ministry of Health. Sir. I request Nagraj sir and his team to be on the stage. Rotary West School, Saraswatipuram, Mysore. These students are competition quiz, essay competition conducted on behalf of National Yoga Day 2024. We'll shortly have a scientific session. I request The teacher from T.S. Subbanna Public School, Chamundipeta, Mysuru, along with his team. Please, sir.
Thank you.
First case, Monica S. 10th standard is second. Second place, generally and 10th standard is second. Third place. Ladies and gentlemen, please give them a big round of applause. Subbanna High School, Vidyaranyapuram. The teacher along with him, please be on the dais. Ajit R. 10th standard is secured the first place. Third place goes to Mahadev Swami of 10th. G. Second place goes to Rohit G, 10th standard. And the first place is secured by Ajit R, 10th standard B section. Government High School, Bogari. This event, first place is secured by Rajesh V and shared with Abhishek of 10th standard. Second place by Shiv Prasad M, 9th standard, shared with Mahadev Prasad. Third place goes to 8th standard and Kiran Kumar LC. ಚಪ್ಪಾಳೆಗೆ ದಯವಿಟ್ಟು ಚಪ್ಪಾಳೆ ಒಂದಿಗೆ Next, Arts P Samaja. The first place goes to Satyam in the quiz event, shared with Amrita, standard, Bhavani, Dhanushri, Mahalakshmi, Trish V, Pavan V. Second place shared by Manoj, Anjali, Shreya S. Third place shared by Shailaja, Vandana, and Harshit. One by Shreya S. First place, second place goes to Bhavani P. Third place goes to Trish V. The most awaiting scientific session by Dr. Prabhavati ma'am. Ma'am is going to speak on therapeutic effects of yoga in cardiology. And I request Dr. Devraj sir to introduce Dr. Prabhavati ma'am and the chairperson and the co-chairperson.
Yes, sir.
I welcome you, sir.
Direct, ನೋಡಿ.
I request Dr. Prabhavati ma'am, Dr. Santosh sir, and Dr. Hanumantacharya Joshi sir on the stage. Please, sir.
Hands ಇರ್ಬೇಕು. ಇರ್ಬೇಕು. ಅದ್ರ ಬಗ್ಗೆ ಹಾ ಸರಿ ಫೋನ್ ಮಾಡ್ತೀನಿ ನನಗೆ.
It is my great honor to introduce and welcome our esteemed speaker for today's session, Dr. Prabhavati Madam, Professor of Cardiology, Jayadeva Institute of Cardiovascular Science, with over 40 years of experience in cardiology. Madam has guided numerous DM cardiology postgraduate students and published over 95 research papers in both national and international journals. She has addressed many prestigious national and international forums and the principal investigator for several significant studies, including ongoing studies like yoga-based cardiac rehabilitation in heart failure and yoga care for post-acute myocardial infarction patients funded by ICMR. Madam, dedication and excellence in teaching have earned her the Best Teacher Award from Rajiv Gandhi University, Bangalore, as well as numerous other awards such as Dr. B.C. Roy Award, Adarsh Sevaratna, Nada Chetana, Nashima Prashanti, and Doctor's Day Award from Government of Karnataka Medical Education Department. We are privileged to have her with us today. Please join me in welcoming Dr. Prabhavati Madam to the dais. I have pleasure of introducing our chairperson, Dr. Santosh K.S., Associate Professor Cardiology, Sri Jayadeva Institute of Cardiovascular Science, with over 15 years of experience in cardiology and currently heads Unit C. He has guided many postgraduate students and has contributed to the field with his extensive research published in both national and international journals. Sir has also presented at numerous national and international forums and the principal investigator and co-investigator for many clinical studies, including CSI registry and various investigator-initiated studies. His contribution have been recognized with several awards. Please join me in welcoming Dr. Santosh K. Sir to dais. Finally, I would like to introduce and welcome our co-chair, Dr. Hanumantacharya, Principal of Sharda Vilas, College of Pharmacy, Mysore. Dr. Hanumantacharya is a distinguished academic with over 227 research papers published in national and international journals and has presented his work at numerous conferences worldwide. He holds 3 Indian patents, 1 German patent, and 2 Australian and 1 UK patents, showcasing his innovative contribution to the field. His achievements have been recognized with many awards. Please join me in welcoming Dr. Hanumantacharya, sir. I now request Madam to take over the session. Thank you.
Yes. Good afternoon, everybody. At the outset, I would like to thank Dr. Shanai for giving me this opportunity. I am very happy to be part of this wonderful, vibrant conference. I hope his expectations are not disappointed. How yoga is relevant to me. I have been practicing yoga for more than 22 years. I learned from Vivekananda Yoga Kendra, which was started by Dr. Nagaratna, Dr. Sushil and Dr. Shashank are here from there. Because I was benefited so much, I keep recommending yoga for all our patients, my friends and relatives. We established a yoga department in Jayadeva in 2007, and now we are part of multiple clinical trials in yoga. So today we will discuss briefly about what is our concept about yoga, what are the beneficial effects, and the role of yoga in cardiovascular diseases, which is the topic of today, and what are we doing in Jayadeva about yoga, including some clinical trials. So our previous speakers have already talked about yoga. It's a connection or union between Atma and Paramatma. The balance between the body, mind, and the soul. You people know better than that. It is just not few postures, which many people think. It's a complete way of life. I remember an incident when I was walking with our Infosys Sudhamuti in Lalbagh. She was asking about yoga. Then I said, it's a way of life. It is not just doing some asanas. She got interested and she took some classes from our yoga teacher, Mr. Kulakarni, and she also introduced yoga to some of her family members. So yoga aims at harmonious development of body and mind, leading to physical well-being as well as mental harmony, which finally leads to positive thinking, happiness, and peace. Now we hear about a lot of lifestyle diseases, increase in hypertension, diabetes, heart attacks, all because of change in our lifestyle. Yoga is a holistic way of intense lifestyle modification, which includes stress management, healthy diet, regular physical exercise, and avoidance of tobacco and alcohol, which together can be called as a lifestyle polypill. We talk about polypills, sort of medicines are given for patients with heart disease because there are too many. We try to combine these medicine in one pill. So this yoga acts like a lifestyle polypill. Apart from physical and mental, yoga also influences the emotional feelings. Like it controls the negative emotions like anger, ego, jealousy, hostility, and others. And also it improves the positive emotions like love, gratitude, compassion, and others. Among the yogic disciplines in the Ashtanga Yoga, we practice mostly in the clinical practice asanas, pranayama, and dhyana, apart from yama and niyama. So yoga has been claimed to be beneficial in many conditions. It controls anxiety and depression, leading to mental peace and happiness. It leads to physical fitness, and some psychosomatic disorders like bronchial asthma, irritable bowel syndrome, and joint pains are also controlled. Bronchial asthma, as far as it is concerned, I am an example. I used to get severe attacks of asthma during my student days and even later. With yoga, my bronchial asthma is very well controlled. To joint pains, one of my teachers was advised joint replacement after an MRI. He asked me whether there is any alternate. Then I suggested yoga. He learned some yoga he took some classes from our yoga teacher. And now you don't believe he can walk 5 to 6 kilometers without any pain and without any surgery. So if you practice properly, I think you can get rid of these diseases. So finally, our topic is cardiovascular diseases. Cardiovascular disease includes mostly coronary artery disease, which leads to heart attack, heart failure, various arrhythmias. It also includes stroke like paralysis, peripheral arterial disease, and hypertensive heart disease. So yoga can have a possible role in preventing these
by modifying the risk factors, decreasing the oxidative stress, improving the myocardial ischemia, preventing myocardial infarction, and subsequently arrhythmias and heart failure. So more than 300 million people practice yoga worldwide, and yoga has shown to have a positive effect on cardiovascular risk factors. What are these risk factors? There are some risk factors which may not be able to change, like advancing age, male sex, and family history. But there are many risk factors which are called modifiable risk factors like hypertension, diabetes, obesity, unhealthy diet, physical inactivity, that is sedentary life, smoking, stress. Many people talked about stress in the morning, and the bad cholesterol. All these can be modified by yoga. All of you know what is heart healthy diet. Vegetables, fruits, legumes, and whole grains. But unhealthy food diet is more attractive and irresistible. So coming to the modification of these risk factors, the stress. Nowadays, everybody is stressed. You ask children, anybody, oh, I'm stressed, I'm tense, I'm worried. So yoga has been shown to have a strong evidence that it can reduce stress. It can lead to improvement in cardiovascular risk. How does it act? It alters the neurotransmitters like serotonin, and it decreases the sympathetic activity. So yoga can also influence other cardiovascular risk factors. Like it can decrease the blood pressure, you can have an optimal weight and body mass index. It helps in quitting smoking. It may reduce the bad cholesterol like LDL cholesterol and triglycerides, and it can increase the good cholesterol, that is the HDL cholesterol. It can prevent diabetes. This was shown by Madam Nagaratna Madam in the ADA 2019. So, nearly 3,366 patients with pre-diabetes, HbA1c between 5.7 to 6.49 from 29 states were randomized. Yoga intervention group performed yogic practice for 3 months. At 3 months, yoga group developed diabetes in 11%, whereas control group, it was double, around 22%. So short-term yoga practice can prevent diabetes. That's what was shown by the study. So the heart attack occurs usually because of the atherosclerosis. There is atherosclerotic plaques which occur in the coronary arteries, which can rupture and cause heart attack. So our cardiologist from Delhi, Dr. Manchanda, he has done a lot of work in yoga. He's called Yoga Man. He's done a lot of studies. He has shown regression of atherosclerosis and decrease in progression of atherosclerosis in studies, and also decrease the need for revascularization like angioplasty and bypass surgeries. And also it helped in the secondary prevention after MI. As shown here, you can see the regression of atherosclerosis and decreased progression of atherosclerosis in the yoga group, which was statistically significant. Similarly, there is decreased incidence of revascularization procedure in the yoga group. So we need evidence now. So we have a lot of evidence even in heart failure. Yoga, few control trials showed that 12 weeks of yoga practice improved LV ejection fraction, quality of life, and decrease in inflammatory markers. So now we have an ongoing yoga care heart failure trial, which is a large trial, and it is done funded by ICMR, which I'll be talking a little later. So even yoga has been shown to reduce arrhythmias. Atrial fibrillation is the most common arrhythmia seen in patients with heart disease. Yoga has shown to reduce symptomatic episodes of atrial fibrillation. And yoga-based cardiac rehabilitation also was shown to be beneficial in patients with coronary artery bypass surgery. A study of 250 patients, post-CABG patients followed for 1 year, yoga group had significantly better improvement in ejection fraction, blood glucose, and lipids. There is an excellent compliance with yogic practices. Only we have to convince them that it's going to benefit them. And there are no side effects. This was published in Indian Heart Journal in 2014. So how yoga helps in this? There are a lot of research going on. Dr. Shekhar was mentioning about Dr. Ornish. Yoga may reduce inflammatory markers as shown by decrease in lot of inflammatory markers and improve in the endothelial function. Yoga may also reduce oxidative stress, which leads to atherosclerotic plaques. And Dr. Ornish has shown that yoga may affect gene expression, the turning on disease preventing genes and turning off the genes which cause heart disease. It may also increase telomerase enzyme. You know, the aging is because of the telomerase length decreases. So yoga is supposed to increase the length of the telomeres. So all these were demonstrated by research activities in various scientists. So as of now, we have some limitations because we need evidence for everything now. So most of the studies in yoga are single center, small sample size, and no uniform methodologies. We do not have randomized control trials. We do not have long follow-ups, and the outcome studies are lacking. So we need large multi-center studies, which are planned by disease for chronic disease control. And now, what are we doing about yoga in Jayadeva? So the Department of Yoga was started in 2007 with the support of Dr. R. Nagaratna, who was a physician. And now she is the Chief of Medical Director, Arogyadama Prashanti Kutiram, S. Vyasa University. She used to visit our institute frequently, and she used to give speeches. She used to tell us the benefits of yoga. And eventually, she even sent one yoga therapist. And Dr. Manjunath, our then director, also supported a lot for this bringing out the yoga department. We had one yoga therapist till 2021. Now, at present, we have 2 yoga therapists. They're very active, enthusiastic, and they create awareness of yoga and its benefits, not only among the patients, among the staffs, among the students. And there is a progressive increase in the people who are taking yoga classes and practicing it. And in 2021, we have started a cardiac rehabilitation program for heart disease with yoga. The health checkups and heart health education was provided for various government departments like BMTC, KSRTC, Police Department, and Karnataka State Mineral Corporation staff, along with even senior citizens. So yoga therapy classes are conducted daily for patients, students, and staff, and all these government staffs. So these are the examples of yoga class taken for Police Department staff, BMTC and KSRTC staffs, and patients, students, and staff. And they also celebrate International Yoga Day as per NMC guidelines. Our Hussainaya is here. He is very enthusiastic. He is very much interested in teaching yoga to everybody. And Naturopathy Day, they also do some extracurricular activities like sports yoga, yoga music, and so on. So finally, what are the clinical trials in yoga we are participating? The first trial was by our Srihari. He is a part of his thesis, Integrated Yoga Practice in Cardiac Rehabilitation Program, a randomized control trial. It was published in the Journal of Alternative and Complementary Medicine. I was the co-guide for his thesis. Patients with recent myocardial infarction with the ejection fraction between 30 to 50% were enrolled for this study. It was a small group, but it was randomized to groups, 33 patients in each group. The yoga group received 1 hour supervised yoga comprising of asanas, pranayama, and relaxation techniques. This was going on for thrice a week for 12 weeks, along with the standard pharmacologic therapy, of course. His result was, it was feasible and safe because post-MI, people are scared to do these asanas, but it is found to be safe. It was beneficial in reducing the depression and anxiety among these patients, and there was improvement in quality of life. Because it was a small group, no benefit of improving cardiac function was detected. So then came the yoga-based cardiac rehabilitation after acute MI. This was done by Center for Chronic Disease Control. Before going to the study proper, we will find out why do you need rehabilitation after acute MI? What happens after acute MI or a heart attack? There is a chance of second heart attack. Heart rhythm abnormalities. Patient can have sudden cardiac death. It may lead to heart failure, uncontrolled heart failure, stroke. So a lot of mental issues like psychological issues, depression, anxiety, and work issues. They may not be able to go back to their work. So all these issues to be addressed in a patient with heart attack. So in Western countries, they established a standard of, they established a cardiac rehabilitation, and this is a standard of care after MI. This is a class 1 recommendation by European guidelines, American guidelines. This is a complex intervention which involves exercise training, stress management, psychosocial support, and secondary prevention. And it is shown to be beneficial in improving the quality of life, cardiovascular morbidity, and their functioning. So what Yoga Care group did was, they designed a yoga care program more or less similar to the British Association of Cardiovascular Prevention and Rehabilitation, cardiac rehabilitation program. So then the yoga care trial was started. It's a randomized trial. It is the principal investigator is Dr. Prabhakaran Dorairaj. He is a cardiologist, and now he's executive director for the Center for Chronic Disease Control. What was the background of this? Because in Western countries, we have this cardiac rehabilitation program that is hardly heard in India. There is shortage. And even worldwide, there's a poor uptake because it's quite expensive. So we need an alternative models for this cardiac rehabilitation, which is inexpensive and everybody can reach out. So this is the largest yoga trial in the world, yoga care trial. It's after acute MI, within 14 days, the yoga was introduced into these patients. 24 medical centers across India, nearly 4,000 patients with acute MI were enrolled, and median follow-up was for 22 months. So among the top clinical sites, our Jayadeva Bangalore and Jayadeva Mysore was in the 4th and 5th position. Yeah. So it was a complete lifestyle package for the patients with post-MI. Right diet, avoidance of tobacco, avoidance of alcohol, stress relief with meditation, various physical postures, pranayama. This was randomized trial. One group, there's a yoga care group, received yoga, whereas enhanced standard care, they were advised about the good, healthy life. So yoga care program lasted for 75 minutes, involved gentle yogic exercises like yogic poses, breath control, meditation, relaxation practices like this. There are 15 postures, 5 breathing techniques, 5 meditative techniques. This was planned, consulting many people in many fields. And the result was, it was safe and feasible. Yoga care improved self-rated health, that is quality of life was improved. The return to pre-infarct activities after acute MI was better in the yoga care group, though there was statistical power to show a difference in MACE was lacking, as shown in this. This was presented in American Heart Association meeting in 2018 in Chicago. Both me and Sadanand were invited for this, but we could not go somehow. And this was eventually published in the Journal of American College of Cardiology in April 2020. It's a prestigious journal. And Dr. Valentin Future, who is the editor of this, and a world famous cardiologist, he has a book in his name called Heart and Heart. So he commented that this study is not only relevant to India, but to the US as well. So, and he advocated yoga for survivors of heart attack. So this is a big boost to yoga. And we started another study now, yoga-based cardiac rehabilitation in heart failure. Again, from Center for Chronic Disease Control, and this is funded by ICMR. So this it's an ongoing trial now. 3,500 heart failure patients are supposed to be enrolled across 15 cardiac centers. Randomization 1:1 to yoga care, heart failure intervention, and enhanced standard care. It was started in last May. We started somewhere in September. Already 843 patients are enrolled. Together, Jayadeva, Bangalore, and Mysore, we have contributed to 244 patients. And 2 days back, we had a investigator meet. And I'm proud to say that Jayadeva, Bangalore, and Jayadeva, Mysore are the top performers in this. The result will be somewhere in next year meet. I'm sure it will have some positive effect. So these are the yoga sessions conducted in our department and yoga and virtual sessions. So in future, the extension of yoga care to other conditions like post-cardiac surgery and pulmonary hypertension are also planned. And we are planning a yoga care rehabilitation along with our Dr. Sushil and Dr. Shashank in Prashanti Kutira, that is Vivekananda Yoga Center. So to conclude, yoga appears extremely promising for primary and secondary prevention of heart diseases. The biggest challenge is acceptability and sustainability. It's very difficult to convince them. They will initially accept and again then stop. It's difficult to continue yoga for life, which should be done. In spite of several limitations, yoga should be incorporated as a complementary technique for prevention of heart diseases because it is simple, safe, and effective, cost-effective, that is cheap. So I thank our yoga therapists, Husainaya and our Kulakarni. Kulakarni was the first yoga therapist, started his work in journey in 2007, and he is popularized yoga in our institute for patients and staffs, everybody. Then 2021, Husainaya joined. So I also thank our research team for doing wonderful job. Even the Mysore team, Dr. Devraj and his team. I do not have their photos. I thank everybody. And thanks everyone. And thank Dr. Shanai for giving me this opportunity. Please take care of your heart with yoga because it will be beating till we breathe last. Thank you very much.
Thanks a lot, madam. It was a wonderful presentation. Madam has trained a lot of cardiologists, including majority of us. It was an opportunity to listen to her. When we talk about managing a disease, we talk about prevention, treatment, and rehabilitation. Madam told us how this yoga can play a part in all the three. When patient come to us, we prescribe the medication. We tell them, control your anxiety, stress, and modify lifestyle. But we don't exactly tell them what exactly to be done. I think if we can train them in yoga or make them practice yoga, I think all these things, modification lifestyle, diet, exercise, everything will be taken care. And I think the patient will be having a very good improvement in their disease. I think it's overall, as Madam told, with the supportive evidence, yoga plays a crucial role in modifying a lifestyle, modifying a pathophysiology in the disease, and rehabilitating the individual to give a best outcome in a given patient. I'd like to give mic to my
please. Before I sum it up, if there are any questions among the audience, it's welcome. We can take few questions if you have any questions in mind. Fine then. I'm a person from pharmacy background. It was very wonderful to see your presentations, madam. First of all, compliments to you. You're doing a wonderful, thing for society. I have two questions in mind. He has already summed it up. Because of whenever we talk about, the cardiac failure and cardiac issues, normally people jump up. So I have one question in mind. See, actually, when a person should start practicing yoga to have a proper cardiac protection? The primary prevention, for example, definitely you are conducting, yoga sessions and all for mainly for patients. See, maybe it may be in the general person's mind. When they should, what is the age to start to have a proper cardiac protection?
It should be as early as possible because atherosclerosis can start in younger age itself. So it's better we start it in childhood itself.
And I like that one sentence you mentioned. That is, it's a lifestyle polypill yoga. It's really nice. And I have, according to your data, what you have collected, which asanas are preferable for a proper cardiac protection? Could you find some asanas which are really? Yes. We will share it. Beautiful. Thank you so much. And thanks to Shadai and the group for the opportunity. And what I feel, madam, I think the awareness should reach, the other society also. Because, being people in Mysore, we are not having such a wonderful work is going on. Published in wonderful international journals. And once again, compliments to Jaydev Institute of Cardiology and the organizers. Thank you.
Thank you for Prabhavati madam for the nice presentation about yoga-based cardiac rehabilitation. And also would like to thank Santosh sir for sharing his view on lifestyle changes. And thank you, sir, Dr. Hanumantachar. Thank you all.
I request, I call upon Dr. Anil Kumar sir to felicitate Dr. Prabhavati ma'am. Anil Kumar sir, please on the dais.
Shobha madam from Shobha ಮತ್ತು ದತ್ತಾತ್ರೇಯ ಇವರಿಗೆ ಸಂತೋಷ.
I request Shobha ma'am and Dr. Dattatri sir to felicitate Dr. Santosh sir. Please on the stage, sir.
ದತ್ತಾತ್ ಸರ್ ಬನ್ನಿ. We want to give a moment to collect it. Gayatri madam, bye. Madam, ನೀವೇ ಕೊಡ್ತೀರಿ.
Thank you.
Next session, Vadraj.
Next session.
ಯಾರು ವಾದ್ರಾಜ್ ನೀವು ಸ್ವಲ್ಪ ಯಾರು ವಾದ್ರಾಜ್ ವಾದ್ರಾಜ್ ಸರ್
Thank you, sir. Thank you, ma'am. Now we have one more scientific session. It will shortly start. I request students from Government Nature Care and Yoga Medical College to introduce Dr. Vadiraju, sir, and the chairperson and the co-chairperson.
Good afternoon, everyone. It is my distinct honor and pleasure to introduce our esteemed guest, Dr. Vadiraju HS, sir. Dr. Vadiraju HS, sir, holds a PhD from the prestigious Swami Vivekananda Yoga Anusandhana Samsthana University in Bangalore, where he was awarded the Srimati Manonmani Rudraya Award for the best thesis in 2011. He also holds a Bachelor of Naturopathy and Yogic Sciences degree from SDM College of Naturopathy and Yogic Sciences, Ujire. Additionally, a postgraduate diploma in bioethics. Dr. Vadiraju HS, sir, has an extensive experience in research and leadership roles. Currently, he serves as the research officer in the Central Research Institute of Yoga and Naturopathy, the Central Research Institute for Yoga and Naturopathy, Nagamangla, a unit of CCRYN, Ministry of Ayush. He has been with CCRYN since March 2023. He also made significant contributions as senior lecturer and senior scientist in the Department of Yoga and Life Sciences at Swami Vivekananda Yoga Anusandhana Samsthana, where he taught the postgraduate and graduate students. His research on the role of yoga in modulatory salivary cortisol levels has been highly regarded in academic circles. He has more than 20 research publications and one international book chapter. He is also the author of many CCRYN publications and compiled more than 6 research monographs of CCRYN. With such an impressive background and commitment to the advancing practice and understanding of yoga and naturopathy, we are incredibly fortunate to have him with us today. Welcome, sir.
From you, sir. And I also request Dr. Rajit, sir, and Dr. Shivaram, sir, to be on the Dr. Shamsundar, sir, to be on the stage as chair and co-chairperson. Dr. Rajit, sir, and Shamsundar, sir. Please, sir. And I call upon Sona to introduce Dr. Rajit, sir.
Through cardio yoga, the heart finds rhythm, the body finds balance, and the mind finds peace. A very good afternoon, one and all present here. Myself, Sona. I'm here to introduce a splendid person, Dr. Rajit K.S., MBBS, MD General Medicine, Doctorate of Medicine in Cardiology. He is currently working as Associate Professor and D Unit Chief in Sri Jayadeva Institute of Cardiovascular Science and Research, Mysore, from September 2020. Also, he is working as Associate Professor and in charge of Non-Invasive Cardiology from December 2019. And sir has even worked as Assistant Professor Cardiology in Sri Jayadeva Institute from November 2011 to May 2016. And also has a Senior Resident Cardiology in Sri Jayadeva Institute from May 2011 to November 2011. Coming his work and research experience, he has an extensive experience in coronary angiograms, angioplasty, pacemakers, balloon valvotomy, and device closures. Involved in postgraduate teaching and clinical research, including trials and anti-XA inhibitors, stem cell therapy, and MAPK inhibitors. And also he has active in teaching Doctorate of Medicine Cardiology resident, previously taught at Bhagavan Mahavir Jain Heart Center, Institute of Nephrology and Kasturba Medical College. Coming to his publications and presentations, relation between left atrial size and atrial fibrillation in rheumatic heart disease, Journal of Medical Science and Clinical Research. Coronary artery disease risk factor factors distribution in cities, urban and rural Karnataka. Journal of Preventive Cardiology. Ethiopathological factors and management of facial palsy, Asian Pacific Journal of Health Science. Relation between left atrial signs and atrial fibrillation in different diseases, Journal of Evolution of Medical and Dental Science. He has been awarded with Best Challenging Case CSI NIC 2017 at New Delhi and Challenging Case Presentation TCT 2018 San Diego at USA. At last, I would like to conclude by saying, as we look towards the future of health and wellness, it's clear that integration holistic practices like yoga with traditional medicine offers a promising path to overall well-being. Thank you for the opportunity. It's a huge pleasure introducing you, sir. Thank you.
Thank you, Sona, for letting us know about the unit chief of our Jadeva Hospital, Mysuru, Dr. Rajit sir. And now we'll have Dr. Ankush to introduce Dr. Shamsundar sir. Please, Ankush on the stage.
A very good afternoon to everyone present over here. Myself, Ankush Gowda HD, student of Government Nature Cure and Yoga Medical College. Hereby having the golden opportunity to welcome Dr. N.M. Shamsundar sir in this wonderful occasion. Dr. N.M. Shamsundar sir, who serves as JSS HOD in Anatomy Department, and he is also helping in anatomy and plastination, who established Anatomy Museum in the first time in the world in Mysuru. He is also known as 10 rupees doctor and has published the article in the newspapers. He has lots of awards. He has won lots of awards, and also he has Master of Plastination. He is known as Master of Plastination, who plastinates many organs and also helped in the Anatomy Museum establishment in Government Nature Cure and Yoga Medical College. Also in his house, he has served very models for students so that they can get to know how the real organs could be there. They can touch and feel it so that they can get you extra knowledges. Yes, sir. Exactly. If I start now to say the awards and all the establishments of Shamsundar sir, then it will become evening, I guess. So there will be no time for other programs. So let us end here by saying that Shamsundar sir, thank you for being here, sir.
We are so honored to have the greatest eminent guest. Now over to Dr. Vadiraj sir.
Good afternoon to one and all. Thank you very much for introducing me to the gathering. Respected chairpersons. First of all, I would like to thank Karnataka Ayurveda Research Organization and Sri Jayadeva Institute of Cardiovascular Sciences and Research for inviting me to deliver my talk. The topic given to me is the research updates in yoga and cardiology. So let's try to understand. The madam has already briefly explained the research activities and some of the research findings. So let's try to explore more. What are the evidences which are available? Whether these evidences are enough or sufficient to implement these in the clinical practice, or what else is needed further to do to introduce this into the clinical practice. So in the morning in the inauguration session, everybody were talking about the non-communicable disease. We all know that the non-communicable disease incidents are increasing every year, and they are recognized as the top 5 killers. And they are chronic stress and lifestyle related.
So there's no set, a factor for causation. It's a chronic stress and lifestyle complete related disease, and wherein there is a role for prevention, management, as well as rehabilitation. So, and the India is becoming the leader of these things, and India is facing both the challenges of developed as well as developing countries, because it is believed that the communicable disease are the most problematic things in the developing countries, but India is crossing that. India as a developing country facing both communicable as well as non-communicable disease burden. That's why India is going to become the capital of non-insulin dependent diabetes, malaise, and CAD. And if you look at the incidences, the incidence of these chronic disease or the non-communicable disease is increasing. And by 2030, it is expected to increase to a larger extent. So what yoga is then? So we all know that yoga is an ancient Indian system of philosophy and practice. It's not just the practice, it do have certain philosophical principles. Without adopting these philosophical principles, just practicing yoga, there's nothing going to happen. So everybody are talking yoga is not just a practice. Yes, of course, it's a way of life, incorporating healthy lifestyle practices and physical practices which improve overall fitness. So we all know the definitions of yoga. As I say, it's just not a single practice. Yoga is not just a single practice. It's a culmination of many practices. Whatever in the morning, the director of Ayush was speaking about. It's many practices, asanas, pranayama, meditation, relaxation techniques, kriyas, yama, niyama, so on and so forth. All these things put together, that is called yuj. Yujyate inenati yoga. So to calm down the mind, that is called the prashamana in yoga science. So as Madam also was telling that it's not just a practice, it's a complete lifestyle package. It talks about the diet, it talks about the physical activity, it talks about the calming down the mind, pranayama practices, concentration, meditation, so on and so forth. So it's a complete lifestyle package. When it comes to the role of yoga in cardiovascular diseases, it can be studied under two headings: the role of yoga in primary prevention and the role of yoga in the secondary prevention. What is this primary prevention? Yes, the main goal of yoga here is to preventing the incidence of cardiovascular disease in the population who are already having the risk factors. The risk factors such as Madam has already explained: hypertension, diabetes, hypercholesterolemia, and the obesity. Whereas in the secondary prevention, those who have already developed the cardiovascular disease, in them trying to reduce the adverse cardiovascular events and to improve the quality of life. In already established CVDs like atherosclerotic diseases, Madam had explained, coronary artery disease, and peripheral vascular disease, arrhythmias, heart failure, so on and so forth. So if you look at this lifestyle disease and its causation, the main three factors, everybody talks about these three factors which are responsible for all these non-communicable diseases. They are the physical inactivity, the hypernutrition, and the psychological stress. So anything non-communicable disease, if we take, these are the main three risk factors, and the mind plays a major role in all these things. And yoga has a main role to control this mind. Hence, yoga can able to tackle all these three factors. Again, when it comes to the risk factors for CAD, it can be classified into behavioral risk factors and the physiological risk factors. And behavioral risk factors like poor diet, lack of physical activity, lack of sleep hygiene, all these things were stressed in the morning in the inaugural function. And the same physiological risk factors are hypertension, diabetes, metabolic syndrome, obesity, so on and so forth. Is there any role of yoga in modifying these things? So how yoga works? Generally, yoga, its mechanism is attributed to the genetic stability. This was again discussing in the morning, and Madam also has stressed on that, upregulating and the downregulation of the genetic expressions. and then by reducing the inflammation, by reducing the pro-inflammatory cytokines, the neurotransmitters, and also the neuroendocrine pathways by bringing down the hyperactivity of hypothalamic-pituitary adrenal axis activity. So if studies have shown in yoga in hypertension especially, the role of mechanism is mainly by reducing the sympathetic tone, where psychological stress has known to increase this sympathetic overactivity and to reduce this parasympathetic tone. So whereas yoga is known to decrease the sympathetic hyperactivity and to increase this vagal tone or the parasympathetic tone, and also to reduce this hypothalamic pituitary adrenal axis overactivity. And also yoga is known to increase this GABA activity. And these are the main mechanisms behind which yoga helps in hypertension. Are there any data to substantiate this? Look at the literature. The first study on the clinical report in hypertension was reported by K.K. Date in 1969, and wherein they have recruited 47 hypertensive patients and pre-post study design, and 40 weeks of yoga intervention was given, and the result showed 27 mmHg of reduction in patients who are taking no drugs, and reduction in medication requirement in patients those who are on drugs, and 35 patients reported either reduction in BP or reduction in drugs. And the first RCT was published by Chandra Patel in 1975, which was published in Lancet, wherein it was a randomized control trial on 34 hypertensive patients. And the intervention was given a twice a week session for 6 weeks. And the control was given just the relaxation, general relaxation. And there they also showed 18 mmHg reduction in systolic blood pressure and 11 mmHg in the diastolic blood pressure. More than that, a meta-analysis study was published by Kramer in 2016. And even there also they have shown a substantial reduction in systolic blood pressure and diastolic blood pressure in both pre-hypertensive patients as well as hypertensive patients, though the heterogeneity was very high in the study. When it comes to the second, another risk factor, that's the diabetes mellitus. And the Ines and Self in 2016, they have given a mechanistic mechanism how yoga could be able to help in reducing or preventing this diabetes mellitus. They mainly hypothesized 4 pathways. The first 2 pathways already explained, that's reducing the sympathetic hyperreactivity. And the second pathway is by increasing the vagal tone or the parasympathetic tone. And another pathway is by improving the physical activity. And another pathway is by altering the neurotransmitters or by reducing the pro-inflammatory cytokines, thereby bringing change in the psychological level and also improving the sleep hygiene. All these things put together help in reducing insulin resistance and bringing down the sugar level down. When it comes to the data, Chen, yes, in 2022 has published an meta-analysis wherein he has analyzed 13 randomized controlled trials published all over the world. Total sample size of 1,335 participants, ranging from 40 in one study to 300 in another study. Age is 41.3 to 63.8 years, and duration of follow-up 10 weeks to 24 weeks. And the delivery of training is mostly 60 minutes, twice a week sessions, and mostly used asana, pranayama, and meditation practices. To look at the data, the 7 RCTs studied on 927 participants showed a significant reduction in glycosylated hemoglobin percentage. And even fasting blood glucose on 11 studies on 1130 participants also showed a significant reduction. Postprandial blood glucose also significantly reduced. And even the triglycerides also reduced significantly following yoga intervention compared to the control group, but did not show any change in the total cholesterol level. If you look at the problems in these studies is the heterogeneity. So that means the duration of yoga is different, the selection of patients are different, so on and so forth, reasons because of which though it has shown a significant result, Still, it cannot be implemented to the clinical practice because of high heterogeneity. The other risk factor is the hypercholesterolemia or the lipid profile. Again, another meta-analysis published in 2022, where they have analyzed 53 randomized control trials, total sample size of 13,000 hard participants, 18 to 70 years age group. And out of 53 RCTs, 36 RCTs were published from India, 6 from US, 3 from China. These RTC include 40 RCTs included both genders, 7 on only women and 6 are only on men. And in study population, 11 on healthy volunteers, 19 on diabetes, 10 on metabolic syndrome, 5 on heart disease, and 4 on hypertension diseases. Even here also, the studies have clearly shown significant decrease in the cholesterol level, LDL. Then the HDL cholesterol also significantly increased, and triglycerides were significantly decreased, and even VLDL also has decreased significantly. Again, though the meta-analysis, all these RCTs have shown a significant improvement, yet the meta-analysis shows high heterogeneity. The other main risk factor is the obesity, and the meta-analysis published in 2023 collected 15 RCTs and the 60 clinical trials, and total 1,161 population, between 18 to 70 years of age range. And it is studied in high income group as well as in the mid income group countries, 6 in high income population and 9 on mid income population. 10 are studied in the university setting, 2 are in the research centers, and 2 in the yoga wellness centers. Only 2 studies in special population, that is breast cancer survivors and obesity with psychological issues. See here, only a study showed a significant decrease in the waist circumference, whereas body weight and the body mass index did not show any change. Though the individual studies would have produced a significant difference, but when it is allotted for meta-analysis, it did not show changes. So this is about yoga prevention in the primary prevention. And now if we come to the secondary prevention, that means reducing any cardiovascular events and improving the quality of health in already diagnosed patients. So there's one more meta-analysis which is published in 2021, which included 6 randomized controls. Most of them are published from India only. There's only 1 from UK. Total sample size of 4,471 participants. Age reported 51 to 60.7 years. Total duration of follow-up in all these studies range from 14 weeks to 1 year. And yoga intervention is important mostly as 30 minutes package to 75 minutes package, once to 14 sessions per week. They also included mostly asana, pranayama, and meditation. The limitations of all these studies, as Madam also explains, many studies are only small sample size, a smaller duration of follow-up, very few studies on clinical endpoints, mostly intermediary outcomes with wider confidence interval and poor reporting. So summary of these outcomes. So they have mainly studied the all-cause mortality. 4 RCTs studied this all-cause mortality. Though it was less in the yoga group, but it did not show any significant change. So there was no change between the 2 groups. When it comes to health-related quality of life, yes, yoga has shown a significant improvement in the health quality of life following yoga interventions compared to the control group. And the composite cardiovascular outcome, though there is a 37% reduction in the yoga group, but once again, it did not show any significant change between the 2 groups. And systolic blood pressure and diastolic blood pressure showed a significant reduction. Comes to the other risk factors like total cholesterol, it did not show any significant change. LDL did not show any significant change. HDL also did not show any significant change. Triglycerides showed a significant reduction, and the body weight and the body mass index showed a significant reduction in yoga group compared to the control group. So this is how yoga has shown to play a role both in primary prevention as well as the secondary prevention. How does yoga work is, as we're all talking about this, yoga is not just a practice. Yoga is to increase the awareness. So having awareness at every moment, whatever we are doing, practicing with awareness only can able to bring a change. So as we go on practice from the gross practices to the subtler practice, these awarenesses are going to increase. Thereby it is going to bring a calmness in the mind and the stress can be reduced substantially. So as this also Madam had already explained, only the cardiac rehabilitation program has shown a significant role to play in cardiovascular disease. But the cardiac rehabilitation is not just a simple thing to adopt. It's very costly and expensive and time consuming because it has all the components: exercise training, the nutrition counseling, weight management, blood pressure management, lipid management. Means they should have a multiple team: psychiatrist, nutritionist, cardiologist, physician, so on and so forth. Whereas the yoga also has the same role. The yoga and naturopathy physicians, we also have replacement to the physical activity, the asanas. The yogic asanas are known to have mild to moderate activity. It's not a severe exercise pattern. It comes under the category of mild to moderate physical activity. And yoga also talks about the diet management, the sattvic diet management. And yoga is known to, as already explained, yoga is known to reduce blood pressure. Yoga is known to bring a favorable change in the lipid management. Sugar, it's going to definitely control the diabetes, so on and so forth. So the same cardiac rehabilitation, similarly, the yoga care also can have a similar rehabilitation program. So ultimately, this is how role of yoga in cardiovascular disease. First, it explained the mechanism mainly. It influences on the neuroendocrine axis. It reduces the hypothalamo-pituitary adrenal overreactivity and the autonomic nervous system, mainly reducing the sympathetic activity and increasing the vagal tone. It helps to reduce the inflammatory pathway, and it helps reduce the oxidative stress and brings a gene stability. And also it improves the endothelial function and reduces the peripheral stiffness, arterial stiffness, thereby bringing a change in the subclinical or the clinical outcomes as evidenced by reduced blood pressure, reduced blood cholesterol level, reversal or remission of atherosclerosis, reduction in arrhythmias, so on and so forth, leading to improvement in the clinical or patient-related endpoints as are established by reduction in intensity of angina or anginal episodes, improvement in the quality of life, symptom severity, anxiety, depression, and exercise testing. So this is the till now the research update on yoga in cardiovascular disease. So yet we have to overcome many barriers and many limitations. So we have to overcome all these limitations and barriers, and we have to do a large multicentric randomized control trials to bring yoga intervention logically into the clinical practice in the management of cardiovascular disease. Thank you once again. Thanks for giving me opportunity to present my ideas. Thank you.
Just asanas, just breathing exercise, connecting mind to the body. Whereas other westernized physical exertion like gym and all, it is not physical. There is no mind action in that. So yoga is superior compared to that. All round for the body.
So yoga, as per the data shown by Dr. Varadarajan, it has shown excellent results in risk factor for cardiovascular diseases. As all of you know, cardiovascular disease is #1 killer disease all over the world. So there is a lot of scope for yoga in this cardiovascular disease, which has shown excellent reduction in hypertension, diabetes, and dyslipidemia. This is mainly, and also in arrhythmias, mainly due to increase in parasympathetic activity and reduction in sympathetic activity, which will lead to hypertension and arrhythmias. So, and also, which are the asanas, common asanas we can use in these patients, hypertension and diabetes. That's what we wanted to know. Another aspect is this, sir has touched mainly on primary prevention and secondary prevention. I think another primordial prevention, that is before the onset of risk factors. I think we should concentrate more on that, and we should educate our students, school health education program, all these things. I think it will help in that. Now I will hand over my mic to co-chair.
Sir has asked one question. What are the yoga practices one can practice? That's how we have, Madam was telling the 2 research projects which are conducted. One has completed and one is under progress in a large multicentric trial, one on cardiac care. That's immediately after myocardial infarction, a follow-up of 1 year, and wherein we have developed a comprehensive yoga module, sir. Very simple to adopt, very simple yogic practices like Ardha Kati Chakrasana, Ardha Chakrasana. We have avoided all forward bending or the asanas which can increase the blood circulation towards the head and neck region. So it's very simple yogic practices one can adopt. More than yogic asanas, it's better to change the way of life completely, the way we behave, the way we are eating, or is it that the way we are the time or the frequency with which we are eating is right or not. So that thing we have to inculcate in ourselves, and then we can slowly bring a changes in entire thing. And probably that yoga module, if you go through, sir, it's very simple and it's very easy to adopt, sir.
Let me thank Dr. Vadiraj for the nice presentation and the research opportunities available for this. Only 1 minute I'll take. I should be grateful to both the big institutions for doing a wonderful work. Most of the time we see allopathy people having the conferences. We have the cardiology, neurology and all that. Or maybe Ayurveda and other medicines having their own conference. Maybe occasionally we have the conference or the summit which involves 2, because the patient doesn't have any specific field, nor the disease has any specific field. It's only our approach. It's a wonderful thing that both the fields are involved in solving the problem of the patient and preventing the problem of the patient. Second thing I would like to put it on the later side, one of my colleagues said absolutely no hypertension, no diabetes, I was slim, no obesity, everything is fine. And when I go home, all the things increase. I'm not telling the gender. So is there any need for a family type of a yoga practice so that both of them are in the minimum stress? Because stress could be the other partner also. So with that, thank you very much for giving the opportunity to be here in this session. And incidentally, I'm purely a allopathy fellow, having done my MBBS and MS anatomy. Recently, since about 10 years, I'm teaching anatomy and applied anatomy to a few centers in Mysore who practice yoga and those who come from abroad to learn the teaching methods of yoga. It's a wonderful combination of allopathy in the Ayurveda and yogic sciences. I wish, being a wonderful country, having the largest population in the world, we should be the example for the whole world to maintain a good health, because body and mind are together, and we should be able to teach the whole world yoga is Indian and yoga practice is going to be the healthy practice. Thank you very much.
So thank you very much, sir. So with that intention only, the Ministry of Ayush in this yoga day, they have organized one contest, video contest with the theme Yoga for Family. Yes, sir. Thank you very much. That's the needed, sir. Thank you very much.
I request Dr. Guru Basaraj sir to felicitate Dr. Vadiraj sir.
Over the city, wherever we go, we see things with so much this one. Whereas the yoga centers are not at all seen. That is the one thing I think should concentrate and train more and more students, and they should start some yoga center all over the city, so that everybody can go and take the benefit.
Thank you very much.
Vadiraj sir. I do the yoga dance.
Yoga dance followed by
Now we have one more visual feast, yoga dance, followed by valedictory. So I welcome Hasini and Kavya and team for the yoga dance, artistic and rhythmic yoga. Let's welcome them. I'll I'll give it to you, sir. After dance. ಖಾರ ಕೊಡ್ಬೇಕು ಮ್ಯಾಮ್. I request Honorable Vice Chancellor Sir Dr. Loknath Sir to give a open applause to the students. I also request Hasini to be on the stage. Hasini. We do have two more sessions after lunch. Please, I request everyone to be here post lunch.
So we are running out of time. We are having valedictory now for 25 to 30 minutes. After that, we will have half an hour lunch break. Then we will have two more sessions, one from Sita Lakshmi Madam and one from panel discussion. So you can ask any questions.
A very warm good afternoon to all of you. I am Dr. Shubhalakshmi from the Department of Samhita and Siddhanta, Government Ayurvedic Medical College, Mysuru. To improve the golden moment of opportunity and catch the good that is in our reach is the great art of life. It is a matter of immense pride to stand here before all of you on the behalf of Government Ayurveda Research Center in association with Sri Jayadeva Institute of Cardiovascular Sciences and Research Center, Mysuru. We are delighted to offer a gracious welcome to all of you for valedictory ceremony of the National Conference Cardio Yoga Summit. A prayer and positive affirmation are the keys for a divine intervention in any situation. So now I request Dr. Vaishnavi for the prayer song. Krishnam Vande Paramanandam Vandeham Krishnam Vande Paramanandam Vande Muralidhara Krishna Tulasidhara Muralidhara Krishna Tulasidhara Manamohana Ananda Nandana Manamohana Ananda Nandana He Giridhari Vanamali He Giridhari Vanamali Yamuna Tira Bihari Hari Yamuna Tira Bihari Hari Krishnam Vande Paramanandam Vandeham Krishnam Vande Paramanandam Vande. Thank you, Dr. Vaishnavi. Small cheer and great welcome makes a merry feast. Now I call upon Dr. Megashri for the welcome speech. A warm good afternoon, everyone. It's my humble duty to welcome you all for this valedictory function. Now, I take a little moment to introduce our guests on the dais. Now, I welcome Dr. Loknath sir, who secured his PhD in physics from an University of Mysore and worked as a scientist from an Halsma Institute in Japan, and is currently working as a director at Planning Evolutionary Board, University of Mysore, and director at the College Development Council, University of Mysore. He contributed more than 409 research works in an international journal papers. We welcome you, sir. I request to welcome sir with the token of the gratitude. Now I welcome Dr. Arish Babu sir, who secured his BNYS degree from SDM Ujre. He started his work as a first degree physician in Jayachamara Hospital, Bangalore, and served as a DAO at Kodagu, and also served as a DAO at Bangalore. Now he is serving his duty as a deputy director of yoga and naturopathy, and also he is holding an additional charge of an register in an KAPUP board, Karnataka. We request to welcome you, sir, with a token of gratitude. We welcome you, sir. Now I welcome Dr. Sita Lakshmi ma'am, the former director of a medical educational board, Government of Karnataka. We welcome you, ma'am. I welcome Dr. Guru Basaraj sir, senior Ayurvedic practitioner. We welcome you, sir. I welcome Dr. Ravi Shankar sir, the senior director of Jamnagar. We welcome you, sir. I request we welcome the Lakshmi Narayan Sinha sir. I welcome Dr. Anjanaya Murthy sir, who was the founder of an HOD of an Ayurveda Samhita Siddhanta. And we welcome Dr. Anantacharya Joshi sir for this program. We welcome you, sir. Thank you, Dr. Megashri. The wisdom of yoga transforms one from craving for freedom to the recognition of unboundedness, from limited ownership to oneness with the whole. Now I call upon Dr. Lakshminarayan Shene sir for report reading of National Conference Cardio Yoga Summit.
Cardio Yoga Summit is an innovative activity we have conducted from Government Ayurveda Research Center along with the Jayadeva Institute of Cardiology. It's a milestone in the history of yoga because Government of India Health Policy 2017 says that there should be an integrative approach, there should be a holistic approach, there should be a patient-friendly, acceptable approach. These three approaches are mandatory in the Government of India 2017 Health Policy. To make the dream of this mandatory health policy, we need such initiative where an integrated type of primary health delivery system should be adopted. And this is not my word, this is the policy statement of Government of India, and we are working on that. And as a part of this policy statement, we are doing this national conference on cardio yoga. We don't have any legal framework, we don't have any implementation guidelines, we don't have any policies. This is the first of kind. We are having one stakeholders meet where we will take inputs from all the stakeholders to make a policy, to make a implementation guideline, to make a vision for health for all by 2050. This is the mandatory things, and we are doing it in a special way, and that is nothing but the cardio yoga. Today morning we have started with the inauguration. The inauguration was done by our Commissioner Srinivasulu sir, along with the director of this Jayadeva Institute of Cardiology, Ravindranath sir, and we had blessings from National Medical Council and advisor of Government of India, Gangadhar sir, and he has given a beautiful message for all of us. And we are lucky to have 450 audios today. This is only 250. We have one more special room for 150 students. And today we had about 45 poster presentations. And all this we have done because International Yoga Day, June 21st, was initiated from Department of Ayush, and we have conducted about 60 programs in 28 schools. Today we are distributing the prizes for all of them. We are having many activities like essay writing, slogan writing, quiz. Then we are having selfie with the yoga pose. Many such activities we have conducted in schools, high schools, and junior colleges and colleges also. So this is a stakeholders meet. We are having 5 sessions. 3 of them already delivered, and 2 of them are yet to be delivered after lunch. But as we thought that valedictory should be within 1:30, we are lagging out of time, and we have started this valedictory program. When I just contacted VC sir, because in spite of his busy schedule, he said, I will be there at 1 o'clock. Sir has came at 1 o'clock. Sorry, sir, for the delay, because the sessions were very beautiful and their deliberations were really apt, and many of the questions have raised, and within the to answer these questions and deliberations, our students were very busy with the deliberations here. So that's why we are running out of time, and today we are in the valedictory session. So we welcome you, sir. This is the report where we have offline, we are having about 450, and online, it's a great thing, 1,200 are there. And now I just checked YouTube, where 1,056 are seeing our deliberations. So thank you all of you, because you have given a good time with us, you have supported us, you have blessed us, and you have given your moral and active support for all of us. I look forward to such support in all our future endeavors. Thank you, Mr.
Thank you, sir. Coming together is a beginning. Keeping together is progress. Working together is success. Now I call upon Professor Loknath sir for the valedictory address. Over to you, sir.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Very good afternoon to everyone. Deputy Director of Yoga, Dr. Harish Babu, and Dr. Shanai, Dr. Sita Lakshmi, and other dignitaries on the dais and off the dais, and students. Yes, indeed, I am very happy to be part of this valedictory event and the National Conference on Cardio Yoga Summit conducted by this very distinguished institution of the Mysore city. You already know that health is wealth. So if you have good health, then you can do many things. So therefore, always you have to maintain your health by doing yoga. That's why it's called Cardio Yoga Summit. As of the government of India, the health policy of 2017 advocates the holistic integrative healthcare delivery systems. So in this approach, the benefit of patients by combining traditional practice like yoga with modern medical achievements. So there has been a noticeable increase in the heart attacks. That's more important is the young generation between the age between 22 to 40 years. So the reasons for this, you already know this, the lack of exercise, poor dietary habits, and the lifestyle. And these are some contributions. I just asked the students who are giving the poster presentations, doing yoga is really good, but the problem is every day doing yoga is a very difficult task. So how can you do every day? That's why I always suggest to the student that the 4 weapons should be there. One is the hard work, the self-study, a consistency, and sincerity. These 4 weapons, if you have, definitely you can do yoga. The most of the people know that yoga is good, but they don't do it. So similarly, morning walking is really good, but nobody do it in every day. This consistency will be gone. So therefore, we should be sincere on work. Similarly, we are sincere about our health also. That's most important. If you do not have health, so because today we are having in the technological world and the information era, you know everything on the internet. You use mobiles. Yes, it is true. But whereas implementation level, we are really lagging behind. The reason is laziness. So how to remove the laziness? That has to be discussed more in this type of yoga. So yoga definitely if you do it in morning, early morning, because everybody says that if you give early rise is the best option. So do you ask the students, how many students will get rise at 5 o'clock or 6 o'clock? Then they say that no. So that's the reason. So that means you need to think about your health. You better to think about your exercise. So it is everything with you. So how you eat, how you practice every day, where you go, what to do, where to go, those things will be in your mind. In the same time, more important is the health. So therefore, this summit definitely will help the students get an awareness is how the important of cardiology. So, and it is also very interesting that the students come over to this great institute so that they can also see that how this hospital works for cardiology. And we can see in the other way around, heart diseases are coming. So everybody says that any person who born, you will have a disease. That's the nature. We cannot say no. But how to minimize the disease is very important. For this, we need this type of yoga. So yoga certainly help your health as well as your thinking and motivations. So therefore, do practice yoga every day. So you will be away from the doctors. You are away from the medicines. I have seen many students in the universities, young age of 21, 22, they have a high blood pressure. They have somebody have a diabetes. So why it is happening is that because the reason is the way our food and the way our lifestyle is there. Therefore, I urge all the students, do practice yoga, do exercise every day, do physical activities, such a way that it should be consistency and sincerity. That's the most important thing. So even in your studies also, you should have to have a sincerity and consistency will definitely take you to the higher heights, such as that you can learn many things and also you can give more importance to the yourself to particular health. So I will not take much time as time is running out for all people. So thank you very much. It's given me an opportunity for me to see this type of programs. Normally we do some other programs in the universities. I thank the organizers. So give me an opportunity to come over here and giving a few time to give an opportunity to see all the students' posters and other things. Okay. Thank you, and
Thank you, sir. Now I request other delegates to felicitate Professor Loknath.
ನೀವು ಮಾಡ್ಕೊಂಡ್ರೆ ನಾ ಮಾಡ್ತಿದ್ದೆ ನಾನು 2 ಬರ್ತೀನಿ ನೀವು ಬರ್ತಿದ್ದೀರ ಹೇಳ್ಬೇಕು 7 ಮುಂಜಾನೆ ಒಂದು
Thank you, sir. The fragrance of flowers spread only in the direction of wind, but the goodness of a person spread in all directions. We are delighted to have with Dr. Harish Babu, sir, as honorable chief guest for the valedictory ceremony. Now I request Dr. Harish Babu, sir, on the stage to address the gathering. Over to you.
Respected dignitaries on the dais and off the dais. I don't want to take much of the time. Just few words. This is much needed of the hour because yoga being our own India's contribution to the whole world. So as yoga very word tells, yujate ananiti iti yogaha. So which joins the humanity with one another. So this is the much needed hour, that scientific effect of yoga for everyone. Because we have forgotten, like Hanuman, despite having all the powers, he had to remind by others that you have so much of powers. The same way, we Indians having a lot of our own strengths we had forgotten. So through the scientific approach, now it is coming to light that yoga has got a lot of benefits physically, mentally, emotionally, psychologically, spiritually, and all the planes. And this kind of workshops instill our confidence in our own culture, our own contributions, our own age-old practices. You will be able to see those practices in the modern light. So in the government, we are doing a lot of yoga activities. Earlier, we had done the school health programs. In the school teachers, we had trained around 1 lakh teachers across Karnataka from 2010 to 13-14. And now again, we have taken up that from the government. And also, as you know, International Yoga Day on June 21st, last year, I think Prime Minister had come to Mysore. So this is one of the most accepted program across the globe. So this year we did from the government of Karnataka a different way. Apart from June 21st, we did something called pre-events, verticals. We are able to reach around 10 lakh people across India who are new to yoga. So we did in apartments, we did in schools, we did in different organizations who are not exposed to yoga. Because yoga who are doing, so they will be doing every day. But we need to bring in many more people because of its simplicity and effectiveness. So that's why we are able to reach out to around 10 lakh people across the state. So that was one of the great achievement for the department this time. We're all having many more programs. So these kind of programs which will instill the confidence in our younger generation to know the effectiveness and also to practice. So as our previous guest was telling that you need to practice yoga every day. So central government has made this yogic practices very simple. The common yoga protocol where everybody can practice. So that is one thing. And for the fast-paced life, so everybody cannot afford maybe 20 minutes of or 30 minutes of this one time. So government has come up with Vibrate app, which usually contains very minimum practices of 3 to 5 minutes. Everybody can afford 3 to 5 minutes of practice in a day. So that's why they have come out with Vibrate app. Anybody can download that app into your mobile. Very simple practices are there. Please download and during the work time, it is called work time only. So during the work time, have a break of 5 minutes, do those practices, and you can keep your health. So with this, I complete my this one, and thank you very much for the organizers for giving me an opportunity and addressing me. Thank you.
Thank you, sir. Now I request other delegates to felicitate Dr. Harish Babu, sir.
So we are having two more sessions after this. So we are having
of University of Mysore, for his inspiring valedictory address. We are deeply honored by the presence of our guest of honor, Dr. Harish Babu, Deputy Director, Yoga. Thank you for your invaluable contributions and support. A special thanks to Dr. Anjaya Murthy sir, Dr. Sheeta Lakshmi ma'am, Dr. Guru Baswaraj sir, Dr. Hanumanchar Joshi. Lately, I would like to thank all the participants, speakers, and volunteers who have made this event a grand success. Your enthusiasm and dedication have been truthfully inspiring. Thank you all once again, and we look forward to continue our journey together. Thank you all.
Thank you, Afrin. The end of a story is the new beginning for many others. On this note, let's conclude a remarkable, memorable, and knowledgeable valedictory session on the behalf of Government Ayurveda Research Center in association with Sri Jayadeva Institute of Cardiovascular Sciences and Research Center, Mysore. Now it is the time for lunch, and again session will start at 3 o'clock. Dhanyavad.
A big round of applause for all the children who presented the yoga dance on stage. Now, I would like to call upon. We'll start with the technical session number 3. Today's technical session will be done by Dr. Sita Lakshmi ma'am. I would like to call upon Dr. Salma to introduce the speaker.
I also request Chairperson Dr. Veena ma'am onto the dais and Co-Chairperson Dr. Ravikiran sir and Dr. Rajesh sir.
ಮೇಡಮ್ ಸ್ವಲ್ಪ ಮುಂದಕ್ಕೆ ಮುಂದೆ ಕೂತ್ಕೊಳ್ಳಿ ಹಂಗೆ.
Good afternoon, everyone. I'm very grateful to introduce our guest speaker, Dr. Sita Lakshmi Madam. Ma'am is a woman of essence with multifaceted personality and a philanthropist by heart, a teacher for excellence and an administrator with human value, and a god to patient and amma to Mysore. There are several names for Sita Lakshmi Madam. Madam is always very supportive in 1980s. In Mysore, Madam is the first doctor from Mysore Medical College to propagate yoga to public. She graduated and post-graduated from Mysore Medical College, 30 years of teaching experience in pharmacology, and served as teaching faculty in Mysore, Bangalore, and Ballari Medical College. She served as principal of Mysore Medical College from 1991 to 1995. She also served as director Medical College, Government of Karnataka for 3 years in Bangalore. Madam has given many talks on awareness on yoga. Being a pharmacologist by profession, Madam has beautifully propagated drugless therapy in the form of yoga. She is the powerhouse behind constructing Sai Baba Temple at Ramakrishna Nagara, Mysuru. Today, it is considered as most powerful shrines in Mysuru. Today, she will talk about yoga in past, present, and future. All are very eager to hear you, ma'am. And I would like to, I request her to welcome with a token of gratitude.
ಕೂತ್ಕೊಳ್ಳಲ್ಲ ಲ್ಯಾಪ್ಟಾಪ್ ಇಲ್ಲ ಚಾನಲ್ ಐತಲ್ವಾ ಒಂದು ಫೋಟೋ ಕಾಪಿ ಹಾಕ್ಬಿಟ್ಟು ಸೆಂಡ್ ಮಾಡ್ತೀನಿ.
Namaste everyone. It's my pleasure to introduce our chairperson, Dr. Veena Madam. She is working as an interventional cardiologist with the designation of Associate Professor at Sri Jaideva Institute of Cardiovascular Sciences and Research, Mysuru, since July 2015. And she is actively involved in research as she believes that we should leave the field richer than we found it. And she has completed and passed her DNB Cardiology 3 years training from Fortis Hospital, Cunningham Road, Bangalore, under National Board of Education in December 2014. She has worked as senior resident in Department of Cardiology at Fortis Hospital. And she has worked as senior resident in Department of Medicine at JSS Medical College and Hospital, Mysore, from September 2009 to December 2010. And we welcome you.
Now, our guest Sita Lakshmi will take over the session. Over to you, ma'am.
Good afternoon, my dear yoga bandhus. Because all are interested in yoga, we have assembled. So we are all yoga bandhus. We will exchange a few views about the yoga. The topic given to me was yoga and cardiology, past, present, and future. I think most of the topic, most of the subject has already been covered in the morning sessions. But anyway, I will brush through a few things, probably which not be aware. So everybody knows about the yoga introduction. It's an ancient practice of originating from India. India had the great contribution to the science of yoga as well as the yoga specialists. Actually, the great saints and sages of our India, which is known in India, they have given a lot of importance for yoga, and all their success has been attributed to the beneficial effects of yoga. So if we just see the historical context, the past, ancient roots, how it has originated in India, and also the philosophical foundations. Philosophical foundation, if you come across, already it has been touched at the Patanjali's Ashtanga Yoga, Patanjali Yoga Sutra. Of course, the Ashtanga Yoga consists of Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, and Samadhi. These are the things every yoga expert will know, and he must know, and he will know about this. So I will not go into the details of it. So what are the benefits of this Ashtanga Yoga in cardiology, with reference to the cardiology? See, mainly it is cardiorespiratory fitness. Why I say this is pranayama forms the major part of one of the yoga anga of the Ashtanga Yoga. And here we have the various breathing techniques. And modern science explains how the heart is related to the lung and lungs are related to the heart. So that interrelation has contributed to the cardiorespiratory protection. Of course, the overall health of the individual attributes to the metabolic health, and the psychological setup is the stress and the emotional regulation. So this is Ashtanga Yoga is a dynamic approach where these are the details of the individual, that 8 divisions of Patanjali's Yoga Sutra. So when did we start? Initial scientific exploration. See, this yoga was almost kept aside by the modern so-called scientists because they could not attribute the scientific reason behind it and the benefits of yoga. So the first significant research in the modern science, if you have to quote, it says that Dr. D. Arnold in late 1980s, his groundbreaking study known as lifestyle heart trial, it was published in the Lancet in 1990. Lancet is one of the very popular medical scientific journal which opened the eyes of the modern science, modern doctors. This research demonstrated the lifestyle changes, comprehensive lifestyle changes, including a low-fat vegetarian diet, moderate exercise, stress management techniques of yoga and meditation, and social support, and could not only prevent but also even reverse the coronary artery disease. Here, I would like to explain or tell you, I'm very happy to tell you, to share my experience with the Swami Rama of the Himalayas. You might have heard of Swami Rama. He is a great saint. He is the author of the very popular book called as Living with Himalayan Masters. He was the great promoter of yoga when the modern so-called allopathic people or the modern scientific people are objecting further. He went abroad, he went to Kansas, and in Kansas University, in the medical school, he demonstrated. He sat in those days, the scientific advances were not that much. So in spite of it, he sat inside the class chamber and recorded, asked the assistants to record all the things. He could demonstrate successfully the stopping the heart for 16.8 seconds. Actually, this observation has been recorded in the British Encyclopedia also. And he had demonstrated also the increase or decrease in the heart rate and voluntary stoppage of the circulation in the limbs. And also he demonstrated at the same point of time the reduction and increase in the body temperature. See, in one experiment, he kept his palm like this. He connected two temperature sensors, one to the little finger, one to the thumb, and recorded the temperature at the same point of time, at a particular point of time. So in a particular point of time, the difference in two fingers, two places was to an extent of 11 degree Fahrenheit. That means you can imagine one finger was 93 degree Fahrenheit and another was 104 degree Fahrenheit. That means the difference between the two places in the same hand. He had demonstrated. Even that has been recorded in the British Encyclopedia. Okay, I will come to the reason how. Then the next was the voluntary stoppage of the circulation in the limbs. See, I was fortunate, in 1992, 91, I first met him in the YesVyasa conference, international conference. In 1992 in Bangalore, he arranged a workshop on meditation. Assembly like that, there were about 200 delegates there. And there was a big mattress put on the platform. And he was sitting on the platform in the Padmasana. And he was talking about the meditation. So the first thing in the meditation comes the importance of posture. So he was explaining the importance of the posture. He was sitting like this in the Padmasana. So, and then in between the talk, he suddenly, who are the doctors here in the assembly? Please come over. The workshop conducted the assembly had various professional or various people, religious people, and we were about 6 doctors. myself and my friend, two ladies, and there were four gents doctors. I don't know the names of them. So we all came to the dais. So then he asked us, see, you are all doctors. Come on, you feel like below knee, think that this is the knee joint, and he was putting the feet like this. He asked us to feel the skin over the below knee, up to the foot, like this, and he was sitting like that. When we saw it was normal. Then after a few minutes, he said, now you feel. Then when we saw one limb below knee, it was purely pale, white, dead, cold, clammy skin. Just like in the anatomy, we study the description of the dead body. How do you explain the sick? That's the first thing they teach in anatomy, that the nature of the skin of the dead body. How it will be cold, clammy, pale. So it was the one limb was like that, another was normal. Then after all of us, then again he asked us to feel. It had come back. So always that is duty. He had perfect control over the autonomic nervous system. See, you might have heard of this autonomic nervous system, sympathetic, parasympathetic, is totally involved. So, any individual cannot control his circulation because that is beyond our control. It is in the autonomic nervous system. Whereas he had mastered the control over the autonomic nervous system, so he could control the circulation. So in the limb, where it was cold, clammy, and dead like skin, he had produced vasoconstriction. That means the blood supply was totally stopped in the limb. So when in the body, when it becomes pale and cold, because there is no circulation, so it has become cold and clammy skin. Another thing was, so the same explanation holds good. The previous experiment which he saw, which I told you, he demonstrated the difference in the temperature. You all know that the artery comes here, brachial artery comes here, divides into two, radial and ulnar arteries. So radial one artery, he had totally vasoconstricted. That means the temperature came down. Another artery, he had made vasodilatation so that there was pushing of the blood and temperature rose. That was that was the reason for the difference in temperature, half the hand cold and half the hand warm. So he had that much of control over the heart and the autonomic nervous system. So anyway, I was fortunate enough to be there on the day of workshop in which he demonstrated it in Bangalore. So later on, when the awareness came, Swami Rama came to Bangalore, and then he started an association with Minhas, and he took some 18 yoga experts, and on them the work was done. So Professor Desirado, in those days, he was the head of the Department of Neurophysiology. He was associating, he was heading the research team, and under him, or along with him, Professor Swami Rama and his team of yoga experts, they did that experiment. And of course, the Vyasa, Vivekananda Kendra of the Jubilee, already morning, Dr. Nagaratna, they told about Dr. Nagaratna. So I was also associated with Vyasa in the beginning when I was in Bangalore Medical College. So in the initial stages, the Vyasa also had not developed so much. So in the beginning, so I was also associated with somewhere in 94, 95, 1995, I think. So there also a lot of research is being done. And mainly effect of yoga therapy in cardiovascular and respiratory illnesses, especially the bronchial asthma. That was a one important landmark in the history of Vyasa. Because Dr. Nagaratna and Dr. Nagendra, I know them very well. So we were doing a lot of research on this asthma. And at that time, I was a professor of pharmacology in Bangalore Medical College. So I was associated with them. So first they published, I think in 1985 or somewhere, they published an article. They wanted to publish an article in Indian journals, IMA journal and other journals. When they said this, nobody was ready to publish because it is yoga. They said, no, it is yoga. No, we are not going to publish it. Then Dr. Nagaraj sent the paper to the BMJ, British Medical Journal, and they asked some about 18 queries. So at that point of time, I was associated with them. Then we all sent the replies to them 2-3 times. Correspondence happened. At last, then they published it. When once the article was published, everybody's eyes was open, and so many queries came, and lot of research pickup was there in the SVAS organization. So right now, Dr. T. N. Satyaprabha, my daughter, she is working in NIMHANS as a head of the Department of Neurophysiology. See, she has, in 93, I was shifted to Mysore Medical College as dean. So I could continue my research. So my research project, whatever there, she is a physiologist, I am a pharmacologist. So she started continuing me. And then she joined, she did MD pharmacology. Then she joined NIMHANS. So in NIMHANS, when she joined, she has developed an autonomic nervous system laboratory itself. So there she is getting all the patients from the clinical side, and they are doing the assessment, clinical assessment before and after yoga therapy and various other, even whether it is a allopathic trial or a Ayurvedic trial, just before and after trial, that assessment they are doing. And she has probably got a good number of papers on this. That is one of the special department which is right now working there in the neurophysiology department. Then apart from this, yoga decreases the levels of pro-inflammatory cytokines and oxidative stress markers. So the estimation of these stress markers forms another criteria, the scientific criteria to prove the efficacy of yoga therapy. And also in the patients where there is cholesterol level, lipid levels, and the tendency to develop atherosclerosis and cardiac condition is more. In those patients, the assessment helps. To mention a few studies all over the world to this is recent research and evidence. Yoga and hypertension. There is one study, systematic review and meta-analysis by Kramer et al. They have published number of papers recently, 2020. And then study 2, Chu et al. Conducted a randomized trial showing 12 weeks yoga practice. And yoga and coronary artery disease. Again, study 3 in coronary artery disease, and study 4, the yoga care study, and yoga and heart failure, study 5, Bidwell et al., and study by Nayak et al., and yoga and arrhythmia. This is an exclusive study on arrhythmias, where the Malhotra et al. Has shown yoga reduced the frequency of atrial fibrillation episodes. So next is the integrative cardiac rehabilitation. How That is about the continuation of the previous study. And next study is the Chattopadhyaya, who has demonstrated yoga-based rehabilitation. So, what is the basis of yoga therapy? How we can see whether you call it as philosophical or spiritual, whatever you say, the whole body structure of the human body is explained on the basis of spirituality. That is, every human body consists of the physical body, that is the Sthula Shariram, and the astral body, Sukha Shariram, and the causal body. That is very, very evident. See, these things have been explained by our ancient sages and rishis who have mastered this yoga therapy. So, actual basis of this therapy is the vibration using. See, God created the whole human earth, whole universe by vibration. Actually, if you go to a little about the spiritual aspect, I'm not going to touch a lot. It is that God is the Nirvikara, Nirakara, Nirguna. So he has no character, he has no shape, no distinct swarupa and all. And when he created, everybody knows God has created this universe. So nobody will deny that. So to create that, he needs something. So the first thing to come out was the vibration. So that vibration condensed into the form of the light, and then that vibration condensed to form of the sound. The sound became the Om, and the light became the illumination. So that light is the nothing but the condensation of the vibration. See, in the astral body structure, they explain it as an electrical current. Even in our physiology, if you say how the nerve impulse starts, it is an electrical current. It is minus 70-degree negative charge. So how the cardiac impulse starts from the pacemaker, it's also an electrical impulse. How do you say that electricity is there in the brain, electricity is in the heart? So that is the structure of astral body or pranic structure. That is nothing but called as prana sharir, that astral body, and various functions which we do, which are initiated by the nerve impulse, that is called the astral body. So that is mainly depends on the vibration. And many times, many people might have some experience about the vibration. See, suppose when you read a person for the first time, sometimes you may feel like talking to the person, or sometimes you may feel dejected. That is why, because at the psychological level, mental level, there is an exchange of the vibration. And also distant healing and so many others, faith healing, distant healing, all of these things, they depend mainly on the vibration. And even the breath control by pranayama effect and on the cardiovascular system, which depends upon how the vibration affect the heart. See, in between the heart and the lungs, there is a reflex mechanism. When the heart rate comes down, this falls up, and when the respiration comes out, it increases like that. So that interchange to maintain the balance of the human body functions, it is the vibration, that is the. So where do you find the vibration? When I say that God has created vibration in every way, even this metal or the wood contains vibration. Even this article, any article contains vibration, any plant contains vibration, any animal contains vibration, any human being contains vibration. To give you one example, the scientific example I tell you, in God, they say God sleeps in minerals, dreams in plants, awakens in animals, knows that he is awake in morning. So the first thing, demonstration of the vibration in inner animal plant was demonstrated by Bose in school. When once Paramahansa Yogananda, when he came to India, he went to visit his laboratory. So when he said, and at that time, the professor, he explained to Yogananda an incident that when he had finished, when that was he finished that experiment, he took a graph. It was just a simple graph like that. And a scientist from abroad, some Oscar, some name. So he had come to visit that institute. He gave that graph to that man and he said, you see, can you tell what is this? Then he says, he thinks like this one, no, this is nothing but the muscle contraction. Because we all, as students of physiology, know that when you stimulate a muscle, it contracts. When it contracts, it produces a graph. So it is nothing but a muscle contraction there. He says, no, it is the graph of a thing on the table. On which it was there. So that scientist was surprised. How can it in inert substance can yes, it do contain, and that is because of the vibration. So that is a solid example where we see, but the frequency and the rate and the depth of the intensity may be less or may be different, but still it is an evidence, solid proof that the vibrations do exist even in the inner materials. Okay. Then what's to the plant? How do you say that it contains vibration? See, many people might have experienced that you can talk to the plant, it responds. Definitely it responds. I myself had so many personal experiences how the plants do respond. Another example, when Paramahansa Yogananda went abroad, they met with Roger, where he demonstrated that the plant do respond to the vibration. That Roger what he had done, he had grown the various cactus, cacti. Cacti are always thorny. So he wanted to have a thornless cactus, plant. So when he went around, he showed the Paramahansa Yogananda, see, these are the plants which I have grown in his garden. Daily he used to give vibration to that plant, telling that I don't want you to grow the thorn, leave the thorn like that. So that went on, and slowly, the whole cactus plant became that whole estate, the garden became thornless plants. And Yogananda was surprised, and he said he took a cutting to his ashram in Los Angeles or Encinitas somewhere in America. So there he grew there. So that plant maintained its character there. So that is another evidence to say that plants do respond to the vibration, whatever vibration we do. And animals. Animals, though it is there, we have to, some stimuli only can awaken. Of course, the man knows that he is awake. See, we all know that we are in this daylight, we are in this program. That situation we know. So that is the situation of the status of the vibration in various. Of course, the healing, role of the healing by music, everybody knows. Even the music, it goes in the waves and it affects the person, it affects the disease in a beneficial way. So, what is the future? So, if you think of future, what it has to become? Personalized yoga interventions, genetic and epigenetic factors. Future research may explore some more genetic and epigenetic influences on the individual. Because now a lot of research on the DNA level, genetic level is going on. Days may come where yoga may be explained on this basis. And precision medicine and technological integration, wearable technology, devices and apps can monitor physiological responses to yoga, providing real-time feedback and data and research. Then virtual reality And artificial intelligence, again, that is another new field which is coming up. And in, I think, Ramat et al. They are doing Europe. They are doing some experiments on this artificial intelligence, how yoga can improve. So, of course, what is the role in its public health strategy? How you can improve? One is standardization, developing the standardized protocols and longitudinal studies. Long-term studies are needed to assess the sustained impact of yoga on cardiovascular health system. Because everywhere, the moment you say yoga or the whatever is beneficial, they ask you to show the proof. Science is evidence-based, always evidence-based. So naturally, if we have to prove, if you have to show the evidence, you must have some parameters to prove your efficiency. Then challenges. What are the challenges and future direction? Challenges, community-based programs, integrating yoga and community health programs can increase the accessibility and promote cardiovascular health at a population level. Policy advocacy, supporting yoga-based interventions in the healthcare system should reduce it. Then, just gently, Paramahamsa Yogananda's experience already I told you. The God manifests in the vibration form, light, and sound. And Paramahamsa Yogananda has made a very interesting statement that he's a Paramahamsa Yogananda. I don't know how many of you know about him. He's the author of the book called Autobiography of Yogi. It is one of the 10 highly sold, marketed book throughout the world. It is one of the 10 highly marketed, very, very popular book, popular book, Autobiography of Yogi. And he stayed abroad for about 15 to 20 years. And he did a lot of spiritual and yoga therapy to the Westerners. Actually, he was directed by Mahatma Babaji, I don't know how many heard of him. So, to go to West and spread about the Kriya Yoga. The main thing which he spreads is nothing but the Kriya Yoga, which affects through that's a type of pranayama technique, which helps the vibrations to move. And also, not only at the physical level, but also the psychological and the spiritual level also, it helps. And he has told, see, about 100, maybe 100 years ago, we all know we didn't have the mobiles, we didn't have the TVs, we didn't have even the electricity also came in 1893, the first electricity generator was established in India, in China, I think. So in 1893, that was first thing. So there was no electricity, no electricity. But now we have advanced. We can maybe 100 years we have advanced to such an extent. Actually, the introduction of the TVs, mobiles, all those things. See, as elderly people, we can't operate, whereas our small kids or the grandchildren or even the baby, you can take that will start operating mobiles, TV, mobile, internet. So science has advanced so much, and that's all nothing but the waves or the vibrations. Whether we see that we were not able to communicate with our own people thousands of miles abroad, but now we can talk to them face to face. We can do all experiments. So that is the scientific advance. Even the medical field, how much the technical advance has occurred. The introduction of the ultrasound therapy, the various therapeutic measures, and so this has the effect of the vibration therapy, which is explained. So he has told in another 100 years, maybe all the drugs, everything may go away, and only the vibration may remain as a field of therapy. So here, the one thing, okay, what is the situation today? Situation of the yoga today, in the whole world population, about 3.8% of the population, when even I'm talking about the world level, world total population is 7.9 crore. So in that, not crores, it is a million. So out of that, 3.7% of the population are following yoga. So you'll be surprised to see that the amount of the interest which the yoga has created and which is being created now. And only thing is that has to be put into the application. So this reminds me of pharmacology. See, our ancient people, good old pharmacologists, Greek pharmacologists, by name Galen. You know what he said? The first sentence, which I always used to tell my students, he said, I give medicines, God will help. So you may give medicines to 10 people, but all the 10 people may not be beneficial. But what modern science says, it is only a statistical significance. So what happens to the remaining which are not significant? Whereas this therapy, the yoga therapy applies, it is 100% full. So this is a small thing which I wanted to share with you people. And being busy since morning and conducting so much of effort Dr. Shana has put, and it is a take-home message for all of you. What you have to do, what is a contribution you can think of? Everybody should think in their own mind, what I can do, what I can contribute to the nation, which is, it doesn't cost anything, it doesn't cost any money, maybe little mental work, maybe, that's all. So that will go a very long way in improving the health of the people. So I think the outcome of this summit will be at the national level, so that it will have maximum benefit to the public at large, and it will benefit the whole community. So even after a heavy lunch, thank you for patiently listening.
After hearing ma'am's session, I remembered one Subhashita. Nachora haryam nacharaja haryam na bhratru bhatyam nacha bharakari vyaye krite vardhata eva nityam vidyadhanam sarvadhana pradhanam. Acquired knowledge cannot be stolen by any thief, nor can it be taxed by the government. It can neither be divided among siblings, nor is it heavy to carry. The more we spend in teaching others in the process, the more we learn day by day. The knowledge is prestigious of all possessions. Thank you, ma'am, for enriching our knowledge by giving insight into yoga and cardiology, past, present, and future. And I request chairperson and co-chairperson to deliver the remarks.
Thank you, madam. Congratulations. That was an excellent talk. I almost felt that we were taken from Vedic world to the marble world which we live in now. From the energy exchanges that happens from within to outside. It was a very excellent lucid talk cited with good examples. It was very good to sit here and listen to the entire talk being delivered in an amazing way. Thank you, madam.
Thank you very much, madam. I happen to be a junior at MMC. So she passed out in 1971. I entered in 1972. I was not exposed to this aspect of her personality. Only today I came to know that she is one of the rare examples of integration of modern medicine, especially for pharmacology. It is very, very rare with yoga and other sciences based on philosophical philosophy. To add to what she was telling about your Paramsa Yogananda, it's one of the most popular books. Its Kannada version is also available. It's a must for all of us to go through it. And to be very brief because of the time constraint, I would like 1 or 2 words only. No, we are all, feel happy and Ananda and Paramananda. Perhaps many few who are not in the medical field are aware about a molecule which is known as Anandamai. The West European scientists, when they isolated and characterized this transmitter, so they named it Anandamide, not its origin from the fatty acids. Why? Because they were, I think, exposed to Indian philosophy and they heard about Paramananda and Chidananda. So to link to that, they give the name Anandamide. Now, before coming here, when Dr. Chanda invited me, I just went through Google Library. So I was, very much interested in Anandamide. I saw that some of the yogic practices, they promote formation of Anandamide. Anandamide is one of the most important molecules, regulatory molecules, which has got physiological role in controlling the stress. So the third aspect, which she was highlighting, I think perhaps that may be linked to that molecule. And the second aspect, it's about sattvic food. Very recently, a lot of research have been conducted on taste receptor. Now, taste receptor, especially bitter taste receptor, there are 26 kinds. So they are there in all parts of the heart, starting from SN node, starting in the contractile apparatus. Not only that, integration of that, and they influence the immunological aspect of this inflammation. They are involved in controlling the oxidative stress, and also they involved in integration of oxidative stress with the the inflammation. So yoga, I think it's going to have definitely a very prominent role in future, because the future generation would be exposed to a lot of stress, work-related stress and society-related stress. For that, I think yoga is the best therapy. I think somebody was referring to a primordial, measures. I think that should be propagated in an intense manner. Thank you. Thank you very much, madam.
Thank you, madam, for enlightening with your vast knowledge. And the future generation may require for the customized kind of the yoga therapy for each individual element. So once it has been concise, so that instead of going for the each and every time for the the treatment, it would be more useful for going for the customized yoga, so that the health benefit will start from the home level itself. So that instead of going at the end to the doctors, because the Vaidya Narayana Hari, the saying says that, but we have to do the part of work, that how best we are taking care of our health in order to go to their, seek their help, and as well as to take care of the whole society. So thank you very much, madam.
One point I would like to add. When you mentioned sattvic diet, I just remember Paramahansa Yogananda's Guru was Swami Yukteswarji. He has written a book called Holy Science. So in that book, he is beautifully explained. Nowhere else you will get. See, the different animals have different types of denture. Incisors, canine, molar, and premolar. So the tiger and those carnivorous animals, they will have a particular type of denture. The herbivorous like cows, they have separate type of this denture. So like that, it depends upon the diet, what they consume. So overall, he has said that whole human population is fruitivorous. So our size, shape, everything of the incisor, molar, canine, whatever may be, the whole denture is most suited for fruitivorous, fruit diet, and also the sattvic diet.
Now it's time to deliver vote of thanks. My heart fills with lots of gratitude and respect for our speaker, Dr. Sitalakshmi Madam, for not only sparing the invaluable time for us to grace this occasion, but also for enlightening us with their commendable talk on the subject. I request Sahana, Nityashree, Maheshwari, along with Dr. Sidanand sir, to felicitate Madam with token of gratitude. And I also request Sahana Nityashri Maheshwari to felicitate. I request Sika Lakshmi Madam to felicitate Dr. Siddhanand Sir with token of gratitude.
ಒಂದು ಆಶೀರ್ವಾದ ಮಾಡಿ ಒಳ್ಳೇದಾಗಲಿ. ನಿಮ್ಗೆ ಅದಕ್ಕೆ ನಿಮ್ಮಿಂದ ಮಾಡ್ಕೊಳ್ತಾರೆ ಸರ್.
I request Dr. Siddhanand Sir to
Good evening to all of you. So I had a little busy schedule today because I had a lot of meetings. So I had to, my director, my FA had come. I was a little busy. Sorry I could not attend the program. So I hope that this program was very beneficial to all of you. So since morning, we have heard so many things about the benefits of yoga, especially in cardiovascular diseases. So I'm very happy to tell you that we are associated with the Ayurvedic Research Institute to implement Ayurvedic practices, yoga in cardiac patients. So we have an MOU with Dr. Vinay. So we'll be starting a series of research activities in our hospital in association with the Yoga Institute. So we want to integrate both our modern medicine, what we practice as cardiologists, with the traditional Indian form of medicine like Ayurveda and yoga. So how the yogic practices, lifestyle changes brings about benefit in our cardiac patients. And we have also conducted a lot of trials in our hospital. So one large scale trial, which was pan-India, which is a multi-centric trial, was conducted about 2-3 years back to examine the benefit of yoga in patients who have suffered a heart attack post-MI period. So we divided into 2 groups, one with yoga intervention, one without yoga intervention. So they were followed up for a period of 6 months to 1 year. So a lot of benefit was observed in patients who are practicing yoga, and this was published in the International Journal also. And there is one more ongoing trial now, which is our institution is a part of that trial. Again, ICMR funded trial, where we are examining the benefit of yoga in patients with heart failure. So ours is one of the highest recruitment in the entire country. Yeah, we stand in the first place in the number of patients recruited. So this is an ongoing trial. I hope that this yoga will benefit patients with heart failure. So if we see mechanisms, morning, all of us have heard about the benefit of yoga in cardiac patients. So I hope that this seminar is of benefit to all of you. And we hope to conduct such kinds of meetings in the future also in association with Dr. Shanai. Thank you very much for attending.
Thank you, sir. We are extremely thankful to Dr. Veena Ranjappa Madam for chairing this session. I request Deepak and Kirti to felicitate Madam with a token of gratitude. I would also like to thank Dr. Ravi Shankar sir for co-chairing this session. And I request Deepak and Preeti to felicitate. I'm also thankful to Dr. Rajesh sir for co-chairing the session, and I request Deepak and team from Youth for Seva to felicitate sir.
Thank you.
Small note, I request all the delegates to give back your feedback form in the registration counter. Now I hand over the session to Dr. Shanai Singh.
So we are having a small panel discussion. Panelists are, this will be done by Amrita Pandit.
Good afternoon, everyone. Tadvidya Sambhasha Buddhi Vardhananam Shreshtam. So it is said that learning is incomplete without a mere discussion with the peers or the scholars. So for the same, we have panel discussion organized today. So I would like to call Dr. Kavita to welcome the panel members.
Namaste all. Myself Dr. Kavita from GMC Mysore. Yasta sancharat deshan, yasta seveta panditan, tasya vistarati buddhihi, taila bindur vivambasi. The intelligence of a person who travels in a different countries and associates with the scholars expands, just as a drop of oil expands in a water. With this beautiful quotation, first of all, I would like to welcome Dr. Sita Lakshmi ma'am over the dais. Dr. Guru Basavaraj sir, over the dais. Please welcome yourself. I would like to welcome Dr. Anjaneya Murthy sir over the dais. Please welcome him. Dr. Arish Babu sir over the dais. Please welcome yourself. Now I'd like to call Dr. Anthony Paul Raj to introduce the panel members.
A cool good evening for everyone. From morning, I think you're utterly tired. I think this is the last session for every seminar or workshop. That is what we heard from morning on till the last session, madam session. So if you have any doubt, so in this beautiful, a fruitful
and valued in this workshop or in national seminar, some fruits should be able to carry to the home. So that fruits to give all the panel of doctors is on the dais. I myself, Dr. Anthony Porter, principal as a Chai Dev B.Ed College. ನಾನೊಂದು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಯೋಗ ದಿನ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಮಾಡಿದ್ದೀನಿ. ಒಂದು 8 ಕಿಲೋಮೀಟರ್ಸ್ ಯೋಗ ನಡಿಗೆ ಮನೆ ಕಡೆಗೆ ಅಂತ. ಬಟ್ ಈ ಸೆಮಿನಾರ್ ಕೇಳಿದ್ಮೇಲೆ I decided my dialogue. Tomorrow onwards, I will go and create awareness like you youth people. ಯೋಗ ನಡಿಗೆ ಹೃದಯದ ಕಡೆಗೆ. And this beautiful, meaningful cardio yoga summit ಅಲ್ಲಿ ಒಂದು ಟೈಟಲ್ ನಾನು ತಗೊಂಡೋಗಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಬಹುಶಃ ಇದಕ್ಕೆ ನಾನು ಮೋಸ ಮಾಡಿದಾಗ ಆಗುತ್ತೆ ಅಂತ ಕೂತ್ಕೊಂಡು ಯೋಚನೆ ಮಾಡಿದೆ ಏನ್ ಹೇಳ್ಬೋದು ಅಂತ ಕೊನೆಗೆ ಅಂತಿಮ ಘಟ್ಟಕ್ಕೆ ಇದನ್ನ ತಂದೆ. ಸೊ ಯೋಗ ನಡಿಗೆ ಹೃದಯದ ಕಡೆಗೆ. ಯಾಕಂದ್ರೆ ಮಾರ್ನಿಂಗ್ ವೈಸ್ ಚಾನ್ಸಲರ್ ಮಾತನಾಡ್ಬೇಕಾದ್ರೆ ಯೂತ್ಸ್ ನ ಕೇಳ್ತಾ ಇದ್ರು, ಯೋಗ ಮಾಡ್ತೀವಿ ಮಧ್ಯ ನಿಂತೋಗುತ್ತಲ್ಲ, ಅದಕ್ಕೆ ಏನಾದ್ರು ಸೊಲ್ಯೂಷನ್ ಕಂಡಿದ್ದೀವಿ ರಿಸರ್ಚ್ ಮಾಡಿ ಅಂತ. ಸೊಲ್ಯೂಷನ್ ಒಮ್ಮೆ ಹೃದಯಕ್ಕೆ ಹೋಗಿದ್ರೆ ಬಹುಶಃ ಅದು ನಿಲ್ಲೋದಿಲ್ಲ. ಹೃದಯದ ಬಡಿತ ಜೊತೆಗೆ ಯೋಗದ ಬಡಿತವೂ ಕೂಡ ದಿನ ಪ್ರತಿ ಬೆಳಗಿನ ಜಾವ ಸಂಜೆಗೆ ನೆಟ್ಟಿದೆ ನಾನು ವೈಯಕ್ತಿಕ ಭಾವಿಸ್ತಾ. ಸೊ ಇನ್ ದಿಸ್ ಬ್ಯೂಟಿಫುಲ್ panel discussion, so with us Dr. Anjanaya Murthy sir, Joint Director, Department Ayush. Sir, once again we heartily welcome you for this session. And with us Dr. Sita Lakshmi Madam, a former Director of Medical Education, Government of Karnataka. ಬಹುಶಃ ಇವರು ಡಾಕ್ಟರ್ ಸೀತಾ ಲಕ್ಷ್ಮಿನಕ್ಕಿನ್ನ ಯೋಗದ ಅಮ್ಮ ಅಂತ ಕರೆದ್ರೆ ಬಹುಶಃ ಅದಕ್ಕೊಂದು ಅರ್ಥ ಆಗ್ತದೆ ಅಂತ ನಾನು ವೈಯಕ್ತಿಕವಾಗಿ ಭಾವಿಸ್ತಾ, ಅಮ್ಮ ನಿಮಗೆ ಕೊನೆಯ ಅಂತಿಮ ಘಟ್ಟದ ಈ ಒಂದು ಶಿಶಿಗೆ ಆತ್ಮೀಯವಾಗಿ ಹೃದಯಪೂರ್ವಕ ಸ್ವಾಗತ. And with us Dr. Ravi Shankar sir. Sir, heartily welcome to you sir. And with us Dr. Veena madam, the cardiologist, so SJICS sir, welcome to you ma'am. And then Dr. Harish sir with us, welcome to you sir, Deputy Director is Yoga. Idi ಕಾರ್ಯಕ್ರಮದ Dr. Guru Prasad sir, welcome to you sir. Dr. Devraj sir, so welcome to you. And Dr. Bhavya madam, welcome to you madam. ಅಂದ್ರೆ ಸ್ಟೆಥೋಸ್ಕೋಪ್ ಇಲ್ಲ ಅಂದ್ರೆ ನಮ್ಗೆ ಐಡೆಂಟಿಫಿಕೇಶನ್ ಮಾಡಕ್ ಕಷ್ಟ ಆಗ್ಬೇಕು. ದಟ್ ಇಸ್ ದ ವೀಕ್ನೆಸ್ ಆಫ್ ಅಸ್. ಯಾಕಂದ್ರೆ ಆಗಿದೆ, ಮೇಸ್ಟ್ರು ಅಂದ್ರೆ ಚಾಕ್ ಪೀಸು, ಪ್ರಿನ್ಸಿಪಲ್ ಅಂದ್ರೆ ಗ್ರೀನ್ ಕಲರ್ ಪೆನ್ ಇರ್ಬೇಕು, ಡಾಕ್ಟರ್ ಅಂದ್ರೆ ಸ್ಟೆಥೋಸ್ಕೋಪ್ ಇರ್ಬೇಕು, ಇಂಜಿನಿಯರ್ ಅಂದ್ರೆ ಟೇಪ್ ಇಟ್ಕೊಂಡಿರ್ಬೇಕು ಅಂತ ಈ ದೇಶ ನಮಗೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಬಳುವಳಿ. ಓಕೆ, ಇಡೀ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬಹುಶಃ 1 ತಿಂಗಳ ಹಗಲು ರಾತ್ರಿ ಕಷ್ಟಪಟ್ಟು ಈ ಕಾರ್ಯಕ್ರಮದ ಉಸ್ತುವಾರಿ ಸಚಿವರಾಗಿರ್ತಕ್ಕಂತಹ ಸನ್ಮಾನ್ಯ ಲಕ್ಷ್ಮಣ ಶಣೈರವರು ಇದನ್ನ ಈ ಕಾರ್ಯಕ್ರಮ, ಐ ರಿಕ್ವೆಸ್ಟ್ ಡಾಕ್ಟರ್ ಲಕ್ಷ್ಮಣ ಶಣೈ to do the moderate responsibility for this session, and welcome to very patiently listening everyone. Another 45 minutes please ನಮ್ಮ ಜೊತೆ ಹಂಚ್ಕೊಳ್ಳಿ. ಈಗ ಸೆಷನ್ ನಿಮ್ದು, ನೀವೇನಾದ್ರು ಪ್ರಶ್ನೆ ಕೇಳಿದ್ರೆ ಇಲ್ಲಿ ಉತ್ತರ ಹೇಳಕ್ಕೆ ಘಟಾನುಘಟಿ ಡಾಕ್ಟರ್ಸ್ ಕೂತಿದ್ದಾರೆ, ದಯಮಾಡಿ ಇದನ್ನ ಸದುಪಯೋಗ ಪಡಿಸ್ಕೊಳ್ಳಿ ಅಂತ ವೈಯಕ್ತಿಕ. ಥ್ಯಾಂಕ್ ಯು.
So once again, so all of you are sleepy or alive? Awake or alive? Okay. The thing is that I wanted to test whether you are alive or awake. Yoga nadige. Okay, now, so I am having 2 of my lieutenants. One is Vinushree. She will ask questions from here. So you have to go there and take the questions. And other side, Shilpa Shri, Dr. Shilpalata. So you have to, we will give you 1 mic. Okay, give her 1 mic. So the audience will throw the questions on panelist. 1 more mic is here. Okay. 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 So Shilpalata, you have to see. Now, who will ask first question? First question, you will get 1 reward here itself. Okay. The first question. Question, okay. Bhavya, the question, I got it here. International yoga protocol is designed and developed by Government of Karnataka. Whether it helps cardio yoga or not. You can explain the international protocol also.
ನಮಸ್ಕಾರ ಎಲ್ರಿಗೂ. ಎಲ್ರು ಯೋಗ ಡೇ ಪ್ರೋಟೋಕಾಲ್ ಫಾಲೋ ಮಾಡಿದ್ದೀರಾ ಅಂತ ಅನ್ಕೊಳ್ತೀವಿ. ಸೊ ಅದರಲ್ಲಿ ನಮಗೆ ಆಸನಗಳಿರುತ್ತೆ, ಮತ್ತೆ ಪ್ರಾಣಾಯಾಮ ಇದೆ, ಮತ್ತೆ ಕೆಲವೊಂದು ಮುದ್ರೆಗಳನ್ನು ಇದೆ. ಈ ಆಸನಗಳನ್ನ ಮಾಡೋದಕ್ಕಿಂತ ಮುಂಚೆ, ಯೋಗಾಭ್ಯಾಸದ ಆಸನಗಳನ್ನ ಮಾಡೋದಕ್ಕಿಂತ ಮುಂಚೆ ಕೆಲವೊಂದು ಪ್ರಿಲಿಮಿನರಿ ಪ್ರಾಕ್ಟೀಸ್ ಆಗಿ ಲೂಸನಿಂಗ್ ಎಕ್ಸಸೈಸಸ್ ತರ ಶಿಥಿಲೀಕರಣ ವ್ಯಾಯಾಮಗಳನ್ನು ಅದರಲ್ಲಿ ಸೇರ್ಕೊಂಡಿದೆ. ಸೊ ಹಾಗಾಗಿ ಇದರಲ್ಲಿ ಬಹಳ ಸಿಂಪಲ್ ಆಗಿ ಎಲ್ಲರೂ ಸಹ ಮಾಡಬಹುದಾದಂತ ಆಸನಗಳನ್ನ ಇಲ್ಲಿ ಕುಲಂಕುಷವಾಗಿ ಯೋಚಿಸಿ ಮತ್ತೆ ಅದರ ಲಾಭಗಳನ್ನ, ಪ್ರಯೋಜನಗಳನ್ನ ಮತ್ತೆ ಯಾರಿಗೂ ಹಾನಿ ಆಗದೆ ಇರೋ ಹಾಗೆ ಸುಲಭವಾಗಿ ಎಲ್ಲರೂ ಸಹ ಎಲ್ಲ ಒಂದು ವಯೋಮಿತಿಯವರನ್ನು ಸಹ ಮಾಡುವಂತ ರೀತಿನಲ್ಲಿ ಈ ಒಂದು ಪ್ರೊಸೀಜರ್ಸ್ ನ ಮಾಡಿದ್ದಾರೆ. ಸೊ 10 ವರ್ಷಗಳ ಕಾಲದಿಂದ ನಾವು ಎಲ್ಲರೂ ಇದನ್ನ ಅಭ್ಯಾಸ ಮಾಡ್ಕೊಂಡೇ ಬಂದಿದ್ದೀವಿ. ಮೊದಲನೇದಾಗಿ ಕುತ್ತಿಗೆ ವ್ಯಾಯಾಮ, ಭುಜಗಳ ವ್ಯಾಯಾಮ, ಕೈಗಳ ಚಾಲನೆ ಇರುತ್ತೆ, ಸೊಂಟ ಟ್ವಿಸ್ಟಿಂಗ್ ಇರುತ್ತೆ, ಮತ್ತೆ ಬ್ಯಾಕ್ ಸ್ಟ್ರೆಚಿಂಗ್ಸ್ ಇರುತ್ತೆ, ಫಾರ್ವರ್ಡ್ ಬ್ಯಾಕ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ಸ್ ಇರುತ್ತೆ, ಮತ್ತೆ ಮೊಣಕಾಲು ಹಾಗೆ ಆಂಕಲ್ಸ್. ನೋಡಿ, ಹೀಗೆ ಆರ್ಡರ್ ನಲ್ಲಿ ಸಹ ಅದನ್ನ ಲೂಸನಿಂಗ್ ಎಕ್ಸಸೈಸಸ್ ನ ಮಾಡಿದ್ದಾರೆ. ವೆರಿ ಸಿಂಪಲ್. ಅದನ್ನ ಕಾರ್ಡಿಯಾಕ್ ಪರ್ಸನ್ಸ್ ಸಹ ಮಾಡ್ಕೋಬಹುದು. BP ವೇರಿಯೇಷನ್ಸ್ ಇರೋರು, ಹೈ ಅಥವಾ ಲೋ ಇದ್ದವರು ಮಾಡ್ಬೋದು. ಅದೇ ರೀತಿ ಡಯಾಬಿಟಿಕ್ ಅವರು ಮಾಡ್ಬೋದು. ಎಲ್ಲ ವಯೋಮಿತಿಯವರು ಮತ್ತೆ ಎಲ್ಲಾ ತರದವರು ಈ ಸಿಂಪಲ್ ಒಂದು ವಿತ್ ಬ್ರೀದಿಂಗ್, ಅದರಲ್ಲಿ ಬ್ರೀದಿಂಗ್ಗೆ ಹೆಚ್ಚಾಗಿ ಒತ್ತನ್ನು ಕೊಟ್ಟು ಇದನ್ನ ತಯಾರು ಮಾಡಿರ್ತಾರೆ. ಸೊ ಹಾಗಾಗಿ ಇಲ್ಲಿ ನಮಗೆ ಫಿಸಿಕಲ್ ಒಂದು ಪೊಸಿಷನ್ ಆಗಿರ್ಬೋದು, ಬ್ರೆತ್ ಆಗಿರ್ಬೋದು, ಅವೇರ್ನೆಸ್ ಆಗಿರ್ಬೋದು, ಈ ಮೂರನ್ನು ದೃಷ್ಟಿನಲ್ಲಿ ಇಟ್ಕೊಂಡು, ಒಂದು ಪ್ರಜ್ಞೆನಲ್ಲಿ ಇಟ್ಕೊಂಡು ಎಲ್ರಿಗೂ ಸಹಾಯ ಆಗ್ಲಿ ಅಂತ ಹೇಳಿ ಈ ರೀತಿ ಒಂದು ಯೋಗಾಭ್ಯಾಸದ ಒಂದು ಪ್ರೋಟೋಕಾಲ್ ಅನ್ನು ತಯಾರು ಮಾಡಿರ್ತಾರೆ. ಯೋಗಾಭ್ಯಾಸಗಳಲ್ಲೂ ಸಹ ಮೊದಲನೇದಾಗಿ ನಿಮಗೆ ತಾಡಾಸನ ಇರುತ್ತೆ, ವೃಕ್ಷಾಸನ ಇರುತ್ತೆ, ನಿಮಗೆ ಸೈಡ್ ವರ್ಡ್ ಬೆಂಡಿಂಗ್, ಟ್ರಯಾಂಗಲ್ ಪೋಸ್ ಏನ್ ಹೇಳ್ತೀವಿ, ತ್ರಿಕೋಣಾಸನ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನು ನೋಡ್ಕೋಬಹುದು. ಸೈಡ್ ಆಂಗಲ್ ಸ್ಟ್ರೆಚಸ್, ಬಾಡಿ ಪೋಸ್ಟೀರಿಯರ್ ಪಾರ್ಟ್ ಆಫ್ ದ ಬಾಡಿ ಸ್ಟ್ರೆಚ್ ಆಗ್ತಾ ಇದೆ, ಬೆಂಡಿಂಗ್ ಆಗ್ತಾ ಇದೆ, ಸೈಡ್ ವರ್ಡ್, ಫಾರ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಆಗ್ತಿದೆ, ಬ್ಯಾಕ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಆಗ್ತಾ ಇದೆ. ಇದೇ ರೀತಿ ಎಲ್ಲ ಆಸನಗಳನ್ನ ತುಂಬಾ ಸಿಂಪಲ್ ಆಗಿ ಮಾಡುವಂತ ಆಸನಗಳನ್ನೇ ಮಾಡಿದ್ದಾರೆ. ಇದರಲ್ಲಿ ಫಾರ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಅಂತ ನಾವೇನ್ ಹೇಳ್ತೀವಿ, ಫಾರ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಆಸನ ಯಾವುದು? ಹಸ್ತವನ್ನ ಪಾದದ ಹತ್ರ ಮುಂದಕ್ಕೆ ಬಾಗಿ ತಾಗಿಸುವಂತದ್ದು. ಈ ಒಂದು ಆಸನ ಕಾರ್ಡಿಯಾಕ್ ಪೇಷಂಟ್ಸ್ ನಲ್ಲಿ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಕ್ರಿಯೇಟ್ ಆಗುತ್ತೆ, ಅಥವಾ ಹಾರ್ಟ್ ಮೇಲೆ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಮಾಡೋದ್ರಿಂದ, ಸಡನ್ ಆಗಿ ಬ್ಲಡ್ ರಶ್ ಆಗೋದ್ರಿಂದ ಈ ಆಸನ ಮಾಡಬಾರ್ದು ಅಂತ ನಾವು ಹೇಳ್ತೀವಿ. ಸೊ ಹೈ BP ಇದ್ದವರು ಮತ್ತೆ ಕಾರ್ಡಿಯಾಕ್ ರಿಲೇಟೆಡ್ ಇದ್ದವರು ಈ ಒಂದು ಆಸನ, ಫಾರ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಆಸನ ಒಂದನ್ನು ಬಿಟ್ಟು ಬೇರೆ ಎಲ್ಲದನ್ನೂ ನಾವು ಅದರಲ್ಲಿ ಅಭ್ಯಾಸ ಮಾಡ್ಕೊಂಡು ಹೋಗ್ಬೋದು. ಕೂತು ಮಾಡೋದ್ರಲ್ಲೂ ಅಷ್ಟೇ ವಕ್ರಾಸನ ಇದೆ, ಅದರಲ್ಲಿ ದಂಡಾಸನ ಇದೆ, ಮತ್ತೆ ನಮ್ಗೆ ಮಂಡುಕಾಸನ ಇದೆ, ಶಶಂಕಾಸನ ಇದೆ. ವೆರಿ ಗುಡ್ ಫಾರ್ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಅಂಡ್ ಟೆನ್ಷನ್ ರಿಲೇಟೆಡ್ ಥಿಂಗ್ಸ್. ಸೊ ಈ ಎಲ್ಲ ಆಸನಗಳನ್ನ ನಾವು ಒಂದೊಂದಾಗಿ ನೋಡ್ತಾ ಹೋದ್ರೆ ಅದು ಮಾಡಿಸಿದ್ದು ಹಾರ್ಟ್ ಅಂದ್ರೆ ಕಾರ್ಡಿಯಾಕ್ ಮತ್ತೆ ಡಯಾಬಿಟಿಕ್ ಅಂತಾನೆ ಹೇಳ್ತಾ ಹೋಗ್ಬೋದು. ಬಹಳ ಸಿಂಪಲ್ ಆಗಿದೆ, ಬಹಳ ಎಫೆಕ್ಟಿವ್ ಆಗಿದೆ, ಮತ್ತೆ ನಿಧಾನವಾಗಿ ಅದನ್ನ ಅಭ್ಯಾಸ ಮಾಡ್ತಾ ಹೋದ್ರೆ ತುಂಬಾನೇ ಅದು ಬೆನಿಫಿಷಿಯಲ್ ಆಗಿರುತ್ತೆ. ಎಕ್ಸೆಪ್ಟ್ ಫಾರ್ವರ್ಡ್ ಬೆಂಡಿಂಗ್ ಆಸನ ಅಂಡ್ ಕಪಾಲಭಾತಿ, ಇನ್ನ ಯೋಗ ಪ್ರೋಟೋಕಾಲ್ ನಲ್ಲಿ ಪ್ರತಿಯೊಂದು ಆಸನನ್ನು ನಾವು ಮಾಡ್ತಾ ಹೋಗ್ಬೋದು. ಅದರಲ್ಲಿ ಯಾವುದೇ ರೀತಿಯ ತೊಂದರೆ ಆಗೋದಿಲ್ಲ. ಮತ್ತೆ ಕಾರ್ಡಿಯಾಕ್ ಪೇಷಂಟ್ಸ್ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋಕ್ಕಿಂತ ಮುಂಚೆ ಒಂದು ಯೋಗ ಅಡ್ವೈಸ್, ಅಥವಾ ಯಾರು ಯೋಗ ಪರಿಣಿತರು ಇರ್ತಾರೆ ಅಥವಾ ಡಾಕ್ಟರ್ ಅಡ್ವೈಸ್ ತಗೊಂಡು ಮುಂದಕ್ಕೆ ಹೋಗೋದು ಬಹಳ ಎಸೆನ್ಷಿಯಲ್ ಅಂತ ಹೇಳಿ ಈ ಸಮಯದಲ್ಲಿ ಹೇಳೋದಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಥ್ಯಾಂಕ್ ಯು ಸರ್.
Do you want to elaborate it? Because he is from Department of Ayush, Director, Deputy Director, and he is the man who is behind all these protocols for Government of India.
So ಈ ಇದರಲ್ಲಿ ಡಾಕ್ಟರ್ ಭವ್ಯ ಅವರು ಹೇಳಿದ್ದನ್ನ ಐ ವಾಂಟ್ ಟು ಟೇಕ್ ಇಟ್ ಲಿಟಲ್ ಫಾರ್ವರ್ಡ್. ಸೊ ಯೋಗದಲ್ಲಿ ಸ್ಥಿರಂ ಸುಖಂ ಆಸನಂ ಅಂತ ಹೇಳ್ತೇವೆ. ವಿಚ್ ಎವರ್ ಈಸ್ ಕಂಫರ್ಟಬಲ್, ವಿಚ್ ಗಿವ್ಸ್ ಯು ಕಂಫರ್ಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸನ. ಸೊ ಎಲ್ಲರಿಗೂ ಎಲ್ಲ ಆಸನಗಳು ಪ್ರಾಣಾಯಾಮವನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಬೇಕು ಅಂತ ಇಲ್ಲ. ಈ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಡೇ ಯೋಗ ಪ್ರೋಟೋಕಾಲ್ ಏನು ನಾವು ಕ್ರಿಯೇಟ್ ಆಗಿದೆ ಸೆಂಟ್ರಲ್ ಗೌರ್ಮೆಂಟ್ ಕಡೆಯಿಂದ, ಅದು ಎಲ್ಲರೂ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಬಹುದಾದಂತ ಒಂದು ಪ್ರೋಟೋಕಾಲ್. ಸೊ ಇದರಲ್ಲಿ ಈಗ ಇನ್ ಲೈಟ್ ಟುವರ್ಡ್ಸ್ ಕಾರ್ಡಿಯಾಲಜಿ, ನಮ್ಮ ಹಾರ್ಟ್ಗೆ ಸಂಬಂಧಪಟ್ಟಾಗೆ, ಹಾರ್ಟ್ ಪೇಷಂಟ್ಸ್ಗೆ ಸಂಬಂಧಪಟ್ಟಾಗೆ ಈ ಎಲ್ಲ ಪ್ರೋಟೋಕಾಲ್ಸ್ ಅನ್ನು ಅದರಲ್ಲಿ ಭವ್ಯ ಅವರು ಈಗಾಗಲೇ ಹೇಳಿದ್ರು, ಒಂದು 2-3 ಪ್ರಾಕ್ಟೀಸಸ್ ಅನ್ನ ನಾವು ಅವಾಯ್ಡ್ ಮಾಡಿಕೊಂಡು ಬೇರೆ ಪ್ರಾಕ್ಟೀಸಸ್ ಅನ್ನ ನಾವು ಮಾಡುವಂಥದ್ದು. ಮತ್ತೆ ಈ ಇದರಲ್ಲಿ ಯೋಗಕ್ಕೆ ಮತ್ತೆ ಜನರಲ್ ಎಕ್ಸರ್ಸೈಸ್ಗೆ ದೇರ್ ಇಸ್ ಎ ಡಿಫರೆನ್ಸ್. ಇವತ್ತು ಬೆಳಗ್ಗೆ ನಮ್ಮ ಒಬ್ಬ ಸ್ಪೀಕರ್ ಮಾತಾಡ್ತಾ ಎಲ್ಲ ಕಡೆ ನಾವು ಜಿಮ್ಸ್ ನೋಡ್ತಾ ಇದ್ದೇವೆ, ಆದ್ರೆ ಈ ಯೋಗ ಶಾಲೆಗಳನ್ನ ತುಂಬಾ ಕಡಿಮೆ ಪ್ರಮಾಣದಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ದೇವೆ ಅಂತ ಹೇಳಿ. ಈ ಎಕ್ಸರ್ಸೈಸ್ಗೆ ಮತ್ತೆ ಯೋಗಕ್ಕೆ ಇರುವಂತ ಒಂದು ವ್ಯತ್ಯಾಸವನ್ನ ನಾವು ತಿಳ್ಕೊಂಡ್ರೆ ಅದರಲ್ಲೇನೆ ನಮ್ಗೆ ಉತ್ತರಗಳು ಸಿಗ್ತದೆ. ಸೊ ಯೋಗ ಈಸ್ ದ ಮೂಮೆಂಟ್ ಆರ್ ವಿತ್ ಅವೇರ್ನೆಸ್. ನಮ್ಮ ಒಂದು ಪೂರ್ತಿ ಅವೇರ್ನೆಸ್ ಅನ್ನ, ಇಟ್ ಈಸ್ ಇಂಟಿಗ್ರೇಟಿಂಗ್ ದಿ ಬಾಡಿ ಅಂಡ್ ಮೈಂಡ್. ಮನಸ್ಸನ್ನ ಮತ್ತೆ ನಮ್ಮ ಶರೀರವನ್ನು ಎರಡನ್ನು ಇಂಟಿಗ್ರೇಟ್ ಮಾಡಿಕೊಂಡು ಮಾಡುವಂತ ಕೆಲವೊಂದು ಪ್ರಾಕ್ಟೀಸಸ್ ಅನ್ನ ನಾವು ಇಟ್ಕೊಂಡಾಗ ಶರೀರದಲ್ಲಿ ತನಗೆ ತಾನೇ ಸಾಕಷ್ಟು ಫಿಸಿಯಲಾಜಿಕಲ್ ಚೇಂಜಸ್ ಆಗ್ತದೆ. ಯಾರಿಗೆ ಯಾವ ಪ್ರಾಕ್ಟೀಸಸ್ ಸೂಟ್ ಆಗ್ತದೆ ಅವುಗಳನ್ನ ನಾವು ಮಾಡ್ಬೇಕಾಗ್ತದೆ. ಇನ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಟು ಕಾರ್ಡಿಯಾಲಜಿ ಅಥವಾ ಹಾರ್ಟ್ ಪೇಷಂಟ್ಸ್ಗೆ ಸಂಬಂಧಪಟ್ಟಾಗೆ ಈ ಒಂದು ಕಪಾಲಭಾತಿ ಪ್ರಾಕ್ಟೀಸಸ್ ಅನ್ನ, ತುಂಬಾ ಸ್ಟ್ರೈನಿಯಸ್ ಪ್ರಾಕ್ಟೀಸಸ್ ಅನ್ನ ನಾವು ಅವಾಯ್ಡ್ ಮಾಡ್ಬೇಕಾಗ್ತದೆ. ಮೋರ್ ಆಫ್ ಪ್ರಾಣಾಯಾಮ, ದಟ್ಟು ಬ್ಯಾಲೆನ್ಸಿಂಗ್ ಪ್ರಾಣಾಯಾಮಸ್ ಅನ್ನ ಮಾಡುವಂಥದ್ದು, ಮತ್ತೆ ಮೋರ್ ಆಫ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್, ಈ ಒಂದು ಧ್ಯಾನವನ್ನ ಮಾಡುವಂಥದ್ದು ಅಥವಾ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಟೆಕ್ನಿಕ್ಸ್ ಇರುವಂತ ಏನು ಶವಾಸನ ಇರ್ಬೋದು, ಅಥವಾ ಇನ್ಸ್ಟೆಂಟ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಟೆಕ್ನಿಕ್, ಕ್ವಿಕ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಟೆಕ್ನಿಕ್ ಅಥವಾ ಡೀಪ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಟೆಕ್ನಿಕ್ ವಿತ್ ಅವೇರ್ನೆಸ್ ನಾವು ಮಾಡಿದಾಗ ನಮ್ಮ ಕಾರ್ಡಿಯಾಕ್ ಎಫಿಷಿಯನ್ಸಿ ಅನ್ನುವಂಥದ್ದು ಗ್ರಾಜುಯಲ್ ಆಗಿ ನಾರ್ಮಲೈಸ್ ಆಗ್ತದೆ ಮತ್ತೆ ಇಂಪ್ರೂವೈಸ್ ಆಗ್ತಾ ಹೋಗ್ತದೆ. ಸೊ ದಿಸ್ ಇಸ್ ವಾಟ್ ಐ ವಾಂಟ್ ಟು
industry. Any questions are there? Ask.
ನಮಸ್ತೆ ಎಲ್ರಿಗೂ. ನನ್ ಕ್ವಶನ್ ಏನಂತಂದ್ರೆ, ಈಗ ಒಂದು ಮನುಷ್ಯ ಆರೋಗ್ಯಕರ ಜೀವನ ಶೈಲಿನ ಫಾಲೋ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ಯಾವ್ದೇ ತರದ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಇರಲ್ಲ ಅಂಡ್ ಯಾವ್ದೇ ತರ ಹ್ಯಾಬಿಟ್ಸ್ ಕೂಡ ಇರಲ್ಲ, ಬಟ್ ಸ್ಟಿಲ್ ಅವ್ರಿಗೆ MI ಆಗಿರತ್ತೆ. ಇದಕ್ಕೆ ಕಾರಣ ಏನಂತ ಜಸ್ಟಿಫೈ ಮಾಡ್ಬೋದಾ?
Thank you for the question. I am a cardiologist. ಇದು ಟೆರ್ಷರಿ ಕೇರ್ ಹಾಸ್ಪಿಟಲ್. ಟೆರ್ಷರಿ ಕೇರ್ ಹಾಸ್ಪಿಟಲ್ ಅಂದ್ರೆ ಕಾಯಿಲೆ ಬಂದ ಮೇಲೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋ ಡಾಕ್ಟರ್ಸ್ ನಾವು. So ideally what would it be preferable is primary prevention, primordial prevention. Risk factors ಕೂಡ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ ಮಾಡೋದು, that is at your age, college level and school level, healthy practices, lifestyle and sattvic food as madam mentioned. Coming to your question, why does a person, ಈ ತುಂಬಾ gym related deaths ಬಗ್ಗೆ ಕೇಳ್ತಾ ಇದೀವಿ, fit people who have been doing the same training exercises suddenly dying heart attack ಅಂತ ಕೇಳ್ತಾ ಇದ್ದೇವೆ. ಇದು ಯಾವ ಕಾರಣಕ್ಕಾಗುತ್ತೆ? That is your precise question ಅಲ್ಲ?
Correct.
ನಮ್ದ್ರಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, ನಾವು ಹುಟ್ಟಾಗ್ಲಿಂದ ರಕ್ತನಾಳಗಳಲ್ಲಿ ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಅಂತ ಡೆವಲಪ್ ಆಗುತ್ತೆ. ದಟ್ ಸ್ಟಾರ್ಟ್ಸ್ ಅಟ್ ಬರ್ತ್. ಸೊ ಇದು ಬ್ಲಡ್ ಲೆವೆಲ್ ಕೊಲೆಸ್ಟ್ರಾಲ್ಗೆ ಸೀಮಿತವಾಗಿರೋದಿಲ್ಲ, ಇದು ರಕ್ತನಾಳದ ಲೈನಿಂಗ್ ಲೆವೆಲ್ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಡೆಪಾಸಿಟ್ಸ್. ಇದಕ್ಕೆ ನಾವು ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಅದು ಕ್ರಮೇಣವಾಗಿ ಅದರದ್ದು ಬಿಹೇವಿಯರ್, ಫಿಸಿಯಾಲಜಿಕಲ್ ಬಿಹೇವಿಯರ್ ಅಂದ್ರೆ ಅದು ಪ್ರೋಗ್ರೆಸ್ ಆಗೋದು. ನಾವು ಹೇಗೆ ವಯಸ್ಸಾಗ್ತಾ ಹೋಗ್ತೇವೋ ಹಾಗೆ ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಕೂಡ ಏಜ್ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ all of us will have some amount of fatty streaks. ಅದನ್ನ somebody who has had a genetic risk, ಅಂದ್ರೆ ತಂದೆ ತಾಯಿಯರಿಗೆ ಇಲ್ಲ ಕ್ಲೋಸ್ ರಿಲೇಟಿವ್ಸ್ಗೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ವಿತೌಟ್ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಬಂದ್ರೆ, ಸಾಧಾರಣವಾಗಿ ನಾವು ಪ್ರಿಮೆಚೂರ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಯಾವಾಗ ಅಂತ ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ, ಯೂಶಲಿ ಮೇಲ್ ಪೇಷಂಟ್ಸ್ ಅಲ್ಲಿ ಲೆಸ್ ದೆನ್ 60 years and ಮೇಲ್ ಅಲ್ಲಿ ಲೆಸ್ ದೆನ್ 50 years and ಫೀಮೇಲ್ಸ್ ಅಲ್ಲಿ ಲೆಸ್ ದೆನ್ 55 years. ಸಾಧಾರಣವಾಗಿ women are protected because of her reproductive menstrual cycles. The good estrogen protects the heart. But ಇದರಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, somebody who's had a genetic risk, ಅಂದ್ರೆ ತಂದೆ ಸೈಡ್ ಅಲ್ಲಿ ಇಲ್ಲ ಅಂದ್ರೆ ತಾಯಿ ಸೈಡ್ ಅಲ್ಲಿ ಯಾರಿಗೆ ಹಾರ್ಟ್ ಡಿಸೀಸ್ ಇರೋರಿಗೆ ಈ ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಅನ್ನೋದು ಬೇಗ ಪ್ರೋಗ್ರೆಸ್ ಆಗುತ್ತೆ. ಸೊ ಈವನ್ ಅಟ್ ದಟ್ ಯಂಗ್ ಅಡಲ್ಟ್ಸ್ 20s 30s ಅಲ್ಲೂ ಕೂಡ ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಡೆವಲಪ್ ಆಗುತ್ತೆ. ಸೊ ಇದು ಆಲ್ಮೋಸ್ಟ್ ಸಮ್ 20% 30% ಬ್ಲಾಕ್ ಆ ರೀತಿ ಇರುತ್ತೆ. ಸೊ ಇದು 20-30% ಬ್ಲಾಕ್ ಯಾವುದೇ ರೀತಿ ಫಿಸಿಯೋಲಾಜಿಕಲಿ ಹೃದಯಕ್ಕೆ ರಕ್ತನಾಳ ಸೀಮಿತವಾಗಿ ಮಾಡೋದಿಲ್ಲ. ಇಟ್ ವಿಲ್ ನಾಟ್ ಕಾಸ್ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್ ಇಶ್ಯೂ. ನಾವು ಹಾರ್ಟ್ ಪೇನ್ ನ ಎಂಜೈನ್ ಅಂತ ಕರಿತೇವೆ. ಸೊ ಈ 20-30% ಬ್ಲಾಕ್ಸ್ ಎಲ್ಲ ಎಂಜೈನ್ ಎಲ್ಲ ಕಾಸ್ ಮಾಡೋದಿಲ್ಲ. ನಾರ್ಮಲ್ ರೆಗ್ಯುಲರ್ ಆಕ್ಟಿವಿಟೀಸ್ ನಿಮ್ ತರ ವಾಕಿಂಗ್, ಕ್ಲೈಂಬಿಂಗ್ ಎಲ್ಲ ಮಾಡಕ್ ಸಾಧ್ಯ ಆಗುತ್ತೆ. ಬಟ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಸಂಬಡಿ ಹೂಸ್ ನಾಟ್ ಯೂಸ್ ಟು ದ ಆಕ್ಟಿವಿಟೀಸ್, ಯಾವತ್ತೂ ಮಾಡ್ದಲೆ ಇವತ್ತು ಹೋಗ್ಬಿಟ್ಟು ನಾನು ಚಾಮುಂಡಿ ಬೆಟ್ಟ ಹತ್ತತೀನಿ, ಮೌಂಟ್ ಎವರೆಸ್ಟ್ ಹತ್ತತೀನಿ, ಅಭ್ಯಾಸ ಇಲ್ದಲೆ ಇರೋ ಕೆಲಸಗಳನ್ನ ಕಂಡೀಷನ್ ಮಾಡ್ದಲೆ ಹಾರ್ಟ್ ನ ಹೋಗಿ ಮಾಡಿದಾಗ ಈ ಫ್ಯಾಟಿ ಸ್ಟ್ರೀಕ್ಸ್ ಏನಾಗುತ್ತೆ, ಒಂದೇ ಸಲ ವಾಲ್ಕೆನೋ ತರ ಹೊಡ್ಕೊಳ್ಳುತ್ತೆ. ಅದು ಪಿಂಪಲ್, ಒಂದು ದೇಹದ ಮೇಲೆ ಸ್ಕಿನ್ ಮೇಲೆ ಪಿಂಪಲ್ ಹೊಡ್ಕೊಂಡಂಗೆ ಅದು ಹೊಡ್ಕೊಳ್ಳುತ್ತೆ. ಅದು ಹೊಡ್ಕೊಂಡಾಗ ಏನಾಗುತ್ತೆ, ಆಟೋಮ್ಯಾಟಿಕ್ ಆಗಿ ಗಾಯ ಹೊಡ್ಕೊಂಡಾಗ ಏನಾಗುತ್ತೆ, ಬ್ಲಡ್ ಬಂದು ಕೊನೆಗೆ ಕ್ಲಾಟ್ ಆಗುತ್ತೆ. ಈವನ್ ಔಟ್ಸೈಡ್ ನಿಮ್ದು ಗಾಯಗಳು ಆದಾಗ್ಲೂ ಕೂಡ ಕ್ಲಾಟ್ ಆಗೋದು ಸಹಜವಾದ ಒಂದು ಫಿಸಿಯೋಲಾಜಿಕಲ್ ರೆಸ್ಪಾನ್ಸ್. ಸೊ ಹೃದಯ ರಕ್ತನಾಳದೊಳಗಳು ಕೂಡ ಅದು ವಾಲ್ಕೆನೋ ತರ ಈ ಲಿಪಿಡ್ ಪ್ಲಾಕ್ಸ್ ರಪ್ಚರ್ ಆದಾಗ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ದೇಹದಲ್ಲಿರೋ ಎಲ್ಲ ಕ್ಲಾಟ್ ಬಂದು ಅಲ್ಲಿ ಕೂತ್ಕೊಳ್ಳುತ್ತೆ. ಸೊ ದಟ್ ಈಸ್ ವೆನ್ ಇವನ್ 20-30% ಬ್ಲಾಕ್ಸ್ ಸಡನ್ ಆಗಿ ಬ್ಲಾಕ್ ಆಗಿ, ಎನಿ ರಕ್ತನಾಳ ಸಡನ್ ಆಗಿ ಬ್ಲಾಕ್ ಆದಾಗ ಆ ಯಾವ್ದು ಅಂಗಾಂಗ ಸಪ್ಲೈ ಮಾಡುತ್ತೋ ಅದಕ್ಕೆ ಬ್ಲಡ್ ಸಪ್ಲೈ ಇಲ್ದರೆ ಅದಕ್ಕೆ ಇನ್ಫಾಕ್ಷನ್ ಆಗುತ್ತೆ. ಬ್ರೈನ್ಗೆ ಕಟ್ ಆಫ್ ಆದಾಗ ಅದಕ್ಕೆ ಸ್ಟ್ರೋಕ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಹೃದಯಕ್ಕೆ ಕಟ್ ಆಫ್ ಆದಾಗ ಅದನ್ನ ಮಯೋಕಾರ್ಡಿಯಲ್ ಇನ್ಫಾಕ್ಷನ್, ಇಲ್ಲ ಅಂದ್ರೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಸೊ ಅಂಡ್ ವಾಟ್ ಇಸ್ ವೆರಿ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಅಬೌಟ್ ದೀಸ್ ಲಿಪಿಡ್ ಪ್ಲಾಕ್ಸ್ ಅಂದ್ರೆ ಇದು ಅರಿಥಮೆಟಿಕ್ ಪ್ರೋಗ್ರೆಷನ್ ತರ ಹೋಗೋದಲ್ಲ. 20% ಇರೋದು 25 ಆಗಿ 30 ಆಗಿ 35 ಆಗ್ಬೇಕು ಅಂತಿಲ್ಲ. 20 can become 70, 70 can become 100 anytime. ಸೊ ಆ ಕಾರಣಕ್ಕೆ ನಾವು ವಾಟ್ ಇಸ್ ಬೀಂಗ್ ರಿಇನ್ಫೋರ್ಸ್ಡ್, ಲೈಫ್ ಸ್ಟೈಲ್, ಹೆಲ್ತಿ ಫುಡ್, ಎಕ್ಸಸೈಸ್. ಸಾಧಾರಣವಾಗಿ ನಮ್ ಅಲೋಪತಿಕ್ ಮೆಡಿಸಿನ್ ಅಲ್ಲಿ ನಾವು ಯೂಶಲಿ ಫಾಲೋ ಮಾಡೋದು ಯುರೋಪಿಯನ್ ಗೈಡ್ಲೈನ್ಸ್ ಅಂಡ್ ಅಮೆರಿಕನ್ ಗೈಡ್ಲೈನ್ಸ್. ಇಂಡಿಯನ್ ಗೈಡ್ಲೈನ್ಸ್ ಕೂಡ ಈಗ ಲಿಪಿಡ್ ಗೈಡ್ಲೈನ್ಸ್ ಬರ್ತಾ ಇದೆ. ಇಂಡಿಯನ್ ಕಾರ್ಡಿಯಾಲಜಿ ಇಸ್ ಆಲ್ಸೋ ಗೆಟಿಂಗ್ ಇನ್ ಟು ಗ್ಲೋಬಲ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ಸ್ ನಾವು. ಇಂಡಿಯನ್ ಸೀಮಿತವಾಗಿ ನಮ್ಗೆ ಇಂಡಿಯನ್ಸ್ ಅಲ್ಲಿ ಸಪರೇಟ್ ಗೈಡ್ಲೈನ್ಸ್ ಬಂದಿದ್ದಾವೆ. ಲಿಪಿಡ್ ಗೈಡ್ಲೈನ್ಸ್ ಕೂಡ ಸಪರೇಟ್ ಇದೆ, ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಗೈಡ್ಲೈನ್ಸ್ ಕೂಡ ಸಪರೇಟ್ ಇದೆ. ವೈ ಏನಕ್ಕೆ ಇಂಡಿಯನ್ಸ್ಗೆ ಸಪರೇಟ್ ಅಂದ್ರೆ, ಸಾಧಾರಣವಾಗಿ ವೆಸ್ಟರ್ನರ್ಸ್ಗೆ ಈ ತರ ಹೃದಯ ಕಾಯಿಲೆ ಬರೋದೇ 70-75 ವಯಸ್ಸಾದ್ಮೇಲೆ. ಅವ್ರ ಲೈಫ್ ಸ್ಪ್ಯಾನ್, ಯುರೋಪಿಯನ್ಸ್ ಲೈಫ್ ಸ್ಪ್ಯಾನ್, ಅಮೆರಿಕನ್ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ನೋಡಿದ್ರೆ ಸಾಧಾರಣವಾಗಿ 70 ಮೇಲೆ ಇರುತ್ತೆ. ಇಂಡಿಯನ್ ಆವರೇಜ್ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಈಸ್ ಅರೌಂಡ್ 60-65 ಆಯ್ತಾ. ಸೊ ನಮಗೆ ಕಾಯಿಲೆಗಳು, ಹೃದಯದ ಕಾಯಿಲೆಗಳು ಬರೋದು 10 years ಅರ್ಲಿ ಅಂತ 10 years ಬ್ಯಾಕ್ ಹೇಳ್ತಾ ಇದ್ರು. ಈಗ ಅದು ವಾಸ್ತುಸ್ಥಿತಿ ಏನಾಗಿದೆ ಅಂದ್ರೆ 20 years ಅರ್ಲಿ ಅಂತ. ವಿ ಡು ಇಂಟರ್ವೆನ್ಷನ್ಸ್, ನಾವು ಕೂಡ ಇಂಟರ್ವೆನ್ಷನ್ ಮಾಡ್ತೇವೆ. ಅಂದ್ರೆ ಹೃದಯಾಘಾತ ಆಗಿ ಬರೋ ಪೇಷಂಟ್ಸ್ಗೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಎಂಜಿಯೋಗ್ರಾಮ್ ಮಾಡ್ತೇವೆ. ಎಂಜಿಯೋಗ್ರಾಮ್ ಅನ್ನೋದು ನೀವು ಶುಗರ್ಗೆ ಹೇಗೆ ಟೆಸ್ಟ್ ಮಾಡ್ತಿರೋ, ಬ್ಲಡ್ ಅಲ್ಲಿ ಶುಗರ್ ಇದೆಯಾ ಅಂತ ಹೇಳೋದಕ್ಕೆ, ಹಾಗೆ ಹೃದಯದಲ್ಲಿ ಬ್ಲಾಕ್ ಇದೆಯಾ ಅಂತ ವ್ಯಕ್ತಿಗೆ ಟೆಸ್ಟ್ ಮಾಡೋದಕ್ಕೆ ಒಂದು ರೀತಿ ಟೆಸ್ಟ್ ಅದು. ಅದು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಲ್ಲ, ಟೆಸ್ಟ್ ಅದು. ಹೃದಯದಲ್ಲಿ 3 ರಕ್ತನಾಳದಲ್ಲಿ ಯಾವ್ದಾದ್ರು ಒಂದ್ ಬಂದಾಯ್ತು ಅಂದ್ರೆ ಪೇಷಂಟ್ಗೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಅದರಲ್ಲಿ ಡಿಫ್ರೆಂಟ್ ಟೈಪ್ಸ್ ಆಫ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಇರುತ್ತೆ. ಕೆಲವರು 40% ಪೇಷಂಟ್ಸ್ ಡೋಂಟ್ ಸರ್ವೈವ್ ದ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್, ಆಸ್ಪತ್ರೆಗೇನೆ ಬರೋದಿಲ್ಲ. ದೇ ಡೈ ಆನ್ ದ ವೇ ಟು ಹಾಸ್ಪಿಟಲ್ ಆರ್ ದೇ ಡೈ ಇನ್ ದ ಹೌಸ್. ಸೊ ದ ಪಿಕಪ್ ರೇಟ್ ನಮಗೆ ಬರೋ ಪೇಷಂಟ್ಸ್ ವಿತ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಅಲ್ಲಿ ಡೆಸ್ಪೈಟ್ ಬೆಸ್ಟ್ ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆದ್ರೂ ಕೂಡ ಇನ್ ಹಾಸ್ಪಿಟಲ್ ಮಾರ್ಟಾಲಿಟಿ ಅಂತ ಏನ್ ಹೇಳ್ತೇವೆ ಅಪ್ ಟು 10-15% ಇರುತ್ತೆ. ಅದರಲ್ಲಿ ಸ್ಟೇಜಸ್ ಆಫ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಕೂಡ ಇರುತ್ತೆ. ಸ್ಟೇಜ್ 1, 2, 3, 4 ಅಂತ. ಶಾಕ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಶಾಕ್ ಅಂದ್ರೆ ಪೇಷಂಟ್ಗೆ ಪಲ್ಸ್ ಇರೋದಿಲ್ಲ, BP ಇರೋದಿಲ್ಲ. ಆ ತರ ಬರೋರಲ್ಲಿ ಮಾರ್ಟಾಲಿಟಿ ಇಸ್ 50%. ಅಂದ್ರೆ 10 ಜನ ಶಾಕ್ ಆಗಿ ಬಂದ್ರೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗಿ 50 ಜನ ಡೆಸ್ಪೈಟ್ ಆಲ್ ಯುವರ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಬೆಸ್ಟ್ ಎಫರ್ಟ್ಸ್ ವಿಲ್ ನಾಟ್ ಸರ್ವೈವ್. ಸೊ ಬೆಸ್ಟ್ ಥಿಂಗ್ ಟು ಡೂ ಇಸ್ ಪಿಕ್ ಅಪ್ ದ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್. ವೈ ಇಟ್ ಹ್ಯಾಪನ್ಸ್? ಮೋಸ್ಟ್ ಕಾಮನ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ನಮ್ ಸ್ಟಡೀಸ್ ಕೂಡ ಮಾಡಿರೋದ್ರಲ್ಲಿ ಡಯಾಬಿಟಿಸ್, ಹೈಪರ್ಟೆನ್ಷನ್, ಸ್ಮೋಕಿಂಗ್, ಈ 3 ಅಂಡ್ ಜೆನೆಟಿಕ್ ರಿಸ್ಕ್. ಈ 4ನ್ನ ಖಡಾಖಂಡಿತವಾಗಿ ಕಂಟ್ರೋಲ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಐ ವುಡ್ ಸಜೆಸ್ಟ್ ನಾವು ಕಾಲೇಜ್ ಲೆವೆಲ್ ಅಪ್ಲಿಕೇಶನ್ ಅಲ್ಲಿ ಒಂದು ಮೆಡಿಕಲ್ ಚೆಕ್ಅಪ್ ಅನ್ನು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ರೆ that will make a hell of a difference with respect to catching patients. Because when they come to us, this is a tertiary care. I'm already treating a disease. What should be targeted is they should not have disease. I hope I'm convincing enough. Any more doubts I can address.
Any questions? Vinu, you yourself has given 6 questions for me. You start your question.
Namaste everyone. My question is, heart attack ಆದಾಗ ಅಂತ ಅಂದ್ರೆ ಯಾರೇ ಒಬ್ಬರಿಗೆ ಏನೋ ಇಶ್ಯೂ ಇದೆ ಅಂತ ಅಂದ್ರೆ, ಬ್ಲಾಕ್ ಆಗಿದೆ ಅಂತ ಅಂದ್ರೆ ಕೆಲವೊಬ್ಬರಿಗೆ ಸ್ಟಂಟ್ ಹಾಕಿ ಟ್ರೀಟ್ ಮಾಡ್ತೀರಾ, ಕೆಲವೊಬ್ಬರಿಗೆ ಓಪನ್ ಹಾರ್ಟ್ ಸರ್ಜರೀಸ್ ಮಾಡಿ ಟ್ರೀಟ್ ಮಾಡ್ತೀರಾ. ಇದರಲ್ಲಿ ಎರಡೂ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ನಾವು ಪೋಸ್ಟ್ ಆಪರೇಟಿವ್ ಅಥವಾ ಪೋಸ್ಟ್ MI ಕ್ಯಾನ್ ವಿ ಅಡ್ವೈಸ್ ಯೋಗ, ಅಥವಾ ಓನ್ಲಿ ಫಾರ್ ಸ್ಟಂಟ್ ಹಾಕಿರೋರಿಗೆ ಮಾತ್ರ ಯೋಗ ಅಡ್ವೈಸ್ ಮಾಡ್ಬೋದಾ, ಅಂದ್ರೆ ಆಸನಗಳನ್ನ? ಓಪನ್ ಹಾರ್ಟ್ ಸರ್ಜರಿ ಆಗಿರೋರ್ಗೂ ಮಾಡಬಹುದು ಅಂತ ಅಂದ್ರೆ ಆಫ್ಟರ್ ಹೌ ಮೆನಿ ಡೇಸ್ ಆರ್ ಆಫ್ಟರ್ ಎನಿ ಪ್ರಿಕಾಷನ್, ಲೈಕ್ ಎಕ್ಸ್ಟ್ರಾ ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ರಿಕಾಷನ್ಸ್ ಏನಾದ್ರು ತಗೊಳ್ಬೇಕಾಗತ್ತಾ?
ಒಂದು ತಿಳ್ಕೊಳ್ಬೇಕಂದ್ರೆ ಯಾವ ಪೇಷಂಟ್ ಸ್ಟೆಂಟ್ ಹಾಕ್ತೇವೆ, ಯಾವ ಪೇಷಂಟ್ ಬೈಪಾಸ್ ಆಗುತ್ತೆ ಎಂಜಿಯೋಗ್ರಾಮ್ ಆದ್ಮೇಲೆ ಅಂತ. ಎಂಜಿಯೋಗ್ರಾಮ್ ನಾವು ಎಲ್ಲಾ ಹಾರ್ಟ್ ಫಂಕ್ಷನ್ ವೀಕ್ ಇದೆ ಅಂದ್ರೆ ಆ ಪೇಷಂಟ್ಸ್ಗಳನ್ನ ನಾವು ಬೈಪಾಸ್ ಸರ್ಜರಿಗೆ ಪ್ಲಾನ್ ಮಾಡ್ತೇವೆ. ಇರೋ ಎಲ್ಲಾ ಬ್ಲಾಕ್ಗೂ ಸ್ಟೆಂಟ್ ಈಸ್ ನಾಟ್ ಅನ್ ಆಪ್ಷನ್. ಬಟ್ ವಾಟ್ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಸ್ ರಕ್ತನಾಳ ಬಂದಾದಾಗ ಇಮಿಡಿಯೇಟ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆದಾಗ ತ್ರೀ ಡಿಫ್ರೆಂಟ್ ಟೈಪ್ಸ್ ಆಫ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್. ಒಂದು ಸ್ಟೆಮಿ ಅಂತ ಹೇಳ್ತೇವೆ, ಇನ್ನೊಂದು ಎನ್ಸ್ಟೆಮಿ ಅಂಡ್ ಅನ್ಸ್ಟೇಬಲ್ ಎಂಜಾನ ಅಂತ ಹೇಳ್ತೇವೆ. ಈ ಸ್ಟೆಮಿ ಅನ್ನೋದು ಈಸಿಯಾಗಿ ಪಿಕಪ್ ಆಗುತ್ತೆ. ಈ ಸ್ಟೆಮಿ ಇರೋ ಪೇಷಂಟ್ಸ್ಗೆ ಆಸ್ ಸೂನ್ ಆಸ್ ಯು ಓಪನ್ ಇಟ್, ದ ಸರ್ವೈವಲ್ ಆಫ್ ದ ಮಯೋಕಾರ್ಡಿಯಂ ಇಸ್ ದಟ್ ಮಚ್ ಮೋರ್. ಎಲ್ಲಿ ಟೈಮ್ ಇಸ್ ಎಸೆನ್ಸ್. ನೀವು ಎಷ್ಟು ಬೇಗ ಓಪನ್ ಮಾಡ್ತಿರೋ, ಎಷ್ಟು ಬೇಗ ಮೆಡಿಕಲ್ ಲೈನ್ ಆಫ್ ಬ್ಲಡ್ ಥಿನ್ನರ್ಸ್ ಕೊಡ್ತಿರೋ ಅಷ್ಟು ಬೇಗ ಅದು ಜಾಗ ಕೊಳಿದಲ್ಲೇ ಉಳ್ಕೊಳುತ್ತೆ. ಸೊ ಎಲ್ಲಾ 3 ದಿನ ಆದ್ಮೇಲೆ ನಾನು ಬೆಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತೀನಿ ಅಂದ್ರೆ ಗಿಡಕ್ಕೆ ಬಾಡೋಗಿ ಹೋಗಿರೋ ಗಿಡಕ್ಕೆ ನೀರು ಹಾಕ್ತಾ ಇದೆ. ಸೊ ಇಟ್ ವಿಲ್ ಬಿ ಆಫ್ ನೋ ಯೂಸ್. ಹಾರ್ಟ್ ವೀಕ್ ಆಗುತ್ತೆ. ಹಾರ್ಟ್ ವೀಕ್ ಆದಾಗ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆಗೋದು. ಪೇಷಂಟ್ ಹಾರ್ಟ್ ನ ಪಂಪಿಂಗ್ ನ EF ಅಂತ ಹೇಳ್ತೀವಿ, ಎಜೆಕ್ಷನ್ ಫ್ರಾಕ್ಷನ್. ಹಾರ್ಟ್ ಪಂಪ್ ಮಾಡಿದ್ರೆ ಮಾತ್ರ ನಮ್ಗೆ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಬರೋದು. ಸೊ ಹಾರ್ಟ್ ಪಂಪ್ ವೀಕ್ ಆದಾಗ ಪೇಷಂಟ್ಗೆ ಯಾವುದೇ ಅಂಗಾಂಗಗಳಿಗೂ ಬ್ಲಡ್ ಸಪ್ಲೈ ಅಷ್ಟು ಮಟ್ಟಿಗೆ ಆಗ್ತಿರೋದಿಲ್ಲ. ಸೊ ಸ್ವಲ್ಪ ನಡೆದ್ರು ಕೂಡ ಉಪ್ಸ ಬರೋದು, ಎಲ್ಲ ಲಂಗ್ ಕಂಜೆಷನ್ ಅಲ್ಲಿ ನೀರು ತುಂಬಿಕೊಳ್ಳೋದು, ಉಸಿರು ಕಷ್ಟ ಆಗೋದು, ಸಣ್ಣ ಪುಟ್ಟ ಕೆಲಸ ಮಾಡಕ್ ಆಗ್ದಲ್ಲೇ ಇರೋದು, ದಟ್ ಈಸ್ ರಿಲೇಟೆಡ್ ಟು ಹಾರ್ಟ್ ಫೇಲಿಯರ್. ನಿಮ್ ರಿಲೇಟೆಡ್ ಟು ಯೋಗ, ಯೂಶಲಿ ಪೋಸ್ಟ್ ಸ್ಟೆಂಟಿಂಗ್ ವಾಲ್ಸಾಲ್ವಾ ಮನೂವರ್ಸ್ ನಾವು ಸ್ವಲ್ಪ ಅವಾಯ್ಡ್ ಮಾಡ್ತೀವಿ. ಬಿಕಾಸ್ ಸ್ಟೆಂಟಿಂಗ್ ಪೊಸಿಷನ್ ಮಾಡಿರ್ಬೇಕಾದ್ರೆ ವೇಟ್ ಬೇಸ್ಡ್ ಮತ್ತೆ ಬ್ರೆತ್ ಹೋಲ್ಡಿಂಗ್ ನ ನಾವು ಅವಾಯ್ಡ್ ಮಾಡಕ್ ಹೇಳ್ತೇವೆ. ಅಂಡ್ ಬೇಸ್ಡ್ ಆನ್ EF, ಈ ಪಂಪಿಂಗ್ ಹೇಗಿದೆ ಅದ್ರ ಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಯೋಗ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಮೆಷರ್ಸ್ ನಾವು ಹೇಳೋದು. ಇಫ್ ಹಾರ್ಟ್ ಪಂಪಿಂಗ್ ಇಸ್ ಲೆಸ್ ದನ್ 35%, ಸಾಧಾರಣವಾಗಿ 55ರಿಂದ 70% ಈ ಪಂಪಿಂಗ್ ನಾವು ಹೇಳೋದು. EF ಅಂತ ಹೇಳ್ತೀವಿ, ಎಜೆಕ್ಷನ್ ಫ್ರಾಕ್ಷನ್ ಅಂತ. ಅದು ದೇಹದ ಔಟ್ಪುಟ್ ನ, ಕಾರ್ಡಿಯಾಕ್ ಔಟ್ಪುಟ್ ನ ಪಂಪ್ ಮಾಡೋ ಕೆಪಾಸಿಟಿ ಅದು. ಅದೇನಾದ್ರು 35%ಗಿಂತ ಕಡಿಮೆ ಇದೆ ಅಂದ್ರೆ ಸಿವಿಯರ್ EF ಲೋ ಇದೆ ಅಂತ ಹೇಳ್ತೇವೆ. ಅಂತವ್ರಿಗೆ ನಾವು ನಿಧಾನಕ್ಕೆ ಟ್ರೈನಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್, ಎಕ್ಸರ್ಸೈಸ್ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಪ್ರೋಗ್ರಾಮ್ ಹೇಳೋದು. Just walk around the house 1 to 2 months ಆದ್ಮೇಲೆ you get up to doing some kind of first level ground walking, ನಂತರ exercises ಅಂತ ಹೇಳ್ತೇವೆ. ವಾಲ್ಸಾಲ್ವಾ ಮನೂವರ್ಸ್, sexual intercourse ನ usually 4 weeks ಅವಾಯ್ಡ್ ಮಾಡಕ್ ಹೇಳ್ತೇವೆ if the patient has LV dysfunction. But if the patient LV is good, ಅಂದ್ರೆ ರಿಕವರಿ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಬ್ಲಡ್ ಥಿನ್ನರ್ಸ್ ಕೊಟ್ಟು ಇಲ್ಲ ಸ್ಟೆಂಟ್ ಹಾಕಿ ಓಪನ್ ಆಗಿದೆ, ರಕ್ತನಾಳ ಚೆನ್ನಾಗಿದೆ, ಹಾರ್ಟ್ ಫಂಕ್ಷನ್ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಅಂದ್ರೆ as early as possible they can get back to routine activities. ಪೋಸ್ಟ್ ಬೈಪಾಸ್ ಇಶ್ಯೂಸ್ ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಪೇಷಂಟ್ಗೆ ಚೆಸ್ಟ್ ಓಪನ್ ಮಾಡಿರ್ತಾರೆ. ಸೊ ಲಿಟ್ರಲಿ ಬೋನ್ ನ ಇಲ್ಲಿ ಸೆಂಟ್ರಲ್ ಬೋನ್ ನ ಸೂಚರ್ ಮಾಡಿರ್ತಾರೆ. ಆ ತರ ಪೇಷಂಟ್ಸ್ಗೆ ದೇ ಹ್ಯಾವ್ ಎಕ್ಸ್ಟ್ರೀಮ್ ಪೋಸ್ಟ್ ಆಪರೇಟಿವ್ ಪೇನ್ ಅಲ್ಲಿ ನಿಮ್ಗೆ ಎಕ್ಸರ್ಸೈಸ್, ಬೆಂಡಿಂಗ್ ಎಕ್ಸರ್ಸೈಸ್, ಸ್ಟ್ರೆಚಿಂಗ್ ಎಕ್ಸರ್ಸೈಸ್ ಕಷ್ಟ ಆಗುತ್ತೆ. ಬಟ್ ವಾಟ್ ಈಸ್ ಅಡ್ವೈಸ್ ಇಸ್ ಬ್ರೀತಿಂಗ್ ಎಕ್ಸರ್ಸೈಸಸ್. ಸೊ ಪೋಸ್ಟ್ ಬೈಪಾಸ್ ಪೇಷಂಟ್ಸ್ಗೆ ನಾವು ಬ್ರೀತಿಂಗ್ ಎಕ್ಸರ್ಸೈಸಸ್ ಆಸ್ ಅರ್ಲಿ ಆಸ್ ಪಾಸಿಬಲ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಯಾಕಂದ್ರೆ ಪೇನ್ ಇಂದ ಅವರು ಬ್ರೆತ್ ಇಂಟೇಕ್ ಸರಿಗೆ ಮಾಡ್ತಿರೋದಿಲ್ಲ. ಮತ್ತೆ ಲಂಗ್ ಕಂಜೆಷನ್, ಅಟೆಲೆಕ್ಟಾಸಿಸ್ ಇನ್ಫೆಕ್ಷನ್, ಲಂಗ್ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಎಲ್ಲ ತುಂಬಾ ಕಾಮನ್ ಇರುತ್ತೆ. ಸೊ ದ ಮೋರ್ ದೇ ಬ್ರೀತ್, ದ ರಿಸರ್ವಾಯರ್ ಗೆಟ್ಸ್ ಬೆಟರ್ ಆಫ್ ದ ಲಂಗ್ಸ್ ಅಂಡ್ ದ ರೆಕ್ಯುಪರೇಷನ್ ಇಸ್ ಆಲ್ಸೋ ಬೆಟರ್ ವಿತ್ ಪೋಸ್ಟ್ ಬೈಪಾಸ್ ಪೇಷಂಟ್ಸ್. ಸೊ ಪೋಸ್ಟ್ PTCA ಬೇಸ್ಡ್ ಆನ್ ಹೌ ದರ್ ಎಜೆಕ್ಷನ್ ಫ್ರಾಕ್ಷನ್ ಇಸ್, ದಟ್ ಇಸ್ ದ ಪಂಪಿಂಗ್ ಕೆಪಾಸಿಟಿ ಆಫ್ ದ ಹಾರ್ಟ್ ನೋಡ್ಕೊಂಡು ಎಕ್ಸರ್ಸೈಸ್ ಲೆವೆಲ್ ಪ್ರಿಸ್ಕ್ರೈಬ್ ಮಾಡೋದು. ಪೋಸ್ಟ್ ಬೈಪಾಸ್ ಪೇಷಂಟ್ಸ್ಗೆ ಬೇಸ್ಡ್ ಬ್ರೀದಿಂಗ್ ಎಕ್ಸರ್ಸೈಸಸ್ ಆಸ್ ಅರ್ಲಿ ಆಸ್ ಪಾಸಿಬಲ್ and based on again ejection fraction, continuation of physical and aerobic training. That's all. Thank you.
ವಿನು ಯಾರಾದ್ರೂ ಇದ್ದಾರಾ? ಕೇಳಮ್ಮ. ಡಾಕ್ಟರ್ ಅನಗ, she is practicing naturopathist and yoga practitioner.
Good evening to all the dignitaries. So I have 2 questions. So first question ಬಂದು, when we are practicing in a clinic, so small setups ಇದ್ದಾಗ, or when we are just doing consultations and when we get a lot of patients, So some patients come with, gastric pain but they will have radiating pain to the left arm and everything. Lower back pain irutte, ಅಥವಾ chest pain irutte. So symptoms MI ಮತ್ತೆ gastric ಎರಡು similar ಇರುತ್ತೆ. So my first question is, how do we differentiate? So ಯಾವ್ದು emergency condition ಅಥವಾ ಯಾವ್ದು which can be treated like a normal this thing?
Good question. Because a lot of times we see even general practitioners and physicians missing heart attack after doing ECG also. So ನಿಮಗೆ ಒಂದು ಬೇಸಿಕ್ ಟೆಸ್ಟ್ ಈಗ ಎಲ್ಲ ಕಡೆ ಸಿಗುವಂಥದ್ದು ಇನ್ಕ್ಲೂಡಿಂಗ್ ಪ್ರೈಮರಿ ಹೆಲ್ತ್ ಸೆಂಟರ್ಸ್ ಇಸ್ ECG. ECG ನಿಮಗೆ ಸಿವಿಯರ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಪಿಕಪ್ ಆಗುತ್ತೆ. ಪೇಷಂಟ್ ಫಸ್ಟ್ ಟೈಮ್ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಅಂತ ಬಂದ್ರೆ, ಯಾವತ್ತು ಲೈಫಲ್ಲೇ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಇಲ್ಲ, ಬಟ್ ಟುಡೇ ಐ ಆಮ್ ಹ್ಯಾವಿಂಗ್ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಅಂದ್ರೆ ಅದು ಯೂಶಲಿ ಆ ಥರ ಆಗೋದಿಲ್ಲ, ಮೇ ಬಿ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್. ಓಕೆ, ತುಂಬಾ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಇರೋರಿಗೆ ಕಂಟಿನ್ಯೂಡ್ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಇದೆ ಅಂದ್ರೆ ಬೆಸ್ಟ್ ಥಿಂಗ್ ಟು ಡೂ ಇಸ್ ಒನ್ ECG. ECG ನಿಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ ಅದು ವೆದರ್ ಇಟ್ ಇಸ್ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್ ಆರ್ ನಾಟ್. ಮೇ ಬಿ ದ ರೆಸ್ಟ್ ಆಫ್ ದ ಪ್ಯಾನಲ್ ಕ್ಯಾನ್ ಎಕ್ಸ್ಪ್ಲೈನ್ ವೈ ಅದು ಪೇನ್ ನಿಮ್ಗೆ ಲೆಫ್ಟ್ ಆರ್ಮ್ ಇಲ್ಲ. ಒಂದು ಕಾಮನ್ ಮಿಸ್ನಾಂಬರ್ ಅಂದ್ರೆ ಬರೀ ಎಡಗಡೆಗೆ ರೇಡಿಯೇಟ್ ಆಗುತ್ತೆ ಅಂತ. ಹೃದಯದ ಪೇನು ಎಡಗಡೆನೂ ಆಗ್ಬೋದು, ರೈಟ್ ಸೈಡು ಆಗ್ಬೋದು. ಜಾ ಕ್ಲಾಡಿಕೇಶನ್ ಅಂತ ಹೇಳ್ತೀವಿ, 5 to 10% ಕೇಸಸ್ ಅಲ್ಲಿ ಥ್ರೋಟ್ ಪೇನ್ ಬರುತ್ತೆ. That is a very specific symptom of heart problem. ನಡಿಬೇಕಾದ್ರೆ ಥ್ರೋಟ್ ಪೇನ್ ಅಂತ ಕೆಲವರು ಹೇಳ್ತಾರೆ, ಜಾ ಪೇನ್ ಬರುತ್ತೆ ಅಂತ. ಅದು ಆ ಥರ ಜಾ ಪೇನ್ ಇದೆ ಅಂದ್ರೆ ಹೇಗೆ ಡಾಕ್ಟರ್ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿದ್ರಿ ಅಂತ ಕೇಳ್ತಾರೆ ಕೆಲವು ಸಲ. ನೀವು ಯಾವ ಪೇನ್ ಇಲ್ದಲ್ಲ ಇದ್ರು ಜಾ ಪೇನ್ ಅಂತ ಹೇಳಿದಾಗ ನಡಿಬೇಕಾದ್ರೆ ದಟ್ ಇಸ್ ವೆರಿ ಸ್ಪೆಸಿಫಿಕ್ ಆಫ್ ಹಾರ್ಟ್ ಒಳಗಡೆ ರಕ್ತನಾಳದ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ. ಇನ್ನೊಂದು ಪೇನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಸ್ಪೆಸಿಫಿಕ್ ಪೇನ್ ಅಂದ್ರೆ ತುಂಬಾ ಬ್ಲಾಕೇಜಸ್ ಇರೋರಿಗೆ ಪೋಸ್ಟ್ ಪ್ರ್ಯಾಂಡಿಯಲ್ ಇಂಜನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸ್ವಲ್ಪ ಊಟ ಮಾಡಿದ್ರು ಅವ್ರಿಗೆ ಏನೇನೋ ಬರೋಕ್ ಶುರು ಆಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಬ್ಲಾಕೇಜಸ್ ಎಷ್ಟು ಮಟ್ಟಕ್ಕೆ ಇರುತ್ತೆ ಅಂದ್ರೆ, ನಾವು ಸಾಧಾರಣವಾಗಿ ಊಟ ಮಾಡಿದಾಗ ನಮ್ದು ಬ್ಲಡ್ ಸಪ್ಲೈ ಎಲ್ಲ ಡೈರೆಕ್ಟ್ ಆಗೋದು GI ಸಿಸ್ಟಮ್ಗೆ, ಯಾಕಂದ್ರೆ ಅದು ಡೈಜೆಷನ್ಗೆ ಬೇಕಾಗೋದು. ಸೊ ಆ ಸ್ವಲ್ಪ ಸ್ಟೀಲಿಂಗ್ ಆಫ್ ಫಿಸಿಯೋಲಾಜಿಕಲ್ ಬ್ಲಡ್ ಟು ದ ಡೈಜೆಷನ್ ಹೋದ್ರೂ ಕೂಡ ಆ ಹಾರ್ಟಿಗೆ ಅಷ್ಟು ಮಟ್ಟಿಗೆ ಬ್ಲಡ್ ಸಪ್ಲೈ ಆಗೋದಿಲ್ಲ. ಸೊ ಪೋಸ್ಟ್ ಪ್ರ್ಯಾಂಡಿಯಲ್ ಇಂಜೈನ, ಜಾ ಪೇನ್, ಯಾವತ್ತೂ ಇಲ್ಲದೇ ಇರೋ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಸಡನ್ ಆಗಿ ಬಂದಿರೋರಿಗೆ ಅದನ್ನೆಲ್ಲ ಯು ಹ್ಯಾವ್ ಆಲ್ ವಾರ್ನಿಂಗ್ ಸಿಗ್ನಲ್ಸ್. ಅಂಡ್ ಹೆಂಗಸರಿಗೆ ಏನೂ ಪೇನ್ ಇಲ್ದಲೆ ಸ್ವಲ್ಪ ಜಸ್ಟ್ ಸುಸ್ತು ಅಂತ ಹೇಳೋರ್ಗೂ ಕೂಡ ಇಟ್ ಮೇ ಬಿ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್. ಎಸ್ಪೆಷಲಿ ಡಯಾಬಿಟಿಕ್ಸ್ಗೆ ನ್ಯೂರೋಪತಿ ಇರೋ ಕಾರಣಕ್ಕೆ, ಆಟೋನಾಮಿಕ್ ನ್ಯೂರೋಪತಿ ಇರೋ ಕಾರಣಕ್ಕೆ ದೇ ಕ್ಯಾನ್ ಹ್ಯಾವ್ ಸೈಲೆಂಟ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್. ಸೊ ದೇರ್ ಓನ್ಲಿ ಸಿಂಪ್ಟಮ್ ಮೇ ಬಿ ಉಸಿರಾಟಕ್ಕೆ ತೊಂದರೆ ಬರ್ಬೋದು. ಸೊ ದೇ ಮೇ ನಾಟ್ ಹ್ಯಾವ್ ಪೇನ್ ಅಟ್ ಆಲ್. ಓನ್ಲಿ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್, ಎಲ್ಲ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ಸ್ಗೂ ಪೇನ್ ಇರಬೇಕು ಅಂತ ಇರೋದಿಲ್ಲ. ಜಸ್ಟ್ ಚೆಸ್ಟ್ ಆಕ್ಚುಲಿ ಯಾರು ಪೇನ್ ಅಂತ ಬರೋದಿಲ್ಲ, ಚೆಸ್ಟ್ ಟೈಟ್ನೆಸ್ ಅಂತ ಹೇಳ್ತಾರೆ. ನಾವು ಹೇಳ್ಕೊಡ್ಬೇಕಾದ್ರು ಅಷ್ಟೇ, ಇದನ್ನ ಲಿವೈನ್ ಸೈನ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಕೈ ಹಿಂಗ್ ಹಿಡ್ಕೊಂಡು ಹೀಗೆ ಹಿಡ್ಕೊಂಡ್ರೆ ಲಿವೈನ್ ಸೈನ್ ಅಂತ, ಮೋಸ್ಟ್ ಲೈಕ್ಲಿ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್. ಈ ರೀತಿ ಪೇನ್ ಬರ್ತಿತ್ತು ಅಂದ್ರೆ ಇಲ್ಲ ಏನ್ ತೊಂದರೆ ಇಲ್ಲ ಹೋಗಿ ಅಂತ ನಾವು ಹಾಸ್ಪಿಟಲ್ ಡೈರೆಕ್ಟ್ ಕಳಿಸ್ಬಿಡ್ತೀವಿ. ವಿ ಡೋಂಟ್ ಸ್ಪೆಂಡ್ ಮಚ್ ಟೈಮ್ ವಿತ್ ದಟ್ ಪೇಷಂಟ್ ಬಿಕಾಸ್ ಲೋಕಲ್ ಪೇನ್ಸ್ ಎಲ್ಲ ಯೂಶಲಿ ಬೋನ್ ಅವ್ರ ರಿಬ್ ರಿಲೇಟೆಡ್ ಪೇನ್ ಇರುತ್ತೆ. ಡಿಫ್ಯೂಸ್ ಪೇನ್ ಎಲ್ಲ ಯೂಶಲಿ ಯು ಶುಡ್ ಟೇಕ್ ಇಟ್ ಮೋರ್ ಇಂಟು ಕನ್ಸಂಟ್ರೇಷನ್. ಎನಿ ಪೇಷಂಟ್ ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್ ಆಫ್ ಡಯಾಬಿಟಿಸ್ ಇದೆ, ಶುಗರ್ ಇದೆ, ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಇದೆ ಅಂದ್ರೆ ಯು ಹ್ಯಾವ್ ಟು ಗಿವ್ ವಾರ್ನಿಂಗ್ ಸಿಗ್ನಲ್ಸ್. ಸೊ ಬೇಸಿಕ್ ಟೆಸ್ಟ್, ನಿಮ್ಗೆ ಡೌಟ್ ಇದ್ರೆ ECG ಮಾಡಿಸಿ. ಫಸ್ಟ್ ECG ನಾರ್ಮಲ್ ಇದ್ರೆ ವೇಟ್ ಮಾಡಿ 2 hours, ಇನ್ನೊಂದು ECG ಮಾಡಿಸಿ. ಅದು ಓಕೆ ಇದ್ರೆ ಯು ಕ್ಯಾನ್ ಗೋ ಹೋಮ್ ಅಂಡ್ ಕಮ್ ಫಾರ್ ಅ ರೆಗ್ಯುಲರ್ ಚೆಕ್ಅಪ್ ಟು ದ ಕಾರ್ಡಿಯಾಲಜಿಸ್ಟ್. ವೇರ್ ಇದೊಂದೇ ಟೆಸ್ಟ್ ಇರೋದು ದೇಹದಲ್ಲಿ ಮುಂಚಿತ ಪಿಕಪ್ ಮಾಡೋದಕ್ಕೆ ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯೋ ಇಲ್ವೋ ಅಂತ. ಎಕೋ ಅಲ್ಲ, ECG ಅಲ್ಲ, ಅದು ಟ್ರೆಡ್ಮಿಲ್ ಟೆಸ್ಟ್, TMT ಅಂತ ಹೇಳ್ತೇವೆ. ಓಕೆ, TMT ಏನ್ ಬೇಸಿಕ್ ಪ್ರೊಸೆಸ್ ಅಂದ್ರೆ ಹೃದಯ ಓಡಿಸುತ್ತೆ. ಬೇಸಿಕಲಿ ಟ್ರೆಡ್ಮಿಲ್ ನೀವೆಲ್ಲ ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡಿರ್ಬೋದು ಜಿಮ್ಸ್ ಅಲ್ಲೆಲ್ಲ. ಹೃದಯನ ಓಡಿಸಿ ಅದೇ ಟೈಮ್ಗೆ ಅದ್ರದ್ದು ECG ಹೇಗೆ ರಿಫ್ಲೆಕ್ಟ್ ಆಗುತ್ತೆ ಅಂತ ಚೆಕ್ ಮಾಡೋದು. TMT ಇಲ್ಲಿವರೆಗೆ ಇರೋದ್ರಲ್ಲಿ ಒಂದೇ ಟೆಸ್ಟ್, ಮುಂಚಿತ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಲ್ವ ಅಂತ ಪಿಕಪ್ ಮಾಡುವಂತ ಟೆಸ್ಟ್. ನೀವು ಎಕೋ ಮಾಡಿದ್ರೆ ನಾರ್ಮಲ್ ಇರುತ್ತೆ, ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗೋವರೆಗೂ ಪೇಷಂಟ್ಗೆಲ್ಲ ನಾರ್ಮಲ್ ಇರುತ್ತೆ. ECG ಕೂಡ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗೋವರೆಗೂ ನಾರ್ಮಲ್ ಇರುತ್ತೆ. ಪೇಷಂಟ್ ಬಂದು ಹೇಳ್ತಾರೆ ಬೆಳಗ್ಗೆ ತಾನೇ ಚೆಕ್ಅಪ್ ಮಾಡಿಸ್ತೆ, ನೈಟ್ ಈವ್ನಿಂಗ್ ಬಂದು TMT ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಬಂದಿರ್ತಾರೆ. ಅದರಲ್ಲಿ TMT ಕೆಲವರು ಮಾಡಿರೋದಿಲ್ಲ, ಕಾಲು ನೋವಿರುತ್ತೆ, ಇಲ್ಲಂದ್ರೆ ಓಡಕ್ ಆಗೋದಿಲ್ಲ ಅಂತ. ಸೊ ಬೇಸಿಕ್ ಟೆಸ್ಟ್ ಟು ಡಿಟೆಕ್ಟ್ early heart disease is treadmill test. 90% ಸೆನ್ಸಿಟಿವಿಟಿ ಇರುತ್ತೆ. ಇನ್ 10% ಅಲ್ಲಿ ಅದು ಫಾಲ್ಸ್ ನೆಗೆಟಿವ್ ಬರೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಆ ತರ ಕೇಸ್ಗಳಲ್ಲಿ ವಿ ಜಸ್ಟ್ ಗೋ ಬೈ ಸಿಂಪ್ಟಮ್ಸ್ ಆಫ್ ದ ಪೇಷಂಟ್. ಡಿಫ್ರೆಂಟ್ ಸಿಂಪ್ಟಮ್ಸ್ ನೋಡ್ತೀವಿ, ನಮ್ಗೆ ಅದು ಎಂಜೈನಾ ಅಂತ ಅನ್ಸಿದ್ರೆ ನಾವು ಯಾವ ಟೆಸ್ಟ್ ಕೇಳೋದಿಲ್ಲ, ಡೈರೆಕ್ಟ್ ಎಂಜಿಯೋಗ್ರಾಮ್ ಇಲ್ಲ CT ಎಂಜಿಯೋಗ್ರಾಮ್ ಹೇಳ್ತೇವೆ. So I hope that answers your question. And regarding why that neural supply affects abdomen, throat pain, left arm pain, I think the panelists can answer that.
Radiating pain.
ಸರ್ ಈಗ ಇದು ಕ್ವಶನ್, ಯೋಗ ಅಭ್ಯಾಸ ಕಾಲ ಅಂತ ಯಾರೋ ಕೇಳಿದ್ರು, ಬೆಟರ್ ಟೈಮ್ ಟು ಪರ್ಫಾರ್ಮ್ ಯೋಗ. ಯಾವ್ದೋ ಕ್ವಶನ್, ಯೋಗ ಅಭ್ಯಾಸ ಕಾಲ.
ಯೋಗ ಸಾಮಾನ್ಯವಾಗಿ ಎಲ್ಲರೂ ಯಾವಾಗ ಮಾಡ್ಬೇಕು ಅನ್ಕೊಂಡಿದ್ದೀರಾ? ಮಾರ್ನಿಂಗ್. ವಾಟ್ ಟೈಮ್ ಮಾರ್ನಿಂಗ್ ಅಂದಾಗ? ಕೆಲವರು 8 ಗಂಟೆಗೆ ಎದ್ದೊಳ್ತೀವಿ, ಕೆಲವರು 10ಕ್ಕೆ, ಕೆಲವರು 6ಕ್ಕೆ, 4ಕ್ಕೆ ಎದ್ದೊಳ್ತಾರೆ. ಸೊ ನಿಮಗೆ ಯಾವಾಗ ಚೆನ್ನಾಗಿ ನಿದ್ದೆ ಆಗಿ ಎಸ್ ಯು ಆರ್ ಫೀಲಿಂಗ್ ಗುಡ್, ಆಗ ರಿಲ್ಯಾಕ್ಸ್ ಪೊಸಿಷನ್ ಅಲ್ಲಿ ಎದ್ದು ನೀವು ಮಾಡ್ಬೋದು. ಇಂಥದ್ದೇ ನಿಯಮಿತ ಸಮಯ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಇಲ್ಲ. ಬಟ್ ಆಕ್ಚುಲಿ ಬೆಳಗ್ಗೆ ಎದ್ದಾಗ ನಾವು ಬ್ರಾಹ್ಮಿ ಮುಹೂರ್ತ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ, ಹಾಫ್ ಅನ್ ಅವರ್ ಬಿಫೋರ್ ದ ಸನ್ ರೈಸ್, ನಾವು ಆಗ ಅಭ್ಯಾಸವನ್ನ ಮಾಡಿದ್ರೆ ದೇಹದಲ್ಲಿ ಆಗುವಂತ ಬದಲಾವಣೆಗಳು, ಪರಿವರ್ತನೆಗಳನ್ನೇ ಬೇರೆ ಆಗತ್ತೆ. ಆಕ್ಚುಲಿ ಎಫೆಕ್ಟ್ ನಮ್ ಏನ್ ಹೇಳ್ತೀವಿ ಎಫಿಕಸಿ ಆಫ್ ಯೋಗ ಅನ್ನೋದು ನಿಮ್ಗೆ ಪರಿಪೂರ್ಣವಾಗಿ ಸಿಗ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಅರ್ಲಿ ಮಾರ್ನಿಂಗ್ ಆಫ್ಟರ್ ಯುವರ್ ಸ್ಲೀಪ್, ಇದನ್ನ ನೀವು ಆಫ್ಟರ್ ಯು ವೇಕಪ್ ಇದನ್ನ ಮಾಡ್ಕೊಂಡ್ರೆ ಬಹಳನೇ ಉತ್ತಮ ಅಂತ ಹೇಳ್ತೀವಿ.
Next question. We will give prize to best question.
Good evening, everyone. Like my question is, we have this static and dynamic 2 types of yoga, right? For betterment of heart health, for prevention of any heart disease, which kind of yoga will be more useful? Whether static or
ಸ್ಟ್ಯಾಟಿಕ್ ಅಂಡ್ ಡೈನಮಿಕ್ ಅಂತ ಹೇಳಿ ಯೋಗಾಭ್ಯಾಸ ಎಲ್ಲೂ ಕ್ಲಾಸಿಫಿಕೇಶನ್ಸ್ ಇಲ್ಲ. ಸ್ಥಿರಂ ಸುಖಂ ಆಸನಂ ಅಂತ ಹೇಳ್ತೀವಿ. ಸ್ಥಿರವಾಗಿ ಸುಖವಾಗಿ ಮಾಡುವುದೇ ಆಸನ. ದ ಪೊಸಿಷನ್ ವೆನ್ ಯು ಆರ್ ಸಿಟ್ಟಿಂಗ್ ಲೈಕ್ ದಿಸ್ ಇನ್ ಎ ಕರೆಕ್ಟ್ ಪೊಸಿಷನ್, ಬ್ಯಾಕು ಎಲ್ಲನೇ ಆರಾಮಾಗಿದ್ದು ಖುಷಿಯಾಗಿ, ನಾನು ಏನೂ ಆಯಾಸ ಇಲ್ಲದೆ ಸಮಾಧಾನವಾಗಿ ಈ ಪೊಸಿಷನ್ ಅಲ್ಲಿ ಇದೀವಿ. ದಿಸ್ ಪೊಸಿಷನ್ ಇಸ್ ಕಾಲ್ಡ್ ಅಸ್ ಯೋಗಾಸನ ಪೊಸಿಷನ್. ಸೊ ಹೀಗೆ ನಾವು ಆಸನ ಮಾಡುವಾಗ ಎನಿ ಡಿಸೀಸ್ ಕಂಡೀಷನ್, ಅಥವಾ ನೀವು ಕುತ್ಕೋಬಹುದು, ಎನಿ ಡಿಸೀಸ್ ಕಂಡೀಷನ್, ಅಥವಾ ಯಾರು ನಾವು ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಲೈಕ್ ನಾನ್ ಕಮ್ಯುನಿಕೇಬಲ್ ಡಿಸೀಸಸ್ ಯಾವುದೇ ಆಗಿರ್ಬೋದು, ಲಾಂಗ್ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಡಿಸೀಸಸ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಲೈಫ್ ಸ್ಟೈಲ್ ಡಿಸಾರ್ಡರ್ಸ್ ಆಗಿರ್ಬೋದು, ಎಲ್ಲದ್ರಲ್ಲೂ ಆಗಿರ್ಬೋದು. ಯೋಗದ ಬೆನಿಫಿಟ್ ನಿಮಗೆ ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಸ್ಲೋ ಅಂಡ್ ಸ್ಟಡಿ ಆಗಿರ್ಬೇಕು. ಅದನ್ನ ನೀವು ಅರ್ಥ ಮಾಡ್ಕೊಂಡು ಆ ಬ್ರೆತ್ ಒಳಗಡೆ ಇದ್ದು ನೀವು ಆ ಪೊಸಿಷನ್ ನ ರಿಟೈನ್ ಮಾಡ್ಕೊಂಡು ಅದನ್ನ ಅವೇರ್ನೆಸ್, ನಿಮ್ಗೆ ಅದು ಗೊತ್ತಿದ್ದು ನೀವು ಆ ಜ್ಞಾನದಲ್ಲಿ ಇದ್ದು ನೀವು ಅದನ್ನ ಮಾಡ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಅದರ ಬೆನಿಫಿಟ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಆಲ್ವೇಸ್ ನಾವು ಡೈನಮಿಕ್ ಯೋಗನ ಯಾರಿಗೂ ಅಡ್ವೈಸ್ ಮಾಡೋದಿಲ್ಲ ಡಿಸೀಸ್ ಕಂಡೀಷನ್ ಅಲ್ಲಿ. ಸ್ಲೋ ಅಂಡ್ ಸ್ಟಡಿ ಯೋಗ ಇಸ್ ಆಲ್ವೇಸ್ ವಿತ್ ಬ್ರೆತ್ ಅಂಡ್ ಅವೇರ್ನೆಸ್. ಈ 3 ಇರ್ಬೇಕು, ಫಿಸಿಕಲಿ ಅಂಡ್ ಬ್ರೆತ್ ಅಂಡ್ ಅವೇರ್ನೆಸ್. ಈ 3 ಇದ್ರೆ ಮಾತ್ರನೇ ಯೋಗಕ್ಕೆ ಅರ್ಥ ಸಿಗತ್ತೆ. ಇಲ್ಲಾಂದ್ರೆ ನೀವು ಮಾಡ್ತಾ ಇರೋದು ಜಸ್ಟ್ ಫಿಸಿಕಲ್ ಫಾರ್ಮ್ ಆಫ್ ಎಕ್ಸಸೈಸ್ ಅಂತ ಹೇಳ್ಬೋದು. ಸೊ ಡೈನಮಿಕ್ ಯೋಗ, ಸ್ಟ್ಯಾಟಿಕ್ ಯೋಗ ಅಂತ ಹೇಳಿ ಕ್ಲಾಸಿಫಿಕೇಶನ್ಸ್ ನಿಮಗೆ ಯಾವುದೇ ಒಂದು ಏನಂತ ಹೇಳ್ತೀವಿ ಪೇಟೆಂಟ್ ಟೆಕ್ಸ್ಟ್ ಅಥವಾ ನಮ್ಮ ಇದರಲ್ಲಿ ಟೆಕ್ಸ್ಟ್ ಅಲ್ಲಿ ಎಲ್ಲೂ ನಿಮಗೆ ಆತರ ಸಿಗೋದಿಲ್ಲ. ಇದೆಲ್ಲ ಮಾಡರ್ನ್ ಫಾರ್ಮ್ ಆಫ್ ಅಲ್ಲಿ ಡಿಫ್ರೆಂಟ್ ವೇರಿಯೇಷನ್ಸ್, ಮಾಡಿಫಿಕೇಶನ್ಸ್ ಮಾಡ್ಕೊಂಡು ಅವರವರ ಒಂದು ಏನಂತ ಹೇಳ್ತೀವಿ ಅವರ ಒಂದು ಎಫೆಕ್ಟ್ಸ್ ನ ಜಾಸ್ತಿ ಮಾಡೋದಕ್ಕೋಸ್ಕರ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಬಟ್ ಆಲ್ವೇಸ್ ಡೈನಮಿಕ್ ಯೋಗ ಇಸ್ ನಾಟ್ ಗಿವನ್ ಆರ್ ಸಜೆಸ್ಟೆಡ್, ಅಥವಾ ಅದನ್ನ ನಾವು ಯಾವತ್ತೂ ಅಡ್ವೈಸ್ ಮಾಡೋದಿಲ್ಲ ಯಾವುದೇ ಪೇಷಂಟ್ ಕಂಡೀಷನ್ ಅಲ್ಲಿ. Even pranayama should be slow.
Sir, ನಿಮಗೆ ಸರ್, ಸ್ಕೋಪ್ ಆಫ್ ರಿಸರ್ಚ್ ಇನ್ ದಿ ಫೀಲ್ಡ್ ಆಫ್ ಯೋಗ ಈ ಸ್ಪೆಷಲ್ ರೆಫರೆನ್ಸ್ ಟು ಕಾರ್ಡಿಯೋ ಯೋಗ. ಯಾರು ಬರ್ದಿದ್ದು ಗೊತ್ತಿಲ್ಲ, ಬಂದಿದೆ. ಮುರುಘಸರಾಜರೇ ಕೊಡ್ಬೇಕಂತ ಅನ್ಸುತ್ತೆ.
Scope is very vast because since morning we listened the risk factors which are responsible for heart disease, starting from hypertension, diabetes, smoking, alcohol, hyperlipidemia, and whatnot. And also we listened to Madam said about the non-modifiable factors. So all these can be modified with the practice of yoga. So yoga therapy has come into practice since the 1970. He brought into their first, the most research work is done on the yoga therapy by the cardiology itself. The founder one from UK, Dr. Narayandas from Harvard School of Medicine, and Satyananda Swami from Haridwar, and Santa Cruz, Bombay Yoga Institute. It is already completed 100 years, and Kaivalya Dhamma School, and Luna School of Yoga, Beer School of Yoga,
all these institutions have practiced yoga for the purpose of therapeutics. Yoga is basically philosophy of mind. It's called as Manodarshana. But the benefits have been experienced by a lot of our ancestors. Dr. T.T. Krishnamachar, as we was writing about the Swami Paramahamsa Ananda, he stopped 16.8 seconds of heartbeats, the practice of Kumbhaka, Puraka, Kumbhaka, Rechaka. We are going to practice in pranayama. So now, why these yoga postures are beneficial? Because yoga postures are designed according to our anatomy and physiology of the body. One thing, the physiological benefits have been identified by the practitioners. So this is one, the scope is possible. And the Digasana and Shavasana, Yoga Nidra are found beneficial in that. How a yoga therapy benefits at the first stage, psychic stage, and then psychosomatic stage, and then somatic stage, and organic stage. So in this way, this is a very what you call a complex phenomena of answering. So this can be understood by studying the stress and its management through yoga by Dr. K. N. Rupa, the former BHU Vice Chancellor. He has identified the neurohumoral transmission, how the basic heart function is impaired by our activity, and how is it restored by practice of yoga.
This is question for Ajay Murthy, sir. In our Samhitas, Acharyas have told MI due to Abhigata. That is Samanya Nidana. Some of the PG students have asked this question. I don't know. Can you explain it?
So the question itself should be asked in this manner. In Trimarmiya Chikitsa Sthana and Trimarmiya Siddhisthana, what they mentioned is when Abhigata takes place, either internal Abhigata or external Abhigata, Hrudroga can take place. MI is going to take place by this Abhigata. That type of words have not been told in Ayurveda. So Hrudroga can occur by this Abhigata they mentioned. So nahi basti kinchit asti marma paripalanam. So basti is the best line of treatment, but we should not close our ears to the modern technology. We should do the thorough investigation from the cardiologist, whether there is an emergency or not, we should see. And if the type of emergency is not there, we can manage that with our Hrudbasti, Hrudyanurasa, Shrungvasva, sublingual manner, and by Arjuna Kshirapaka and Basti mechanisms.
Okay. One more question. It is for
1 minute. As sir pointed out, is Marma Bigata. Vana Prakopa will be there. All of you study. I know this is the Krishna Devachari. That's why I will tell about this. With the help of pranayama, spectra pranayama, the Vana Vikruta, Hridaya Gata, or Hridaya complications can be restored along with the medications and the procedure what sir has told.
Nitalakshmi madam, somebody has asked this question. I don't know why they have asked it. Your name is written here. Your experience on yoga life.
Your experience.
Hello. My personal experience.
So they have asked.
Okay. About 6 months back. I have a car. I usually sit at the left side with the front seat next to the driver's seat. So suddenly one day I developed a pain here. So I was 3-4 days continuously it was paining. Then I consulted an orthopedic doctor. He said some muscles sprain. Then I consulted a physiotherapist. Then he said, he advised some exercises. He said supraspinatus tendon bursitis. Then, I asked him one question. See, I'm disciple of Paramahamsa Yogananda. I practice Kriya Yoga. And in our practice, there are 4 steps there. First step is the energizing exercises. Second is some Hansa meditation. Third is Om meditation. Then Kriya Yoga. So every day I practice, and every day that set of exercises is called energization exercises. So I practice. It is a set of about 32 exercises. It is very simple exercises. Only basic thing is, I can't tell you the detail because we have taken the plate there. So anyway, I will tell you brief. So only thing is, we have the principle is, we have to absorb the cosmic energy. See, cosmic energy is surrounding us. So we have to absorb the cosmic energy through our Bhrumadhya, forehead, that is Agna Chakra, and send it to the place where there is pain. So daily I used to do, it takes about 20 to 25 minutes every day. Every day, since so many years I am doing. So I asked him why that, in spite of doing those exercises. Then he asked me what you are doing, what exactly exercises doing. Because I'm not supposed to reveal the actual. Then he advised me some 2-3 more exercises. That disappeared. Then he said, who has designed these exercises? He must be a PhD in yoga therapy. I said it is Paramahamsa Yogananda and his guru Swami Yukteswarji. Since then we are doing. Then I asked why I got that thing. I said, see, whenever I used to sit in the, as soon as I enter the car and sit in the front seat, I used to keep my right hand like this. That automatically it had become a very bad habit. So this posture. So then with the difficulty, I had to get over that habit, and then the pain totally disappeared. So it is a bad habit or a wrong habit. It's not bad. It is a wrong habit. Unknowingly, which I was doing, I used to get. So with that, then when I started some other yoga exercises also, and was totally relieved of that. That's one thing. Another thing, about 2-3 years back, I had suddenly I had developed this spine with pain in the back. So I went to Rishikesh, the Himalayan hospital. They did all the MRI and all. They said that they had to undergo the surgery, spinal disc. I said no. And then they advised me another set of a few exercises, yoga exercises. I did that and I was totally relieved that. And now when I go to our Jolly Grant Himalayan Hospital of Swami Rama, they are surprised, Madam, without any surgery, you are so active and so well. Like that. This is my personal experience with yoga. And with Ayurveda also, I had some experience. Shall I tell? Long back, must be about 30 to 40 years back, when I was working as a professor in Bangalore Medical College. Myself and Ayurvedic College principal, Panchakshama. She stays near my house in Bangalore, Jayanagar. So we used to travel in the same bus. I used to get on in BMC, she used to get on in Ayurvedic College. And once I developed sudden pain in the small joints. So when I showed that to our allopathy doctor, they said rheumatoid arthritis, typical rheumatoid arthritis, all small joint swelling. Then I asked her, because we used to travel together, then she prescribed some Ayurvedic glue and other things. And all. About 3 months I took the medicines regularly and totally disappeared. Now I don't have any arthritis. That's my personal experience of it. yoga and Ayurveda.
Harish Babu sir, one more question. Somebody has given. Whether do you have any standard module or are you recommending any module? That is especially they have asked about asana, pranayama and dhyana. Which is specific asana, which is specific pranayama, which is in cardiac ailment. Cardiac ailment. Any modules are there in Government of India? That's right.
See, Government of India or Government of Karnataka, we have not given specific modules for specific ailments. But different schools of yoga have followed different modules, and in my personal experience, SVESA has developed some of the modules for different ailments, for cardiac and for us bronchial disorders or arthritis and other ailments. So that has, we have seen good results with those kind of practices. Little bit of asanas and more of pranayama and more of relaxation techniques, especially in cardiac rehabilitation conditions. You don't need to do, as our expert cardiologist was telling, based on the severity of the disease and the kind of treatment they had undergone, we need to prescribe them. So immediately after surgery, you don't need to, you should not be prescribing the physical activities. You should take them more into the relaxation techniques like the Shavasana or Yoga Nidra or instant deep and quick relaxation techniques and Nadi Shodhana Pranayama. So one interesting thing I want to share with you. Last time, 3-4 years back, in Mysore itself, there was one conference, yoga conference, which happened. And one of the researchers was sharing their experience. It was told there that they did the research. By doing 18 minutes of Nadi Shodhana Pranayama, or more, 18 minutes and more of Nadi Shodhana Pranayama, giving optimal results in case of cardiac health. So that was very interesting outcome, because usually in yogic practices, how many times you need to do, what is the time duration, many other things. So that is one thing which strike. So 18 minutes of Nadi Shodhana Pranayama brings cardiac coherence. So which brings the balance in the sympathetic parasympathetic activities. So that was one of the very interesting thing. And as I was telling, so based on the severity and based on the duration and their health conditions, so you should apply your this one. There is nothing like in modern medicine. So if you have fever here in India or fever in America, you give certain prescribed formats. But in our Ayush systems, there is nothing called there is nothing called standard operating procedures. So of course, now the standard operating procedures are coming for Ayurveda, homeopathy and other systems. But in case of yoga, I would suggest based on the person's health condition and their well-being, you should make a decision of how much of asana need to be prescribed or how much of pranayama or meditation need to be prescribed. I think I'm clear with that.
Sir, this is for
Point I'd like to add that if Nadi Shodhana is just watching your own breath, is it? Left Anuloma Viloma. But regarding that watching your own breath, that there is a scientific explanation. Long back, I think in about 1985 or 90, I had read an article in Nature. One cardiologist had done the experimental research analysis. So he had advised the patient to have only observe his own breath. See what happened here, given the explanation also. When once you observe your own breath, slowly, the number of breaths comes down. And when that lungs are relaxed, heart also reflexively relaxes. So the heart rate also comes down. So probably cardiac health.
Sir, sir, this is for you. What is your experience? Because you are doing cardio yoga research. What is your experience? Can you share your experience here?
ಯೋಗ ಬೇಸ್ಡ್ ಕಾರ್ಡಿಯಾಕ್ ರಿಹಬಿಲಿಟೇಷನ್ ಇನ್ ಹಾರ್ಟ್ ಫೇಲ್ಯೂರ್ ಮತ್ತೆ ಮಯೋಕಾರ್ಡಿಯಲ್ ಇನ್ಫಾರ್ಕ್ಷನ್ ಅಲ್ಲಿ ಸ್ಟಡೀಸ್ ಮಾಡಿದೀವಿ. ಬಟ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಇಲ್ಲಿ ಯೋಗ ಸ್ಟಡೀಸ್ ಎಲ್ಲ ಸ್ಮಾಲ್ ಸ್ಯಾಂಪಲ್ ಸೈಜ್ ಮತ್ತೆ ಲಾಂಗ್ ಟರ್ಮ್ ಫಾಲೋಅಪ್ಸ್ ಇಲ್ಲ. ಸೊ ಅದರಿಂದ ಏನಾಗ್ತದೆ ಅಂದ್ರೆ ನಾವು ಎಕ್ಸ್ಟ್ರಾಪೊಲೇಟ್ ಮಾಡಕ್ ಆಗೋದಿಲ್ಲ ಜನರಲ್ ಪಾಪ್ಯುಲೇಷನ್ಗೆ ಓವರ್ ಆಲ್. ಅದರಿಂದ ಮತ್ತೆ ಇನ್ನೊಂದೇನು ಅಂತಂದ್ರೆ ಇಲ್ಲಿ ಡ್ರಗ್ ಟ್ರಯಲ್ಸ್ ಗಳೆಲ್ಲ ಆದ್ರೆ ಅದಕ್ಕೆ ಅರ್ಧ ಡ್ರಗ್ ಕಂಟ್ರೋಲ್ ಜನರಲ್ ಆಫ್ ಇಂಡಿಯಾ ರೆಗ್ಯುಲೇಟರಿ ಬಾಡೀಸ್ ಇದೆ. ಆಯುಷ್ ಅಲ್ಲಿ ಕಂಪ್ಲೀಟ್ ಫಾರ್ಮ್ ಆಗಿಲ್ಲ ಅನ್ಸುತ್ತೆ. ಮತ್ತೆ ರೂಲ್ಸ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟೀಸ್ ಕ್ಲಿಯರ್ ಆಗಿ ಡಿಫೈನ್ ಆಗಿದೆ. ಪಾಲಿಸೀಸ್ ಯೋಗದಲ್ಲಿ ಸ್ಟಡೀಸ್ ಡೆಫಿನೆಟ್ಲಿ ಹೆಲ್ಪ್ ಆಗ್ತಾ ಇದೆ ಯೋಗದಿಂದ. ದೇರ್ ಇಸ್ ನೋ ಡೌಟ್ ಅದರಲ್ಲಿ. ಸೊ ಮಾಡಿಫಿಕೇಶನ್ ಆಫ್ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ಗೆ ಹೆಲ್ಪ್ ಆಗ್ತಾ ಇದೆ. ಅದರಿಂದ ಕಾರ್ಡಿಯಾಕ್ ರಿಹಬಿಲಿಟೇಷನ್ ಇದು ಇಂಪ್ರೂವ್ಮೆಂಟ್ಸ್ ಔಟ್ಕಮ್ಸ್ ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ. ನಾವು ಈಗೇನ್ ಲಾಸ್ಟ್ 2-3 ಸ್ಟಡೀಸ್ ಎಲ್ಲ ನೋಡಿದೀವಿ. ಅದ್ರ ಓನ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಲಿಮಿಟೇಷನ್ಸ್ ಇದೆ ಮತ್ತೆ ಸ್ವಲ್ಪ ಚಾಲೆಂಜ್. ಸೊ ಇದನ್ನ ಸ್ವಲ್ಪ ಇದು ಮಾಡ್ಬೇಕು.
ಸರ್ ಕೇಳಿದ್ರೆ ಕೇಳಿ ಏನಾದ್ರು ಪಾಲಿಸಿ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ನೀವು ಅಥವಾ ಅವರು ಹೇಳಿದ್ರು ಗೈಡ್ಲೈನ್ಸ್ ಏನಾದ್ರು ಇದೆಯಾ ರಿಸರ್ಚ್ ಮಾಡ್ಲಿಕ್ಕೆ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಆಯುಷ್?
Yes. Yes, homeopathy, that's what the standard operating procedures ಅಥವಾ ಗೈಡ್ಲೈನ್ಸ್ ಏನಾಗ್ತಾ ಇದೆ. ಸೊ ಇದರಲ್ಲಿ ಆಯುರ್ವೇದಕ್ಕೆ ಆಲ್ಮೋಸ್ಟ್ ಫಾರ್ಮೇಶನ್ ಆಗಿದೆ ಮತ್ತೆ ಯುನಾನಿನಲ್ಲೂ ಫಾರ್ಮೇಶನ್ ಆಗ್ತಾ ಇದೆ. ಉಳಿದಾಗೆ ಹೋಮಿಯೋಪತಿನಲ್ಲೂ ಆಲ್ಮೋಸ್ಟ್ ದೇ ಆರ್ ಕಮಿಂಗ್ ಥ್ರೂ. ಸೊ ಈ ಯೋಗದಲ್ಲಿ ಮತ್ತೆ ನ್ಯಾಚುರೋಪತಿ ಸಿಸ್ಟಮ್ ನಲ್ಲಿ ಸ್ಟಿಲ್ ಇಟ್ ಇಸ್ ಯೆಟ್ ಟು ಬಿ ಫಾರ್ಮ್ಡ್. ಅದಕ್ಕೆ ಒಂದು ಅಪೆಕ್ಸ್ ಬಾಡಿ ಆಗ್ಬೇಕು. ಅದ್ರ ಜೊತೆಗೆ ಈ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಆಪರೇಟಿಂಗ್ ಪ್ರೊಸೀಜರ್ಸ್ ಏನಿದಾವೆ ಅವು ಆಗ್ಬೇಕಾಗಿರುವಂಥದ್ದು ಅಥವಾ ಬೇರೆ ಇನ್ನು ಪಾಲಿಸಿ ಡಿಸಿಷನ್ಸ್ ಅಲ್ಲಿ ಲಾಟ್ ಆಫ್ ಥಿಂಗ್ಸ್ ನೀಡ್ ಟು ಬಿ ಡನ್. ಐ ಥಿಂಕ್ ಸೆಂಟ್ರಲ್ ಗವರ್ಮೆಂಟ್ ಅಲ್ಲಿ ಅದರದ್ದು ಒಂದು ಇದರಲ್ಲಿ ಪರ್ವ್ಯೂ ನಲ್ಲಿ ನಡೀತಾ ಇದೆ ಆಕ್ಟಿವಿಟೀಸ್.
ರವಿಶಂಕರ್ ಸರ್, Ravisankar is from National Institute, Jamnagar.
I am interacting with the regulating agencies frequently. This aspect was pointed out. CCRS published Ayush GCP. Ayush GCP, that's mainly meant for Ayurveda. To some extent, it can be applied to Unani also. Ayurveda Siddha, they have got clear-cut guidelines. They have published it. Yoga, you can't stitch one shirt and fit it to everybody. So, convent or modern medicine, whatever guidelines are there, they are mainly based on the expertise gained in the modern systems. The approach in Ayurveda is different. The approach in Unani is different. The approach in yoga is further away from this guidelines. So we need specific guidelines for each of the discipline. So now taking into consideration the basic concept of Ayurveda, so they have come, they have formed a draft policy, but it is going to be refined because the fundamental requirement, Prakriti assessment itself is not, we do not have a gold standard, just like we have gold standard for almost all diagnostic this thing. And similarly, terminology varies. So now, recent advances, some of you might have read, paper ಅಲ್ಲಿ ಬಂದಿತ್ತು ಯಾರು WHO ಇವರು ಡೈರೆಕ್ಟರ್ ಜನರಲ್ ಮತ್ತೆ ನಮ್ಮ ಆಯುಷ್ ಸೆಕ್ರೆಟರಿ ಅವರು ದೇ ಹ್ಯಾವ್ ಎಂಟರ್ಡ್ ಇಂಟು ಮೆಮೊರಾಂಡಮ್ ಆಫ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್. ಈಗ ಡಿಸೀಸ್ ಗೈಡ್ಲೈನ್ಸ್ ಗೆ ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಮತ್ತೆ ಎಕ್ಸಾಕ್ಟ್ ಇಂಟರ್ಪ್ರಿಟೇಷನ್ ಗೆ ವಿ ಹ್ಯಾವ್ ಗಾಟ್ ICD 10-11 now for modern diseases. Similarly, Chinese Director General was there in WHO. She pushed Chinese medicine. So and China was giving a lot of money. Though I'm some little political, it is true. So because of her persistence, they have developed ICD 11 TCM1, but that contained only Chinese medicine related aspects. So they have equated many terms, modern terms with Chinese terms. Now, because of the persistence of our Ayush secretary, Dr. Vaidya Rajesh Koteja, so they have agreed and they have released a draft about ICD guideline 11 TCM2. So I hope someday we'll have ICD guideline, for yoga separately. I think for that, our experts have to, provide a draft, and they have to insist. WHO, after insisting for nearly 20-30 years, they have given guidelines for Ayurveda and Chinese. And yoga, I think yoga is even more widespread followers throughout the world. So it requires, separate guidelines for research, separate guidelines for what you call as primordial, primary, and tertiary education.
Sir, one more question for you, sir.
I just would like to add from my point of view, being a follower of allopathic form of medicine, when we diagnose something, when we treat something, everything is evidence-based. So these studies would have been done in close to say 10,000, 15,000 patients and would have been followed up for 5 or 10 year in Western data. So that is the data we draw and the conclusions we draw, and we extrapolate it to our patient in the form of treatment. We know yoga works, but we have no hard endpoints to tell the Western media or the Western people to accept our form of medicine without hard evidence-based data. And when you have to make evidence-based data, you cannot go with a frame of mind that yoga is going to work. It should be a tested hypothesis whether it is going to work. If you go with the mindset of doing a research saying this is going to work, then we are fallacious even at the beginning of the study. You have to subject a patient with yoga and without yoga and see the hard endpoints and publish the data as it is to form the acceptance or not. And this data, if you're doing it at a cross-sectional point, will be of no use. It has to be a prospective data. It has to go on for a few years, and that requires funding. And that requires a lot of positive people as well as research framework of people in particular health centers. And it has to be done at a multicentric North India, South India, East India, West India, tribal, rural, urban, for it to become important, relevant, and accepted.
One more point. Regarding this, this point has come up in Ayurvedic sector also. So to conduct prospective studies is definitely important. Now they have categorized evidence into different categories. So highest level category, if you want to have this systemic reviews and meta-analysis, and also pharmacoepidemiology studies are required. That's why they have come up with translational medicine. So to gain that, what we have suggested is to create a database. How to create database? Each of you who are practicing yoga, you can have now. You are very well versed with this handling all your Microsoft based instruments. You can have one app which is created by some experts. You go on adding where you have a standard protocol for diagnosing and treatment, and gather data. When you gather data in a large scale, suppose there are 1,000 yoga practitioners in our city or in our country. If just imagine if we can gather data from 100,000 people every year, it will comes to around 1 lakh. So similarly, during COVID-19 in Ayurveda, we have got I think more than data from 2 lakh people. It is being analyzed. It is taking more than a year to analyze that data. So having a standard guideline is most important. Gathering data at every level, prospective study. Retrospective is a bit difficult because we have not created any dependable database. So database creation is required. For that you need to have medical recording system. I think they have a medical record system here, and almost all top institutes in Ayurveda sector also have got medical recording system. And as per the new policy decision, it's a must for all the colleges. So we should not leave that to the important institution. Each one of you, each of the yoga practitioners, please record all your experiences, because experience of each and every practitioner will be different. So when we gather, say hundreds of data for particular type of management, so that can be subjected to appropriate analysis. So what they call as big data analysis has come in a big way now. So big data analysis based on artificial intelligence and latest mathematical models is very good. So that will give you, precise indication what are and indexes for us to, formulate a proper guidance.
Okay, thank you all, because we cannot move further. Now it is time for felicitation. So we have to felicitate Ravi Shankar sir. So I request Anjali Murthy sir to felicitate Ravi Shankar sir, our panel member. Ravi Shankar sir is one of the faculty from National Institute, that is Ayurveda Institute, Jamnagar. He was director for SDM Ayurveda Research Center, Udupi. And today now he is a consultant for Sri Sri Ayurveda Research and Rashtrottana Hospital. So it's a great opportunity to interact with you, sir. So I request Indalakshmi Madam and Anjali Murthy to felicitate Ravi Shankar sir. And now it is time to felicitate Anjali Murthy sir. Anjali Murthy sir. Anjali Murthy sir was the former director, joint director of Department of Ayush, and he is director of Family Ayurvedic College, and now he is consultant for many Ayurveda institutions. So it is time to felicitate Dr. Bhavya, please. So many of the panel members already felicitated. So we wanted to give one Ayurveda book to all panel members. I request Renuka to give one book to all panel members. No, 1 minute, one minute, vote of thanks. Sir, eldrigu. So today we had cardio yoga poster competition. The judges are Anish Babu sir, Bhavya madam, Rajesh sir, and Anjali Murthy. So they have given the judgment. Hamsa Bedi, please come. Tanya. Hamsa Bedi, Tanya, Ankita, and Zoya Kanu. Zoya Kanu. Sir, I request Anjali Murthy sir to give the today this conference we have many helping hands. One of the helping hand is Youth for Seva, the coordinator of Youth for Seva, Deepak. I request Deepak to collect one memento from us. Deepak, please come. I request Anish Babu sir to hand over memento to Youth for Seva. They have given 10 volunteers for today's program. And the special postal card release and stamp release was done by Kirti madam. She is the faculty from Vidyavardhaka College. She is English teaching faculty, assistant professor, and you have heard her MC, beautiful MC. Kirti madam, I request Harish Babu sir to give comment to Kirti madam. So now it is time for vote of thanks.
Vidya Brahmananam Shreshtam. Vidya or knowledge is considered as one of the means of nourishment, that is nourishment to our mind. So through this panel discussion, our resource persons have tried to quench our thirst for knowledge by feeding it through their valuable inputs, and that has led to the enrichment of our knowledge. So for the same, I would like to call Dr. Darshini to convey the vote of thanks.
Before that, today the Chaya Devi students have done the yoga dance. So I request the principal of Chaya Devi to collect the mementos on behalf of Cardio Yoga Summit. I request Harish Babu sir to give this memento to Chaya Devi Principal Anthony Parvaz. Yoga dance. 15 students are there. Certificate of
Namaste all. Here we came to the last part of this session, that is vote of thanks. It gives me an immense pleasure to deliver a vote of thanks to all the dignitaries on the dais. I would like to express my heartfelt gratitude to each and every one of you for being a part of this wonderful event. First and foremost, I would like to extend our sincere thanks to Dr. Sita Lakshmi ma'am, former Director of Medical Education, Government of Karnataka. Thank you, ma'am, for enriching our knowledge. And next, I would like to thank Dr. Anjaneya Murthy sir, former Director of Department of Ayush, Government of Karnataka. Thank you, sir. Next, Dr. Ravi Shankar sir, Senior Researcher, IPGTRA, Jamnagar. Thank you, sir. Dr. Devraju sir, Senior Researcher and Head of the Department, Jaideva Institute of Cardiology. Thank you, sir. Dr. Veena ma'am, Senior Cardiologist, Jaideva Institute of Cardiology, Mysore. Thank you. Dr. Harish Babu, Deputy Director of Yoga. Thank you. And I would like to thank Dr. Lakshmi Narayan Shane sir, who has made this event possible. Thank you. Once again, thank you all for being here.